Good morning again. If some delegates are in the room and they are not in the member state seat, we kindly ask you to sit in where the nameplate is so we can count again. We need 3 more member states to start. We have the 22 members needed to start, so we will start the session, Madam President. Thank you.
Muy buenos días para.
Good morning, everyone. I hope everyone has been able to rest. We're going to pick up where we left off on 4.8, strategies on integrated emergency, critical, and operative care, 2025-2030. We continue with our discussion. There are 3 non-state actors who had requested the floor. So we give the floor to the World Federation of.
Buenos días. Gracias, señor.
Good morning, Madam President. The World Association of Anesthesiologists Associations backs a strategy on integrated emergency, critical, and operative care 2025-2030 as an essential step toward strengthening health systems and improving the results of patients in the Americas as doctors who are with patients during their whole treatment period. Anesthesiologists play a very important role in the management of critical emergency and pre-op operations. This is a critical part of the integrated effort to offer care. Without sound and effective anesthesiologists or anesthesiology services, we do urge to prioritize the hiring of anesthesiologists. It's essential for us to make sure that all medical centers have access to doctors, providers of anesthesia. This means not only increasing training, but also ongoing training and professional development to stay abreast of changes in the field. 2, to incorporate anesthesia in the planning for health. It needs to be built into policies as well as national budgets. This would make it possible to make sure that there be sufficient personnel, equipment, and budget for that, and to include anesthesiologists in the design of and leadership of critical emergency services. We need to play a leadership role in coming up with protocols, health policies related to this strategy. The National Association of Anesthesiologists play a key role, offering a guidance and their experience in the provision of these services. In investing and strengthening in anesthesiology services, we can contribute to this strategy, ensuring that we have integrated and effective and safe care. Our organization and our national members will be working with PAHO and member states to offer critical support. Thank you.
Muchas gracias a la Federación.
I thank you. Now I give the floor to the International Hospice and Palliative Care Association.
D, advocates for safe accessibility, affordability, and availability of essential generic opioids for the medical and scientific purposes as required by the Single Convention on Narcotic Drugs. International Narcotics Control Board data on opioid consumption reports that the U.S. and Canada consume 82% of opioids in the region. This data reveals severe underuse for medical purposes in less wealthy countries in the region. Enhancing the accessibility, quality, and safety of integrated emergency, critical, and operative care entails improving national stockpiles of essential opioids through public procurement of medications such as morphine in both pediatric and adult formulations. Health systems experienced critical shortages and stockouts of these medicines during the COVID-19 pandemic. Studies of health system barriers to regional opioid availability report pharmacy stock deficits, suboptimal supply chain and inventory management, inadequate market sources for generics, lack of public policy supporting the provision of palliative care, lack of professional education in opioid prescription and monitoring, and unduly restrictive regulations at all levels of governance. The IAHPC can support member state strategy implementation through evidence-based education and multi-stakeholder task forces supporting safe supply chain management. Thank you.
Muchas gracias.
I thank the International Association of Hospice Palliative Care. I offer the floor now to Dr. Fitzgerald for him to respond to the comments.
Much, Madam President. Good morning to you. Good morning, Dr. Barbosa. Good morning, delegates. I really want to thank all the member states for their comments on this important strategy on integrated emergency, critical and operative care. I think this policy document, the strategy, should be considered within the overarching framework of the SDG 3.8 and particularly our target relating to 3.8.1, which really urges us all to move towards universal access to health and universal health coverage as measured by the Services Coverage Index. We've seen that the region has advanced over the past 20 years in ensuring effective coverage in terms of services, particularly in areas such as communicable diseases, maternal child health, having some work to do in the area of NCDs. However, we also note that in recent reports in 2021, there has been a level of stagnation in terms of the Service Coverage Index. And so as countries are really making significant investments in health sector transformation, principally based on primary health care, they are also allocating sufficient and important resources to strengthening the first level of care. But we know also from many studies in the region, that as you increase the capacity of the first level of care, you will also be increasing the needs at secondary and tertiary care, requiring also significant investment in specialized care. And so the strategy on emergency and critical operative care should be seen within an overarching approach to ensure integration in the organization of health service delivery and to ensure the organization of integrated care. And so the word integrated strategy is the integrated emergency, critical and operative strategy is really important in that respect. As such, we know comments from Honduras, Paraguay, and Brazil on the importance of really structuring this within an overarching policy to organize health services organization within the region. I think the second point that's important to make really relates to unmet needs. We heard from the delegate from Ecuador about how this strategy really addresses an issue relating to unmet needs in access to health services. Prior to the pandemic, studies we carried out in 9 countries indicated that approximately 34% of the population was reporting unmet needs. This increased significantly to about 43% in 2021 at the height of the pandemic. This due to significant barriers to access to comprehensive and integrated health service delivery. We saw also within the pandemic that as of April 2021, many countries reached a breaking point in terms of the hospital occupancy rate, which was measured at approximately an 80% threshold of occupancy. And this really specifically related to availability and use of intensive care units. This situation prevailed for many months during the pandemic, and at the same time we had significant disruptions in the provision of essential health services, with countries at that time reporting 84% disruption. And so despite the enormous investments that countries have made in specialized care, in emergency and critical care, there is still further need for further investment in these specialized services so that not only we can provide access to comprehensive service at this level, but also we can ensure the degree of resiliency that we require within our health systems to be able to address any future international public health emergency. Another issue relating to this is an issue that we're seeing in all our countries still, relation to backlogs and waiting lists, that the capacity within the system is not there as of yet. And so as countries are struggling to program essential surgeries and moving towards the management of capacities and demand, significant investments, capital investments, infrastructure and technology are still being required to address those backlogs and waiting lists as we move forward. We heard from Jamaica on the important efforts that Jamaica is making on the evaluation of emergency critical operative care services in this regard, and we know that many other countries are implementing specific strategies to address the actual backlogs. A quick comment on resource allocations, the resources in terms of equipment, technology. We just heard on the challenges in terms of access to medicines and technologies, but also health financing. This is resource intensive, and as we continue to invest heavily in primary health care, and particularly in the first level of care where the majority of health needs can be addressed, it will require significant allocation of resources also to increase specialised care services and in particular emergency care. However, as we do so, we would also urge you to maintain the principles of financial protection, particularly at the point of services, where we generate and we allocate and we pool resources in a manner that is efficient and both equitable. And in terms of efficiency, the deployment of digital technologies that we heard yesterday is so important, is also particularly important as we organise and structure our specialised services at this level. We also heard finally from Colombia on a very important issue, which is the health workforce issue. The required professions and competencies for emergency and critical operative care are vast and broad, and we really urge all member states to continue to develop workforce policies, workforce plans that addresses the necessary competencies in specialised care services that will be required to address this. And also in terms of emergency care, we note that urgent care can be delivered during emergency transport or in an emergency unit, an intensive care unit, either by technicians, nurses or specialised services. So it's the collective competencies that we need to be looking at and the organisation of those competencies in interprofessional teams that need to be addressed. And one final call being made, I think it was Brazil that made it yesterday actually, relating to the protection of the health workforce in emergency care, a really important issue relating to workforce safety solutions. We heard from a number of countries requesting support, Madam President, and we will follow up with you in discussing technical cooperation needs and the implementation of this strategy. Thank you very much.
Muchas gracias, doctor.
Thank you very much, Dr. Fitzgerald, for answering the questions. Mr. Director, would you like to make any remarks? Thank you. I will be brief. I had to step out yesterday to attend another event, so I didn't hear the full discussion. This was an invitation to visit USAID and talk about the topic of an event related to America's Health Corps initiative, which is focused on strengthening human resources in the region. So I did think it was important on behalf of the member states of FAHO for me to be there and to foster that good relationship with USAID. A private foundation, Johnson & Johnson, was also there, so that was an opportunity to strengthen that partnership. So I would like to thank Ecuador. This was Ecuador's proposal, following up on a parallel side event that we had at the WHA in 2021, if I'm not mistaken. And what strikes me is that this relates to a topic that sometimes is not a part of our discussions here at the Directing Council, which is the issue of operative care, emergency critical and operative care. When we speak of strengthening primary health care, fortunately in our region, we've already made strides as far as offering access to primary care in the region. But this is actually something that should be built in, integrated with the other levels of the healthcare system. Even with a strengthened primary healthcare system, that can actually lead to a streamlining of demand. Those who need surgical care, for example, can receive that care more swiftly than if there is a unmet demand and no real place for that demand to be met. If you have 10 different levels you have to go through. Now, as James Fitzgerald called our attention to the matter of integrated or comprehensive health care services, in which other levels of care should also be integrated such that we can broaden access and reduce wait times, lines, which is a problem that all healthcare systems in the world face, given the demographics, given how hard it is to meet all of the health needs, given a pent-up demand left over from the pandemic. So I think this goes a long way toward strengthening our ability to offer technical assistance on this topic. It's very important. I'm very grateful for all the comments that member states made, and we share in the challenges that you face in your countries and the initiatives that are being implemented by way of addressing that demand. Thank you very much, Dr. Barbosa, for your remarks. Now I would ask the rapporteur to present the proposed resolution. Thank you, Madam President. Proposed resolution, Strategy on Integrated Emergency, Critical and Operative Care 2025-2030. The 61st Directing Council, PP1. Having reviewed the Strategy on Integrated Emergency, Critical and Operative Care 2025-2030 document CD61/11, PP2, recognizing the vital role of integrated emergency, critical, and operative care in providing comprehensive responses to a wide range of health emergencies, from acute medical conditions to complex surgical interventions. PP3, acknowledging the disparities in access to IECO care across the region of the Americas and the urgent need to expand these services in underserved areas, thereby ensuring the right of all individuals to timely and effective health care. PP4, aware of the need to strengthen health system resilience in response to natural disasters, pandemics, and non-communicable diseases. PP5, understanding the importance of strategically enhancing IECO care through the design and organization of these services within integrated health service delivery networks, through the adoption of digital health technologies for improved coordination, comprehensive training for healthcare professionals, and the implementation of quality and safety standards in all settings. PP6, emphasizing the need for IECO services to be provided as an integral part of the primary healthcare approach, which fosters seamless patient referrals across different levels of care, placing patients at the center of all coordinated healthcare continuum, spanning primary, specialized, emergency, and critical and operative care. Resolves OP1, to approve the Strategy of Integrated Emergency, Critical and Operative Care 2025-2030, document CD61/11. OP2, to urge all member states, considering their contexts, needs, vulnerabilities, and priorities, to A, implement the strategic lines of action contained in the Strategy on Integrated Emergency, Critical, and Operative Care 2025-2030, document CD61/11. B, improve the design and enhance the integration of emergency, critical, and operative care across health service networks to ensure a seamless continuum from pre-hospital settings, including primary care and medical transport, to hospital care, thereby supporting universal access to IECO services with financial protection for the population. C, invest in the infrastructure of health care facilities to support operational efficiency and safety and IECO care, ensuring continuous access to essential utilities and technologies, and adopt digital clinical decision support systems to optimize patient triage, waiting lists, and management of critical care resources. D, utilize evidence-based tools and integrate clinical guidelines into local protocols to standardize care across different health care settings, thereby improving patient outcomes and care quality while actively engaging patients and communities in their health care journey. E, adopt measures to ensure the protection of health workers in IECO care and prioritize the continuous education and training of healthcare professionals across all levels of care, incorporating new information and communication technologies, telehealth, online education, and learning networks to enhance response capacity and quality of performance. To request the Director to provide technical cooperation to Member States to strengthen capacities that contribute to the implementation of the strategy and the achievement of its strategic lines of action. B, promote collaboration among Member States in relation to the strategy on IECO care. C, report periodically to the governing bodies of the Pan American Health Organization on the progress made and challenges faced in the implementation of the strategy through a midterm review in 2028 and a final report in 2031. Thank you. Thank you, Madam Rapporteur, for presenting this draft or proposed resolution. I'll open the floor for discussion on this proposed resolution.
Cedo la palabra.
I give the floor to Guatemala. Thank you very much, Madam President. Within the context of Strategy and Integrated Emergency Critical and Operative Care 2025-2030, I would like to talk about the reality of our country. Nearly 80% of expenditures at the third level of care in Guatemala are focused on the management of these urgencies. This is a huge pressure on the resources of our healthcare system, which makes us seek out more comprehensive and sustainable solutions beyond the healthcare system. Now, it's not just at the primary level, but at the tertiary level to ensure access to quality medical inputs and quality as well. This is where PAHO's revolving fund and the Central American Comisca access to medication system are key to ensure the joint and efficient procurement of inputs. Now, improving health infrastructure and the timely supply of resources would enable us to optimize the provision of specialized surgery care. Our commitment is to strengthen coordination across the levels of care, setting up integrated networks that can properly respond to needs, especially to strengthen the role of care centers, 24-hour urgent cares as a primary level of health, which are essential in a health emergency, and to bring them ever closer to the population, to set up communication and transportation means among providers, authorities, and communities. Also, the need to reduce traffic accidents, which are a large number, responsible for a large number of emergency needs in hospitals, Guatemala, as well as other countries with scarce public transportation services, face many challenges in this area. We need more support from cities and other state agents to foster a culture of road safety and prevention. In addition to enhancing public transportation infrastructure, we enjoy the support of PAHO to continue going down this path, working closely with all the different actors involved to ensure we have a more accessible and safer healthcare system. Thank you. Guatemala. For your remarks. There not being any change in the resolution, I deem it approved.
Continuamos con el siguiente punto, el punto.
The next item, 4.9, strategies on epidemic intelligence for strengthening early warning of health emergencies 2024-2029. I would like to bring document CD 61/12 to the attention of the Council, and I invite Dr. Ciro Ugarte, Director of the Department of Health Emergencies of the Pan American Sanitary Bureau, to come to the head table. I grant the floor to the representative of the Executive Committee to report on this item. Thank you very much, Madam President. The Executive Committee welcomed the proposed strategy, noting that the COVID-19 pandemic had stressed or laid bare the importance of strengthening academic intelligence capacity in the region in order to strengthen early warning systems and ensure that health authorities will be able to detect, verify, investigate, evaluate public health threats, and mount timely responses that will prevent outbreaks and epidemics from becoming devastating pandemics. Delegates applauded the proposed approach to epidemic intelligence, which combines information from multiple sources, including not only indicator-based surveillance, but also event-based and community-based surveillance. At the same time, they underscored several challenges, including the prevalence of misinformation and disinformation. Several delegates emphasized the need to ensure the integration and interoperability of systems and tools to enhance epidemic intelligence. The importance of a collaborative, multidisciplinary One Health approach was underscored, as well as the importance of sharing experiences and best practices in order to strengthen epidemic intelligence capacities. Countries were encouraged to prioritize implementation of the strategy at the national level and to allocate sufficient financial and human resources for that purpose. The Executive Committee adopted Resolution CE 174R8, recommending that the Directing Council approve the strategy on epidemic intelligence for strengthening early warning of health emergencies for the period 2024-2029. Thank you, Madam President. This concludes my report on this item. Thank you, Madam Representative of the Executive Committee, for that report. I offer the floor now to Dr. Ugarte to present this item.
Madam President of the 61st Directing Council, Director, distinguished member states, delegates, colleagues, I'm glad to introduce the agenda item 4.9, Strategy on Epidemic Intelligence and Health Emergencies 2024-2029, document CD 61/12. Recalling the consequences of the COVID-19 pandemic and the need to apply the lessons learned, a new strategy is being proposed aimed at strengthening early warning systems through enhanced epidemic intelligence capacities. This proposed strategy requires expanding our data sources for prompt detection, considering, for example, genomic surveillance and community source information, effectively managing large volumes of information, and accelerating risk assessment and verification of signals and events to facilitate swift responses. Moreover, it calls for innovative approaches tailored to our national, regional, and local contexts, including small island development states. This is a member state-driven initiative, initially proposed by Brazil and further supported by PAHO member states. We are working closely with member states to advance these efforts, actively engaging with their ideas across all subregions. This entails leveraging regional efforts across technical capacities to implement epidemic intelligence, such as those mobilized by the Regional Genomic Surveillance Strategy for Epidemic and Pandemic Preparedness and Response. I would like to especially thank all of our member states for their participation in the 4th regional and 3 sub-regional consultation meetings. Their participation highlights our joint commitment to understand and integrate all perspectives in this strategy. Our objective is clear: to empower member states and therefore the region with solid epidemic intelligence capacities for the early warning of health emergencies. And to achieve this, we are focusing on 4 strategic lines of action with a One Health approach. Our region, through the adoption and implementation of this resolution, will be better equipped to face potential epidemic situations, thereby increasing the health sector's resilience to emergencies. These efforts will also contribute to other regional and global initiatives to achieve the highest possible level of health and well-being of the peoples of the Americas. We thank you for your consideration of this strategy and the proposed resolution. Thank you, Madam President.
Thank you, Dr. Ugarte, for presenting this report. I now invite the Directing Council to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution presented in Annex A. I open the floor to the plenary to start the discussion of this document. The discussion on the resolution will take place once the rapporteur has read the proposed resolution. I wanted to remind you that statements need to be limited to 2 minutes, and that today I do have a buzzer, so I can remind you if you pass that 2-minute limit. Thank you. I give the floor to Costa Rica. Good morning. This proposal focuses on dealing with a need, a challenge in our countries. This is something for Costa Rica and the entire region. And because of the interconnection we have, this will serve us well. This strategy provides a comprehensive approach to current challenges, like a lack of intersectoral coordination and the need to modernize our surveillance and early warning systems. This strategy is brought in keeping with the need to strengthen our basic capacities that we have so that we can comply with the RCI. We have to favor the One Health approach, and although the mention talks about the technological needs, especially in terms of data management and data analysis, there is no clear roadmap to achieve the interoperability amongst different surveillance systems. It would be good for the digital team to come up with a list of gradual implementation steps. The strategy points to the importance of following up on progress using clear indicators and presenting reports so that we could look at early warning systems with indicators needed to measure success. And in that way, the countries can align in keeping with their existing technology and assets. Thank you, Costa Rica. I give the floor to Jamaica.
Thank you, Madam President. The Jamaica's surveillance system matured over the last 5 decades, supported by legislations and policies, to a robust traditional system of which we are proud. We continue to strengthen our surveillance capacity to ensure we detect, assess the risk, report, and respond. In this regard, we are developing an electronic notification system, strengthening the event-based surveillance system, and the use of data from various sources for the triangulation of data. Jamaica, in principle, supports the resolution and the strategic lines of action. However, the information presented for Strategic Line of Action 4 are subject to interpretation, we believe. We recommend that in the further development of the plan of action, that strategic line of action be more clearly enunciated and shared with member states to foster transparency and trust. We recommend that the following phrase be inserted in paragraph number 29 on the strategic line of action 4 in the first sentence so that it would read as follows. The Bureau and member states should work together to build a strong regional trust architecture within the framework of the international health regulations. This is to promote transparency and enhance information sharing for assessing risk and responding to public health events and emergencies. Additionally, we recommend that PAHO support strengthening of in-country capacity, particularly for epidemic intelligence. Jamaica will actively participate in the strategy on epidemic intelligence for strengthening of early warning systems of health emergencies in the region. Thank you.
Thank you, Jamaica. I recognize the United States of America.
The United States thanks PAHO for developing the strategy on epidemic intelligence for strengthening early warning of health emergencies 2024 to 2029 and supports the proposed resolution and the need to share information. The United States is committed to strengthening detection and pandemic prevention, preparedness, and response domestically in the Americas region and globally. Diseases with epidemic and pandemic potential such as influenza, dengue, cholera, emerging respiratory viruses, and yellow fever present a shared threat across the Americas. Our experience through the COVID-19 pandemic, Zika and Mpox outbreaks, highly pathogenic avian influenza outbreaks, and other health emergencies globally have made clear the need to strengthen epidemic intelligence for early warning of health emergencies to improve preparedness, response, and overall resilience in the region. The amended International Health Regulations 2005 are crucial in preventing disease outbreaks by mandating governments to report outbreaks early with transparent data and information sharing and develop the necessary capabilities to detect, prepare for, and respond to outbreaks before they spread globally. The U.S. IHR National Focal Point actively promotes international cooperation through regional and bilateral exchanges with other NFPs within the PAHO region, enhancing epidemic intelligence and enabling timely detection and response to health threats through open communication, sharing best practices, and supporting capacity building. We thank PAHO for their leadership in the development of this strategy. We are proud of the constructive approach that the Americas region has taken to strengthen capacity and collaboration both in global discussions and within the region. The United States is committed to sharing knowledge and best practices to enhance the region's collective preparedness and response, along with supporting global initiatives and frameworks that promote coordinated efforts to prevent, detect, and respond to public health threats, safeguarding the health of our populations across the Americas and beyond. Again, the United States welcomes PAHO's increased efforts to support member states and looks forward to receiving progress reports on this strategy. Thank you.
Muchas gracias.
Thank you, United States. I give the floor to Bahamas.
Thank you, Madam President. The Bahamas endorses and supports the 4 strategic lines of action of the Strategy on Epidemic Intelligence for Strengthening Early Warning of Health Emergencies 2024-2029. The changing climate has had a significant impact on the susceptibility of humans, animals, and plants to communicable diseases. Research in climate change reveals that rising temperatures have shortened the reproductive cycles of both mosquitoes and rats, 2 important vectors for communicable disease outbreaks that are found in abundance in tropical climates, including small island developing states. For the Bahamas, this raises a special area of note, as while we have had significant efforts and progress in strengthening the surveillance of conditions and microbes that impact human health, we are lagging behind on the progress in developing sophisticated surveillance systems for animal and plant health. It is anticipated that through the 4 strategic lines of action, there will be opportunities to access technical assistance and to engage subject matter experts to craft strategies that support preventive actions and mitigative work in these areas. While we note the good intent of the 2nd strategic line of action, we remind that it requires that member states stretch already thin budgets to recruit officers that can benefit from these training plans. The 3rd strategic action that forecasts the goal of working toward interconnectivity of health information systems will require funding and technical assistance to identify information systems that appropriately captures data being already collected in a way that matches the algorithms and formulae to guide early warning system alerts and inform management of outbreaks. Overall, the strategy forecasts a sound pathway to improving the availability, access, and reliability of data and information to strengthen the region's mandate of preventing, early detection, and management of disease outbreaks. Thank you.
Muchas gracias, Bahamas.
Thank you, Bahamas. I recognize Cuba. President, our country has taken part in 2 regional meetings sponsored by PAHO last year. And this strategy has a past in terms of resolution. We consider that the strategy of dealing with COVID-19 showed us that we had to use different data sources, and we had to rapidly identify the potential sources of these threats to public health. Our region is characterized by diseases that are a threat to public health, and we agree that we have to set up multidisciplinary teams that are well-trained and that have experience in epidemiological surveillance, also providing them with the technical wherewithal, and that needs to be bought by member states and also sometimes using technical cooperation. The 4 lines of strategic action aim at strengthening the leadership in early warning systems and also providing technical improvements. We consider it important for the countries to collaborate and to work with WHO to promote the trust and transparency in the exchange of information so as to assess risk and respond to events and emergencies. Our country has 93 centers that work with international hubs, and also this can lead to collaboration projects so as to implement the strategy and improve the work done on epidemic intelligence along the 4 strategic action lines. Cuba will always be willing to cooperate and share its experiences so as to strengthen early warning systems in the countries that need them. Thank you. I thank you, Cuba. And with that, I give the floor to the Dominican Republic. Thank you, Madam President. In the Dominican Republic, we are constantly improving our surveillance capabilities so as to be able to provide early warnings in the case of acute events in public health. These would be events that could be a threat to human health. Now, the pandemic showed us that these actions have to come early. They have to use technology so that we can quickly detect infectious diseases as they emerge, especially when the initial number of cases is low. There is really no baseline that allows us to establish diagnoses. We have established partnerships with different international organizations and domestic ones so as to share resources, and we are committed to inform our population about health risks and the necessary public health measures. Our country has a sound surveillance system. It includes surveillance based on indicators and events. We continue to strengthen surveillance based on cooperation with the community, coordination within the community, which is essential for epidemic intelligence. All of this is made possible by using new technologies and building interconnected information systems so that information can be triangulated, and thus we can make better decisions and intervene more effectively to promote both collective and individual health. The Dominican Republic welcomes this strategy on epidemic intelligence for strengthening early warning of health emergencies, and we reiterate our commitment to comply with the obligations laid out in this binding document. Thank you. I thank you, Dominican Republic. I now give the floor to Canada.
Thank you, Madam President. I'm honored to deliver this statement on behalf of Canada's youth delegate, who is unable to due to delayed proceedings. The pandemic demonstrated the importance of epidemic intelligence. As we closely follow the evolving spread of mpox, we are reminded that early warning of health emergencies is critical to implementing effective and life-saving public health interventions. In consultations with young people across Canada, there was a clear call for inclusivity in how we implement epidemic intelligence systems and activities. Youth emphasized the need to overcome cultural barriers, particularly in engaging Indigenous communities, and to ensure data collection methods are culturally safe and respect socioeconomic and cultural contexts of all populations. We cannot overlook the critical role of community-based and local networks, especially those involving young people. NGOs and local organizations already embedded in communities can help bridge gaps in trust, particularly among marginalized groups. Utilizing these networks will not only enhance surveillance, but help disseminate accurate, culturally sensitive information to combat misinformation, especially through social media, a vital tool for reaching youth. Youth also emphasized the importance of collaboration and a strong multi-sectoral approach. Adopting a One Health approach, where health, environmental, and animal sectors share data seamlessly, will ensure early warning systems to detect potential threats from multiple fronts. Canada supports the strategy in its resolution and is committed to working collectively to advance these efforts in a way that is inclusive, collaborative, and forward-thinking. Thank you.
Muchas gracias.
I thank you, Canada. I now give the floor to Honduras. Good morning, everyone. Honduras agrees with the proposed resolution, Strategy on Epidemic Intelligence for Strengthening Early Warning of Health Emergencies 2024-2029, because this strategy will strengthen our national capacity by improving our epidemiological surveillance systems. Honduras, as a priority country, requires technical and financial cooperation from strategic health partners that allow us to move ahead in our strategy on epidemic intelligence so as to favor early warning in terms of health emergencies 2024-2029. An early warning of health emergencies has to cover all phases of response to mitigate and reduce the impact on the population. Thank you. Thank you, Honduras. I now give the floor to Guatemala. Good morning, and thank you, Madam President. Guatemala recognizes that epidemic intelligence is essential. We support this resolution. We have to strengthen the guidelines, have standardized practices to guarantee epidemiological surveillance in Guatemala and the whole region following the One Health approach. Our current surveillance system is not sufficient to quickly detect new infectious diseases or emerging diseases, especially when the number of cases is low. We also acknowledge the need of a legal basis for implementation of epidemiological intelligence in Guatemala and in the region so that this can be comparable and also can be disseminated quickly. Epidemiological intelligence is a determinant. It will be a determinant based on compulsory reporting of events. We need to be able to activate alert levels at the domestic and international levels. Thank you, Guatemala. With that, I give the floor to Guyana.
Thank you very much, Madam Chair. Guyana fully supports the proposed strategy for strengthening early warning of health emergencies from 2024 to 2029 through epidemic intelligence. We have made significant strides in enhancing our intelligence system with a series of proactive measures already in motion. We are currently updating our legislation with the assistance of PAHO, and soon we should be able to pass in Parliament this new legislation. We have completed a joint external evaluation in 2023 where we have identified gaps and we are currently working with the assistance of several partners to address these gaps. We've also successfully developed and finalized a national action plan for health security in 2024, and this would be a 5-year plan. And again, we are collaborating with several partners to implement this. We are right now developing a multi-hazard emergency management plan, and once completed, we would also be implementing this. Guyana is proud that we have been able to put in place an integrated respiratory virus surveillance system at 12 Sentinel sites across the country, with laboratory analysis using multiplex assays to identify known and unknown viruses. And already we've seen the effects of that. We've also been able to complete an assessment of our national reference lab, and we are now awaiting certification to become a national influenza center. We have also implemented epidemic intelligence software, and this now is yielding for us real-time data. We have also had in our national reference lab capacity now to do genetic sequencing, and this too is helping us to understand the various viruses that are circulating within the country. Guyana look forward to collaborating with PAHO over the next upcoming years and also with other partners as we strengthen our system. We fully support this resolution.
Thank you, Guyana. I now give the floor to Mexico. Thank you very much, Madam President. Mexico considers that this strategy is essential to protect the health of our population, and also it gives us the possibility of having a resilient system that is multi-hazard in its approach. It follows the one health approach, This cannot be possible without efficient, sound, early alert and response systems that can save lives and reduce the negative effect of emergencies, including those having to do with physical and mental health, economic losses, social disruption, and environmental damage. Our country has provided training to the 32 Federation units in terms of services and updating the national risk profile. That would be events of natural origin, chemical, anthropogenic events, things that have an impact on the population's health. Since 2017, we have been implementing a bulletin on early alerts for outbreaks of dengue, and that provides entomological, climatological information. We agree with Costa Rica and Jamaica about the comments of strengthening this strategy. Thank you. Thank you, Mexico. And with that, I now give the floor to Chile. I thank you, Madam President. Good morning, everyone. Chile is a country with several threats, both natural and man-made, and depending on their intensity, they can unleash a disaster or a catastrophe. During the COVID-19 pandemic, coordinated work was done within sectors and amongst sectors, involving both public and private systems. And from this broad perspective, information systems were developed using geospatial evidence, geoclinical information, and this was important to deal with that threat and carry out planned activities. This joint effort turned into a successful response to such a broad-based event, the pandemic. And to this, we have to add the experience, the lessons learned with other types of emergency that affect us frequently. That would be the case of landslides, earthquakes, etc. So the Ministry of Health has to develop tools to react to these emergencies. In this way, we can monitor sector actions, the target population, health conditions, etc. For all of these reasons, our country is interested in moving forward with a strategy like the one under discussion today to strengthen our early warning capacity in cases of high alert or health emergencies. Thank you. Thank you, Chile. And with that, I recognize Ecuador. Ecuador welcomes the presentation of this strategy. In a world that is ever more interconnected, threats to public health are always present. The COVID-19 pandemic showed the pressing need to have surveillance systems that were sensitive, that were robust, well-coordinated, so as to identify and effectively respond to health emergencies. And that is why this initiative is going to contribute to strengthening early warning and our response to health emergencies by improving coordination, leadership in epidemiological intelligence, training staff, and also strengthening the technologies to facilitate integration, modernization, and interoperability of surveillance systems. Within this context, Ecuador has strengthened the use of the integrated epidemiological surveillance system so as to improve detection and provide a timely response to outbreaks. Also, we have implemented event-based surveillance so as to look at changes in respiratory viruses, new pathogens, and that has been done using the PAHO flu platform. Also, we have made efforts so that our professionals will receive training regarding IT tools so they can identify emerging challenges. There still are challenges, for example, improving the interoperability of health information systems, also animal health, as well as the environment. And lastly, we would make an appeal. It's important that we strengthen regional collaboration and that we exchange information on epidemiological intelligence following a One Health approach so that the region can anticipate and better respond to health threats. Thank you very much. Thank you, Ecuador. With that, I give the floor to Panama. Thank you, Madam President, and good morning. Panama welcomes this strategy. It aims at improving countries in the Americas' abilities to respond to public health threats, especially diseases that have epidemic potential, and they seriously can affect the health of our populations and become a permanent threat. We took an active part in preparing this strategy, and we are ready to implement it. We used different sources of information to identify early on these threats to both health and the economy. Panama agrees with this approach and feels that the 4 lines of action being proposed are essential: financing the strategy through voluntary contributions or subsidies will facilitate implementation in the region. Epidemiological surveillance of the traditional type has been based on indicators and events, but this strategy introduces new technologies, new analytical strategies for early detection. And in that way, we obtain the necessary information for decision-making. Panama has a roadmap to prepare for its implementation as a national regional priority. We support the contents of the resolution, and we are ready to implement it and strengthen our ability to do epidemiological intelligence to better deal with health emergencies. Thank you. I thank you, Panama, and with that, I give the floor to Brazil.
Thank you very much, Madam President. In an interconnected world, infectious diseases can spread beyond borders quickly, and this calls for an effective and brisk response. And so it's necessary for us to have a system for early detection and warning to avoid pandemics. Brazil would like to commend the Secretariat for preparing this strategy that should be approved. We express our support to the 4 strategic lines of action. The exchange of experiences and technology will make it possible for us to bolster our coordinated efforts to respond to emergencies PAHO can act as a link between among countries, offering technical support and collaborating such that there can be instilled more trust across the region with the exchange of information with full respect to the IHR. We make an appeal to all countries of the region for them to engage further in the implementation of a strategy to prioritize this topic by investing financial and human resources, just as we did at the end of 2023 in the regional meeting on the use of epidemiological information for a timely response. More than 30 countries in attendance. We make ourselves available to continue to promote cooperation in close dialogue with other countries and PAHO. Thank you. Thank you, Brazil. I give the floor to Argentina. Thank you, Madam President, and good morning, everyone. Argentina takes note of the information presented, and we are grateful for it. We thank Brazil for having presented this proposal and the organization for having included many of the comments made by our country in the virtual consultations, which we do see in the document. By way of contribution, we have further comments we'd like to make on the document. We do think it would be important for there to be a bibliography that allows for national technical teams to consult as a reference and to strengthen epidemic intelligence in a comprehensive way, integrating with other ministries, creating inter-ministerial teams to that effect. We think it's key to identify the interoperability of systems. We also understand that the support given by the Bureau to implement the mentioned strategy from the different sectors is also necessary and important. We also think it's right for us to approve this proposed resolution as presented. Thank you. Thank you, Argentina. I give the floor to Barbados.
Good morning, Madam President, distinguished colleagues. Barbados welcomes the strategy on epidemic intelligence for strengthening early warning of health emergencies. The detection of and early response to public health emergencies will continue to challenge existing disease surveillance systems, particularly those that rely on indicator-based surveillance. The COVID-19 pandemic highlighted the importance of monitoring public opinions to improve communications with the public and to identify situations of increased risk. A greater proportion of these emerging diseases are zoonoses, and the implementation of a One Health approach is required. To date, Barbados has commenced training of appropriate personnel in One Health, and we request assistance of the Secretariat to provide additional technical support in this area. Of note, this approach is also used in foodborne disease surveillance and response, and is acknowledged and included in our strategic plan for the management of antimicrobial resistance. Notably, use of indicator-based surveillance is necessary, though challenging for Barbados, as it requires the integration of intersectoral data for shared risk evaluation, which is further hindered by poor data availability. Considering the mandate of the Ministry of Health and Wellness, event-based surveillance for early warning and response is important. However, the existing challenges support the further implementation and sustainability of this type of surveillance. Potential ethical issues and data protection should be taken into consideration. Barbados is in support of the resolution. Thank you so much.
Thank you, Barbados. I give the floor now to the UK.
Thank you, Madam President, and good morning, colleagues. The UK territories would like to thank PAHO for this strategy. Strong systems able to promptly detect and respond to epidemic and pandemic-prone disease threats are essential. We therefore welcome the proposed strategy and its strategic lines of actions. In particular, we are supportive of the One Health approach and focus on involving trained, multidisciplinary teams. The UK territories welcome consideration of specific national contexts, including those of small island developing states in implementing the strategy. In particular, consideration of challenges around workforce training and technical capacity is vital to ensure a comparable implementation of this crucial strategy. Thank you.
Muchas gracias.
I thank the UK. I give the floor to Haiti. Thank you, Madam President. The importance of integrating epidemic intelligence and early warning systems to detect, investigate outbreaks and emerging public health threats is very important for our region, especially to Haiti. It's important for us to quickly ascertain what the emerging threats are, making use of different tools to ascertain what the risks are and to respond accordingly and quickly, and that the system innovates over time to enhance the early warning system in benefit of health. So the system needs to continue improving to bring to bear a response as threats emerge and evolve. We have institutional fragility in Haiti that affects our healthcare system. Haiti endorses the need to enhance the surveillance system and the response to emergencies. It's essential for the public health system, which has been strengthened over the years. This would help to build the local ability to respond to epidemics, taking into account the socioeconomic, environmental factors that are always evolving. This flexible approach is necessary to tackle health challenges, unforeseeable ones. We thank the CDC of the U.S., PAHO, for all the technical financial support that they offer to improve surveillance systems, enabling us to effectively respond to health emergencies. Human resources are necessary at different levels in order to issue these early warnings and to create strategies and, again, to strengthen the financial, human, technical resources available to ensure no one be left behind, to ensure the health of the region. Haiti supports this strategy and the proposed resolution. Thank you, Haiti. I give the floor to Puerto Rico. Thank you, Madam President. We think that this is a timely strategy and a necessary one. Early detection of threats to public health enables us to set into motion quickly public health interventions that can save lives and mitigate the negative fallout of emergencies. The strategy responds to a basic public health need, early detection and timely response to the benefit of communities' health. We staunchly support this strategy. Thank you. Thank you, Puerto Rico. There are two non-state agents who have requested the floor to speak on this item. The International Federation of Associations of Medical Students has the floor. Thank you, Madam President. Delegates, International Federation of Associations of Medical Students supports the strategy. We support the ongoing investment in strengthening public health systems to detect and quickly respond to health events. COVID-19 affected the healthcare systems and societies. And what we have learned from that crisis shows us that we have to further strengthen the international health regulations, calling for a multidisciplinary approach to health emergencies. Given climate change, we run the risk of suffering new pandemics and other climate emergencies, reason for which we need solutions. and early warning systems, enabling us to respond quickly and save as many lives as possible. Make an appeal to governments to establish collaboration between public and private sectors, universities, civil society to develop a comprehensive epidemiological intelligence system that would report on diseases as well as detect and verify and assess emergency risks, and to enhance the exchange of information among member states, to invest in strengthening our preparedness vis-a-vis emergencies such as efficient response plans and sufficient infrastructure to effectively tackle and cope with emergencies, to strengthen our reporting system within our countries, to better detect health emergencies in our countries, especially in far-flung rural areas, and to have the necessary wherewithal to rein in infections such as trained personnel to ensure sufficient protective gear such that we can quickly respond to health emergencies, to adopt a One Health interprofessional approach to address health emergencies in each sector, and that everyone clearly define what their roles are, to avoid loss of life, economic instability. We would remind everyone that as medical students, we are willing to join the efforts of member states to ensure that we have a future that can prevent such crises. I thank the International Federation of Associations of Medical Students, or Students of Medicine. I give the floor to the International Federation of Associations of Pharmaceutical Product Producers.
Thank you very much. This statement is from IFPMA as well as FEPharma. The focus on strengthening regional epidemic intelligence capacity is critical to raise an early warning and respond quickly to health emergencies and for AMR. Our ability to predict, prepare for, and respond to outbreaks, epidemics, and pandemics rests on three principles: robust surveillance, immediate information, and data sharing, and the scientific community's ability to collaborate. We would like to emphasize the importance of the following. A key driver for success will be health system strengthening, including ensuring appropriate technical and professional capacity at the local, national, and regional levels. Surveillance that is representative of a region's epidemiological reality is a prerequisite to the creation of a stable regional structure with long-term financing to ensure a sustainable framework. The One Health approach is vital in effective surveillance and response strategies with cross-sectoral collaboration and partnerships at the national, regional, and global levels. Integrated, agile, and well-resourced surveillance systems are not only a critical building block for a strengthened global health architecture, but enable the research community, including the innovative pharmaceutical industry, to research and develop the necessary medical countermeasures as rapidly as possible. Thank you very much.
Muchas gracias.
I thank the International Federation of Associations of Producers of Pharmaceutical Products for your remark. Now, I offer the floor to Dr. Ugarte for him to respond to the comments.
We took note of the comments and the support of the 20 member states and also the 2 non-state actors that intervened during the session. Also, I would like to acknowledge the very good suggestion of Jamaica, so we will incorporate the reference to the framework of the IHR in paragraph 29 of the document, and will be updated and published promptly. I would like also to acknowledge the suggestion of Argentina. Argentina sobre la sugerencia de hacer.
Regarding the suggestion to translate the bibliography, yes, there is much bibliography in other languages, and it's necessary to translate these bibliographies for member states to be able to reference that bibliography. I would also like to recognize the extraordinary work done on early warning and response to cholera in Haiti. This was a cross-sector effort with the support of many partners over 3 years. Perhaps we don't recall much of this, but during 3 years, Haiti was capable of eliminating cholera. And there was only a reemergence of some cases after the humanitarian and security crisis that Haiti is currently facing. This is an extraordinary effort, and the initiative is specifically tied to early warning and early detection. The initiative in Haiti goes to show that even in the most trying of times, and with intersectoral collaboration and with others, many partners coming together, we can actually bring to fruition something that very few or perhaps no other country was capable of doing. I would also stress one of the points raised by our countries, and that is that it is necessary to detect and to halt outbreaks at their source, and that can only be done through surveillance and epidemiological intelligence. This calls for close collaboration across sectors and among countries. And the key part of this collaboration is that there be trust that our information is being used to rein in these outbreaks, that we are receiving information on time through trustworthy and confidential sources, and that there aren't an economic or social or political use made of this information or misuse. The interoperability of systems is also essential. The suggestion made by Costa Rica regarding including this among the digital health initiatives is a worthwhile one, and this is one of the most significant challenges that many of our countries face. Many of our countries don't have interoperable systems across sectors, and that information that does exist in other sectors isn't always available to health. And this is an internal matter, but it's also something that affects us on a regional level. I'd also like to thank Brazil for presenting this proposal, not just proposing it or presenting it rather, but having actually commenced offering support to put together and to strengthen epidemiological surveillance, early surveillance in the region of the Americas. I urge all countries to follow that example when a topic is proposed, that we actually support it, and that's what Brazil has done. Thank you, Madam President. Thank you, Dr. Ugarte, for responding to comments. Mr. Director, do you have any comments you would like to make? Yes, I would like to thank all of the countries for what I think was a very productive debate, not just today, but throughout the entire process of preparation of this resolution, with contributions from all of the countries. This proposal, which was a suggestion by Brazil originally and then garnered the support of many countries, places our region in a position of leadership on an important topic. When we look at all of the public health emergencies of international importance that we have seen over the last couple of years, the lack of integration, coordination, and analysis of the different aspects of animal, environmental, and human health led us to a situation in which we did not fully avail ourselves of that very small window of opportunity that we have to act quickly. So, beyond just the traditional surveillance system that's based only on events, we have to go beyond that. We have to work with countries. It's an emergency situation. There are many countries in the region already. I was in Paraguay, country of our president, and I took part in a meeting about a project that PAHO and other partners are taking part in, that it was approved, whereby funds would be received from the pandemic fund. And at the same table, we had people from the environmental sector, agriculture, farming, animal and human health, and that's the first step for us to be able to share laboratory data that can be used to undertake a risk analysis and for immediate decision-making. Absent that, the weeks that are lost before all of the necessary coordination of information can actually take place, oftentimes that is exactly the time we needed to have made a more effective response, and that time was lost. And so the experiences that we have already had in many countries of the region that are doing this have laid the foundation, the groundwork, a very sound one, for us to follow through with this strategy of epidemic intelligence, strengthening our early warning and response system for public health problems. Thank you. Thank you, Dr. Barbosa, for your comments. I would ask the rapporteur now to present the proposed resolution. Thank you very much. Proposed resolution, strategy on epidemic intelligence for strengthening early warning of health emergencies 2024-2029. The 61st Directing Council, PP1, having reviewed the strategy on epidemic intelligence for strengthening early warning of health emergencies 2024-2029, document CD61/12, PP2, taking into account the importance of integrating epidemic intelligence operations within a comprehensive early warning mechanism that is capable of promptly and effectively detecting, verifying, investigating, assessing, and responding to public health threats and emergencies. BP3, bearing in mind the experience of the recent COVID-19 pandemic, which highlighted the need for rapid verification of signals of potential public health threats. PP4, recognizing the varying levels of implementation of epidemic intelligence among countries of the region of the Americas and the importance of using different data sources to assess risks, as well as the need for rapid adaptation and continuous innovation to enhance early warning systems for health emergencies. PP5, considering that a key purpose of epidemic intelligence is to detect, verify, and assess public health risks as early as possible in order to mitigate and reduce their impact on populations. PP6, acknowledging as health threats and their drivers change and novel threats emerge, epidemic intelligence must continuously improve in order to ensure early detection and response. Resolves OP1 to approve the strategy on epidemic intelligence for strengthening early warning of health emergencies 2024-2029, document CD61/12. OP2 to urge all member states, considering their national contexts, needs, vulnerabilities, and priorities, and in alignment with the international health regulations, to A, promote the implementation of the strategic lines of action set out in the strategy. B, strengthen technical capacity for conducting epidemic intelligence activities aimed at promptly detecting, verifying, assessing, reporting on, and responding to public health emergencies of national and international concern. C, build capacity and participate in defining best practices based on scientific evidence on epidemic intelligence, fostering coordination and collaboration across various sectors and disciplines, and developing standardized terminology and concepts to enhance comprehension and effectiveness in epidemic intelligence efforts. OP3, to request that the Director provide technical cooperation to member states to strengthen capacities that will contribute to the implementation of the strategy and the achievement of its objectives. B, promote the dissemination of lessons learned and good practices in epidemic intelligence, leveraging the advancements achieved within the region. C, report periodically to the governing bodies of the Pan American Health Organization on the progress made and challenges faced in the implementation of the strategy through a midterm review in 2027 and a final report in 2030. Thank you very much, Madam President. Thank you, Madam Rapporteur, for presenting this draft resolution, proposed resolution. I give the floor now to the plenary. Open the floor. First, a debate on this draft resolution. There not being any objections, I declare that this resolution is approved.
Bueno, vamos a continuar.
Now, the next item. At 10:45, we're going to have a 20-minute recess, actually. Now, well, 4.6, strategies for strengthening the essential public health functions to accelerate health systems transformation 2024-2034. I would like to bring document CD 61/9 to the attention of the Council. I invite Dr. James Fitzgerald, Director of the Department of Health Systems and Services of the Pan American Sanitary Bureau, to come to the head table. And I offer the floor to the representative of the Executive Committee to report on this item. The Executive Committee welcomes the strategy for strengthening the essential public health functions, noting that it would provide a structured and sustainable approach to strengthening health systems. The strategy's emphasis on data, infrastructure, and standards, and on the needs of the public health workforce was also welcomed. In addition to implementing the measures proposed in the strategy, member states were encouraged to work with their ministries of finance to ensure that health policies be prioritized in budgetary planning. It was suggested that the strategy should include measures to address workforce migration and measures to strengthen local and regional capacities to produce strategic public health supplies. The Executive Committee adopted Resolution CE 174R5, recommending that the Directing Council approve the strategy for strengthening the essential public health functions to accelerate health systems transformation for the period 2024-2034. Thank you, Madam President. This concludes my report on this item. Thank you, Madam Representative of the Executive Committee, for that report. I give the floor now to Dr. Fitzgerald for him to present on this item.
The 61st Directing Council, delegates to the Directing Council, Director Dr. Barbosa. The 59th Directing Council of the Pan American Health Organization 2021, in adopting the strategy for building resilient health systems and post-COVID-19 pandemic recovery to sustain and protect public health gains, noted the urgency to adopt a comprehensive approach to primary health care in the Americas through a renewed focus on the essential public health functions. The essential public health functions are those capacities of health authorities at all institutional levels to act with civil society to strengthen health systems and ensure the full exercise of the right to the highest attainable standard in health. By clarifying responsibilities, enabling multi-sectoral collaboration, and ensuring accountability, the essential public health functions support health authorities to effectively lead and coordinate policies and actions that promote health and well-being. Prior to the COVID-19 pandemic, approximately 34% of the population in the Americas reported unmet healthcare needs. This indicator increasing to 45% in 2020. The pandemic impacted health systems, exposing fragmentation and limitations in the capacity of health authorities, both of which hindered effective and equitable pandemic response. Pre-existing social and institutional structural deficiencies and inadequate attention to stewardship and governance have compounded the situation emphasizing the need to prioritize public health action in agendas for health system strengthening. The strategy for strengthening the essential public health functions to accelerate health systems transformation 2025 to 2035, presented here today, proposes 3 strategic lines of action. Firstly, strengthening leadership, stewardship, and governance for primary healthcare-based health systems through implementation of the essential public health functions and collaborative governance at all levels, including at the national, subnational, and local levels. Secondly, strengthening the capacity for the evaluation of the essential public health functions to serve as a basis for improved policy development and decision-making, with plans adopted around a shared public health agenda focusing on population health. And finally, strengthening public health workforce competencies to effectively implement the essential public health functions through effective workforce planning, competency development in public health, and strategies for the recruitment and retention of the public health workforce. Madam President, the Secretariat would like to thank all Member States for their active engagement, participation, and support received during the consultative process for this policy document. It was prepared through technical discussions and meetings with Member States. A virtual consultation was held with Member States in March 2023, with contributions, oral and written, being received from 15 countries. Thank you, Madam President.
Muchas gracias.
Thank you very much, Dr. Fitzgerald, for your report. I now invite the Directing Council to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution presented in Annex A. I open the floor to the plenary to start the discussion of this document. The discussions on the resolution will take place once the rapporteur has read the proposed resolution. I give the floor to Mexico. Thank you very much, Madam President. Mexico is committed to the right to health, and that right cannot be achieved without strengthening the essential public health functions. In many mandates, Member States have made a commitment to strengthen leadership, stewardship, and governance by applying these functions to achieve universal health. In other words, there is no doubt about their importance, but it is important to close the gaps to achieve this purpose. The connection between collective and individual health is a risk for populations, and we have to optimize infrastructure, human resources for health, and any initiative to renew, to strengthen public health and its functions has to rely on greater cooperation to achieve resilience and cooperation. That means that we have to deal with these social health determinants, especially in terms of guaranteeing access within a framework that gives priority to prevention. In Mexico, we're working on implementing a comprehensive intersectoral strategy that is based on rights, and we focus on communities, different areas of the country, understanding that health is maintained outside of institutions. So Mexico reiterates its support and stands willing to contribute in any way possible to the region. Thank you, Mexico. And with that, I recognize Paraguay. Paraguay supports the approval of the strategy for strengthening the essential public health functions to accelerate health systems transformation 2024-2034. To achieve access and universal health coverage, it is important to have strong leadership and effective governance at all levels. Consequently, it is necessary to revamp health systems, emphasizing primary care, emphasizing essential public health functions as part of a basic structure. During COVID-19, we learned how important it is to strengthen these institutional capacities. Now, in this regard, my country recognizes that PAHO's strategy provides a framework for support so that member states can strengthen the essential public health functions at the local, subnational, and national levels, accelerating the transformation of health systems. The strategic lines of action in the document CD 61/9 are aligned with national plans and policies that Paraguay has already been implementing. These plans include the Sustainable Health Agenda for the Americas 2020-2030 and the National Policy on Health Promotion. In this connection, some of the actions envisaged in these policies include strengthening primary health care by having integrated networks and also improving intersectoral and interagency actions to accomplish health determinants. We have solid plans to strengthen the essential public health functions so as to transform our health system to benefit our entire population. Thank you. I thank you, Paraguay, and with that, I give the floor to Honduras. Thank you very much, Madam Chair. Honduras agrees with this proposed resolution, the strategy for strengthening essential public health functions to accelerate health system transformation 2024-2032, because this is especially relevant for our national context. This strategy reasserts the policies of the current health authorities that are restructuring our health system based on a renewed public health strategy with a sustainable approach that goes beyond the current administration and will become a long-term state policy. This year, Honduras is going to join the countries of the region that will have completed the exercise to measure and strengthen their essential public health functions, applying the 3 strategic lines established in this resolution. It is expected that, in cooperating with organized civil society and the international community, this process will lead to a national health authority that is strengthened in its leadership, its stewardship, its effective governance, and these are essential pillars that will enable countries to move towards universal health care and have a more resilient and equitable system. In the Comisca meeting in Tela, Honduras, there was an agreement reached to support Central America and Dominican Republic and to strengthen the exercise and joint operation of essential public health functions in the region. Honduras feels that this strategy provides us with a unique opportunity to strengthen regional cooperation, attract investment, develop resources and strategic partnerships that will allow the creation of innovative solutions in public health. Also, we asked PAHO to give us a space for dialogue amongst member countries and international donors, promoting partnerships that would reinforce the financial and technical sustainability of the efforts already underway. Thank you. I thank you, Honduras. With that, I give the floor to St. Kitts and Nevis.
Good day, Madam President and esteemed colleagues. The Federation of St. Kitts and Nevis embraces this strategy and conceptual framework along with the recommended cyclical policy process. The Federation, in collaboration with PAHO, embarked on this essential public health function evaluation and strengthening exercise in November of 2023. This assessment involved the following steps: determination of the status of each of the essential public health functions in the Federation, identification of the health challenges and gaps, prioritization of these health challenges, and the determination of the mechanisms to strengthen them. During this assessment process, the Ministry of Health hosted 4 stakeholder meetings, and the final report is now complete. This final assessment report is currently being used to develop the next iteration of our National Strategic Plan for Health, 2025-2030. This roadmap will help us strengthen our EPHFs and ensure effectiveness in addressing the public health challenges over the next 5 to 6 years. The government of St. Kitts and Nevis thanks PAHO for providing the technical support in this regard, and St. Kitts and Nevis is in support of this resolution. Thank you.
Muchas gracias.
Thank you, St. Kitts and Nevis. I give the floor to the Dominican Republic. Thank you, Madam President. The Dominican Republic is part of its strategic planning for 2020-2030 is looking at key actions to strengthen the essential public health functions to accelerate health systems transformation. These are things that are part of this strategy under discussion. The idea is to accelerate the transformation of health systems. And as part of our actions, we emphasize strengthening governance of the health system by formulating policies and implementing the national plan for developing the health sector, the national health strategy, and also signing an agreement between the health authorities within the country. And also we have set up a consultative working group looking at primary health care. This was signed by PAHO, the World Bank, and the IDB. In this way, we hope to improve the infrastructure, the quality of care, by implementing strategies that promote healthy habits, like the heart strategy that has been implemented in 100% of the first level care institutes in the Dominican Republic. We welcome this proposed resolution and we're committed to following up on the actions laid out in the strategy, having the technical and financial support of PAHO, and also making efforts to support primary health care to better the health of the population. Thank you. With that, I recognize the United States of America.
Is it on? Yeah. Thank you, Madam President. Estados Unidos quiere agradecer.
The United States would like to thank the Pan American Health Organization for developing the strategy for strengthening the essential public health functions to accelerate health systems transformation, and it supports the resolution contained in this document. We understand the faceted impacts of COVID-19 in the region. The pandemic pointed to opportunities for the region to strengthen its capacities and the performance of its health systems in responding to future threats. Through leadership and thanks to the cooperation of PAHO with member states, we can continue to strengthen the essential health functions to deal with emerging challenges. The United States would like to underscore the key role of this strategy to promote the transformation of health systems, including better governance and greater accountability in the region of the Americas. Also, we appreciate the inclusion of all of the technical changes in the resolution. They were shared in June of 2024 during the meeting of the Executive Committee. The United States calls for redoubling efforts to support member states and hopes to receive progress reports on this strategy. Thank you. I thank the United States. And now we are going to take our break. It will be a 15-minute break, and we return here at 11 or 11:05 to continue with this conversation. Thank you.
Since 2021, the Pan American Health Organization, PAHO, has been implementing the Improved Health of Women and Adolescent Girls in Situations of Vulnerability project in Bolivia, Colombia, Ecuador, Guyana, Honduras, and Peru. With financial support from the Government of Canada, this project addresses some of the most pressing challenges related to the health of women and adolescents.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, The interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
By strengthening the capacities of more than 45,600 people, including healthcare providers, public servants, and community health workers, such as traditional midwives, the project has contributed to strengthening health systems from primary care and expanding access to sexual and reproductive health services in the 6 countries. The project has also supported the creation of about 100 technical guidelines to improve the quality of care and has developed innovative telehealth initiatives to optimize maternal and neonatal health outcomes. Taking a comprehensive approach and promoting gender equality, the project has fostered the empowerment of women and adolescents so they can make informed decisions about their well-being and actively participate in matters related to their sexual and reproductive health rights.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Additionally, considering cultural diversity, the Knowledge Dialogues methodology has been implemented by exchanging perspectives on issues such as teenage pregnancy and gender-based violence, encouraging communities to increasingly attend health centers. The project is carried out in coordination with ministries of health, civil society, and community leaders in the 6 countries, creating spaces for exchange, capacity building, and knowledge transfer. The alliance between the Government of Canada and PAHO is essential to continue efforts to improve the health of women and adolescents in situations of vulnerability. This collaboration aims not only to advance towards the achievement of the Sustainable Development Goals, but also to continue to positively impact the lives of women so that in the near future, all can exercise the sexual and reproductive health rights, leaving no one behind.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary health care system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this just with our team that we have here at National Public Health Lab. It was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So.
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving, yes. Collaboration. Yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal, and I think all of these accomplishments were done as teams, and I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's right to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área da telesaúde. Isso aí, para mim, é como fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Eu sou a Rafaela e eu ouvi dizer que o escritório da OPAS no Brasil está fazendo um monte de coisas legais para cuidar do meio ambiente e eu vim aqui ver de perto.
Oi, eu sou Matias. Será que a OPAS é verde mesmo? Oi, sou Liz, quero trabalhar aqui no futuro.
Oi, bem-vindos à OPAS, crianças!
Nós ainda temos containers maiores que também podem ser usados para papel, para papelão, ou seja, tudo aqui pode ser reciclado.
Tá vendo essas bicicletas aqui? Ó, isso aqui a gente fez para os colegas nossos aqui da OPAS que quiser pedalar, elas ficam aqui disponíveis para todo mundo.
Aqui na OPAS a gente não usa nada descartável, só copos e garrafas reutilizáveis. E olha só que legal, nosso mexedor é de bambu.
Nós também acabamos de instalar uns painéis para captar energia solar.
A OPAS também tem um sistema de irrigação e só uso o necessário.
Oi, Rafa, para finalizar, vou mostrar para vocês os 120 ipês amarelos que nós plantamos e que hoje estão pequenininhas, mas no futuro vão ficar grandes igual aquela lá atrás.
Nós estamos cuidando do planeta também aqui. Estamos cuidando para vocês.
Nosotros como Oficina de País en Nicaragua nos encaminamos a una oficina verde tomando en consideración el consumo de papel para nuestras impresoras. Tenemos una estadística que desde el 2019 fue la última vez que se compraron resmas de papel en una cantidad de 180 resmas. En el 2024 tenemos un saldo de 136 resmas. Eso indica de que solamente se han utilizado 44 resmas en 5 años, a razón de un promedio de 8.8 resmas por año en consumo. Esto también implica, si hay una reducción del consumo de papel, hay una reducción también de tóner para nuestras impresoras. La representación en Nicaragua se unió a la modalidad de trabajo en casa, lo que permitió una reducción de consumo de papelería y tóner en esta oficina. Como organización debemos de ser parte activa de la ecologización de nuestras instalaciones, adoptando políticas ambientalmente sostenibles con prácticas modernas de ahorro de energía, reducción de residuos y reciclaje.
Desde el equipo de OPS en Colombia estamos comprometidos con la sostenibilidad. La sostenibilidad para proteger el medio ambiente y sobre todo para cuidar de la salud de cada uno y cada una de nosotros, los habitantes en este hermoso planeta.
Desde el 2023, la representación en Colombia aplica dentro de la evaluación de eventos competitivos criterios de sostenibilidad.
Solicitamos a nuestros proveedores el uso de empaques biodegradables o de más de un uso, la alimentación saludable y el manejo de residuos al final de los eventos.
Promovemos desde la planificación del evento el uso de la tecnología en vez de la impresión de material. Esto con el fin de ayudar al medio ambiente y a la optimización de los recursos de la organización.
Hemos tenido muy presente la sostenibilidad, no solamente en términos de lo que ha sido toda la construcción para nuestras nuevas oficinas, sino también en cada una de nuestras actividades, pensando en cuáles son los mejores materiales, el poder reducir el uso del papel y, por supuesto, velando por esa salud de cada una y cada uno de los miembros del equipo del OPS en Colombia.
Los interruptores inteligentes nos ayudan a un ahorro más eficiente de la energía. Asimismo, contamos con UPS. Esto nos ayuda a hacer un ahorro entre el 20 y el 30% de nuestro consumo de todos los equipos que tenemos en la oficina.
El compromiso con la sostenibilidad es una tarea de todos. Es por eso que desde OPS Colombia queremos dar ese ejemplo y poder continuar en este trabajo.
Ça, pour nous arriver à tout petit monde, même chance, nous travaillons avec un pile l'hôpital. Pour nous arriver, faire promotion à l'état maternel et soutenir maman qui a été seulement pendant 6 premiers mois de la vie de monde. Comme ça, nous gagnons l'hôpital Tout du Nord qui déjà passé 2 évaluations internes et qu'on y a capté une évaluation externe dans début mois de septembre pour nous arriver certifié comme hôpital ami des bébés. Ça veut dire un hôpital qui est ami des bébés, côté tout personnel là, depuis le directeur pour arriver joindre sécurité dans la barrière, tout le monde met ensemble pour faire toute femme qui est enceinte, qui vient accoucher, connaît que c'était seulement pour bailler pendant 6 premiers mois la ville.
L'initiative Hôpitaux Amis des bébés garantissent que les maternités dispensent des informations et du soutien continu aux mères en respectant aussi les besoins et les rythmes naturels des nouveau-nés.
Ensemble, ces actions contribuent à améliorer la santé et le bien-être des nourrissons en Haïti, offrant à chaque enfant un meilleur départ dans la vie grâce à l'allaitement maternel et contribuent à la réalisation des objectifs de développement durable.
Hoy visitamos esta sala de vacunas Padre Monchi, aquí en Foz de Iguazú, el equipo de evaluación externa, y hemos evaluado y analizado y conversado con los colegas y trabajadores de la salud del sistema del SUS.
La evaluación consiste de varias fases, la primera de las cuales es parte del país, en el cual utiliza un instrumento de autoevaluación, y posteriormente un equipo de expertos viaja al país, visita, conoce la realidad en territorio y de esa forma les permite identificar potenciales oportunidades de mejora, recomendaciones y también fortalezas que deben ser sostenidas a lo largo del tiempo y eventualmente compartidas con otros países de la região para fortalecer las capacidades no solo a nivel nacional, sino a nivel regional.
A avaliação externa voluntária ela vem num momento muito importante para o Brasil. É um momento que o Programa Nacional de Imunizações ele passa por mudanças e reajuste, ele está tendo uma reorganização, uma reestruturação.
Lo importante de las evaluaciones que son un mecanismo que permite al país que la solicita poder tener una idea clara de cuál es su situación actual, no solo desde su propia autoevaluación que el país la hace, sino desde la visión de un evaluador externo, lo cual no solo les permite corregir aquellas situaciones en las cuales se pueden mejorar o confirmar que el camino es el correcto, que la situación está bien llevada adelante, de manera que es un ejercicio en el cual el país tiene todo para ganar.
We saw here a lot of aha moments. People, they have not seen like that with their own eyes. And so bringing these external perspectives and these opportunities for peer learning, it's great because they can actually see things with other eyes, bring fresh perspectives.
Very well. Good morning again. Let us reconvene and continue with the debate, and let me give the floor to Jamaica now.
Madam President, Jamaica continues its partnership with PAHO to strengthen the essential public health functions to accelerate health system transformation. We have identified strategic and high-priority actions focused on closing critical gaps, and we continue to align initiatives with national health plans. Jamaica, in collaboration with PAHO, has since 2019 developed and is implementing our National Strategic Plan, Vision for Health 2030, which has 6 strategic goals that cover safeguarding access to equitable, comprehensive and quality health care, strengthened leadership and governance, improved health financing, ensuring human resources for health in sufficient number and competencies, addressing the social determinants of health, and making reliable and modern infrastructure available for health service delivery. As we implement the strategic actions, Jamaica has sought to introduce significant reforms in the areas of health system strengthening through undertaking primary and secondary healthcare reform, the upgrading and expansion of health infrastructure, the strengthening of laboratory services, the increase in health worker availability at all levels, and the increase in our health expenditure to GDP ratio to 5.1%. That is 1.5 percentage points in 5 years, moving us closer to the recommended target of 6% of GDP. Jamaica notes that work is ongoing in strengthening health policy development and evaluation and improving resource allocation through a result-based approach to advance public health interventions and services. We thank PAHO WHO for their continued unwavering support that is highly appreciated as we advance this journey. Consistent with the 3 lines of actions proposed in strengthening the essential public health functions to accelerate health systems transformation, Jamaica is committed to undertaking these significant reforms relevant to the implementation of public health functions. Therefore, we endorse the strategy and proposed resolution, recognizing its importance in guiding our legislative, strategic, and operational efforts to improve health outcomes for all Jamaicans. Thank you.
Thank you very much, Jamaica. Now I call on Bahamas.
Madam President, the Bahamas views the essential public health functions as crucial to advancing health and well-being for all, and commends the Secretariat's alignment of the 10-year EPHF strategy with the Sustainable Health Agenda. Having been the first country in the Caribbean sub-region to complete all phases of the EPHF assessment with the support of PAHO, we are honored to now serve as co-chair for Workstream 2 of the Economy and Health Dialogue, a multi-sectoral discussion forum for elevating and strengthening the intersection between economic policies and health outcomes. Madam President, at the national level, our assessment identified many gaps. To move from gaps to growth, we engaged policy discussions to develop an action plan, leveraging outputs from the assessment and now informing health system transformation initiatives and a refreshed National Health Strategy plan. We note and commend the 3 strategic lines of action. Notwithstanding, we call for PAHO to develop a streamlined and standardized tool for serial progress evaluations for the EPHFs. We also request that specific monitoring indicators be included in the strategy document with progress report submission to the governing bodies at shorter intervals than 5 years, which may delay urgencies to retool or pivot before strategies expiration. Finally, Madam President, PAHO's virtual campus has served member states well. The Bahamas advocates for leveraging the virtual campus to offer courses specifically designed to strengthen leadership, stewardship, and governance capacities, as well as courses to strengthen capacities for implementing the EPHFs. The Bahamas supports the resolution, and I thank you.
Thank you very much, Bahamas. And now we give the floor to El Salvador. Thank you very much, Madam President. El Salvador welcomes the resolution. We also successfully carried out the development of the public health functions in a participatory and in-person process in September 2021 to September 2022, which ended with the development of a plan of action for its strengthening, which is being implemented since September 2023. Thus, our country follows and carries out the proposed strategic lines by the organization and are guided in strengthening leadership, stewardship, assessment, the competencies of the public health staff for efficient implementation of the essential public health functions. And the term set to achieve the strategic objectives is of 10 years. Its follow-up and assessment will be consistent with the management framework based on the results of PAHO and with its follow-up processes and assessment of its performance. We feel very proud to contribute with a grain of salt in order to have a universal coverage health system, and we will continue working together with the member countries of WHO and PAHO in order to attain that goal. Thank you. Thank you very much, El Salvador. And now I give the floor to Panama. Good morning, Madam Chair, distinguished colleagues, distinguished delegates. The Republic of Panama would like to express its sincere gratitude addressed to the Pan American Health Organization for the valuable initiative of strengthening the essential public health functions with the main purpose of transforming health systems in our region throughout the upcoming decade. By facing the current challenges, the health authorities in Panama, all across the board in all institutional levels, together with civil society, are committed to developing essential capacities and skills in order to further strengthen our health system. This commitment is focused on ensuring the full exercise of the right to health by dealing with the risk factors and the social determinants that have an impact on the health of our population. Panama has achieved significant progress with the implementation of essential public health functions, considering these as a crucial component of primary health care, being essential in order to improve the leadership, stewardship, and governance of policies and measures that will promote the well-being of our population. We profoundly value the strategy for strengthening the essential public health functions because they offer a frame of reference at a local level as well as at our national and regional levels in order to expedite the transformation of our health systems and thus move forward towards a universal health coverage. The comprehensive approach of primary health care, which is renewed through the strengthening of essential public health functions, implies a continuous assessment cycle with the formulation and development of policies, allocation of resources, and universal and equitable access to health services. Thus, Panama reaffirms its interest in continuing to strengthen these essential functions by providing its resolute support to the proposed strategy as presented in this resolution. We are convinced that this effort will be essential in order to face emerging challenges in public health and thus improve the resilience of our health system. Thank you very much.
Muchas gracias, Panamá.
Thank you very much, Panama. And now I give the floor to Guyana.
Thank you very much, Madam President. Guyana fully supports the resolution to strengthen the essential public health functions, to accelerate health systems transformation from 2024 to 2034. Over the years, we have used these essential public health functions as a guide to restructuring and rebalancing our public health system. Our unwavering commitment to enhancing all public health functions is yielding tangible results with significant strides made in key areas. Notable improvements in assessments, policy development, resource allocation, and access are clear indicators of our steadfast dedication to continuously improving health in Guyana. Regarding policy development, we have been able to make significant progress in updating our legislation. Over the last few years, we have added 6 new laws relating to mental health, human resources, transplant, and data protection. And in the upcoming year, we will be adding new legislation regarding medicine regulation, telehealth, and public health, to name a few. We are very grateful to PAHO's legal department for their assistance. Our collaboration with PAHO to develop a workforce strategy, particularly in training and retention of nurses, is a testament to our commitment to delivering high-quality care and broadening access to remote communities. We deeply appreciate the support we have received from PAHO and the Collaborating Center in São Paulo, Brazil, and we acknowledge that our collective efforts are pivotal in helping us to train our nurses. We look forward to using this platform to train other categories of healthcare workers. We eagerly anticipate continued support in the coming years. We have also been able to access affordable medicines and vaccines through PAHO's strategic and revolving funds, which have been extremely beneficial to us. This support will become even more crucial as we expand our services. We are happy to learn that PAHO has included a new list of medication, including oncology drugs, and we plan to fully utilize these options. We recognize the benefits of this resolution and eagerly anticipate our close collaboration with PAHO to implement it in the upcoming years, aiming at maximum success. Thank you.
Muchas gracias, Guyana.
Thank you very much, Guyana. I now call on Brazil. Thank you, Madam Chair. Brazil supports the strategy as well as the resolution proposed in preparation for future emergencies. We talk about the strengthening of the essential public health functions to accelerate health systems transformation 2024-2034. For this goal, it's important to improve surveillance and primary health care and particularly strengthen the health force and development of strategic medicines in line with the universal access to health. Particularly, we support the recommendation that PAHO continue to offer technical assistance to states to implement essential functions and strengthen governance in public health. Finally, we'd like to underscore the importance of improving the training of healthcare professionals to avoid the loss of these resources. We know that strengthening the labor force is critical for our efforts and must be accompanied with retention policies and development policies. Thank you very much, Brazil. I now call on Colombia. Thank you, Madam Chair. Colombia welcomes and fully shares the views expressed in the strategy to strengthen the essential public health functions. We are working at two levels, at two speeds. One through executive actions, and the others aimed at a structural reform of our health system. In the first area, the one dealing with access, resources, development of policies and evaluations, I'd like to underscore that with the support of the Pan American Health Organization, we have moved forward in the second phase of the National Public Health Plan, which has a holistic approach towards social determinants, transnationality, transsectoral aspects, and strengthens the subnational health structure. Secondly, we'd like to highlight the work to improve primary health care. We said we have 10,000 basic teams throughout the country, and in an interdisciplinary manner, they address social determinants, they do early prevention, sectoriality. They encourage participation through a deeply territorial perspective and participatory perspective. Also, other policies that we've developed, particularly with ethnic, indigenous, Black, Afro-descendant populations, raizales, paniqueros, and Ron, we have developed systems owned by them, intercultural systems, and have developed the National Rural Health Plan through the peace agreement. Together with that, alongside the health reform, we have generated a national consensus on health with territorial equivalents, a unit for planning and monitoring, which will focus on the essential functions of public health. So we are therefore grateful and support this resolution. Thank you. Thank you very much, Colombia. I now call on Chile. Thank you, Madam Chair. Chile supports the document and the resolution proposed by the organization. In my country, the transformative agenda being developed has as its main goal to achieve universal health coverage. To achieve this, we have proposed to undertake a series of changes in our health system, beginning with universal primary health care, and make that the center that coordinates health care. This within the framework of the essential public health functions. We have therefore strengthened access and universal coverage in the area of primary health care, as I already said, and we've opted to make more universal the access to coverage regardless of the financing system for the primary health care each person has. We've also combined this with co-payment zero in all the care provided through this system. Another essential function of public health that we have strengthened through the reform has been participation, together with the social participation of user communities. We have been building a structure of universal health so that they become the managers of their well-being, of the well-being individually and of the collective. Thank you very much. Thank you, Chile. I now call on Peru. Thank you, Madam Chair. Peru believes it's fundamental to strengthen the essential functions of public health. And for this reason, we have started an assessment and strengthening project to develop a plan of action for the essential public health functions by holding national workshops with the participation of PAHO in Peru. However, there's still limitations in the operative ability of the first care system, which means we need financial resources for this. Also in the area of prevention and promotion of health. This is particularly critical in rural and vulnerable areas. That's why we need to strengthen national institutions that train healthcare workers pre- and postgraduate cases and develop public healthcare systems at the community level. We also need to close the gap in the training of human resources and develop talent in the remote areas. This strategy will contribute to national and regional objectives in Americas because it focuses on primary health care, which is a priority for Peru and countries in the region as we move towards universal coverage. The participation of academia and civil society in developing strengthening strategies is crucial in order to provide a real change in the health systems to achieve our goals. We also intend to replace the general focus in general evaluation to one centered in local capacity and subnational capacity, because the centralization of health services is still a challenge for Peru and many countries in the region. Also, we have aligned our strategy with the national policies and the priorities of the 2030 Agenda for Sustainable Development. We therefore suggest that there be a specific mention of strengthening the surveillance systems and the response to health emergencies, since the lessons of the COVID-19 pandemic showed that there were weaknesses in the early warning system. In addition, it's important to develop information systems that allow us to make decisions based on timely and reliable evidence. And finally, we believe that access to medication and other technologies should be addressed as a specific function of public health, because it's a fundamental component of access to health. We take note of what is stated in the document and support the strategy presented at the Council. Thank you very much, Madam Chair. Thank you, Peru. I now call on Barbados.
Thank you, Madam Chair. Barbados reaffirms its commitment to implementing PAHO's strategy to accelerate health systems transformation over the next 10 years. In this regard, we've already taken significant steps towards strengthening leadership, governance, and the integration of public health systems, and now seek to align these efforts with the broader EPHF framework to achieve universal health coverage. The Ministry has been actively strengthening its leadership and governance structures by fostering collaborations with key stakeholders, including PAHO. We are committed to addressing health disparities and ensuring equitable access to care, particularly for the vulnerable. Efforts to integrate primary health care services and promote social participation have already been initiated. In this regard, work continues with the integration of mental health services into the polyclinic system. Addressing social determinants of health through intersectoral collaboration is also central to the ministry's work, ensuring a whole-of-society approach. Barbados has undertaken to develop our human resources for health, including leadership and managerial training, to ensure effective implementation of the EPHF. A memorandum of understanding with Chamberlain University will see the training of nurses in advanced nursing practice, inclusive of nurse practitioners and nurse specialists. Building on lessons learned from COVID-19 pandemic, the ministry has made significant strides in strengthening emergency preparedness and resilience. In addition, we have updated our multi-hazard disaster preparedness plan. To fully implement the EPHF strategy and accelerate health system transformation, Barbados will require continued support from PAHO in the areas of capacity building and health information system strengthening. Barbados remains dedicated to advancing the EPHF framework to strengthen its health system and ensure a healthier future for all citizens. We support the resolution, and I thank you.
Muchas gracias, Barbados.
Thank you, Barbados. I now call on Puerto Rico. Thank you, Madam Chair. Puerto Rico thanks and congratulates the Secretariat for introducing the strategy to strengthen the essential public health functions in the Americas, a renewal for the 21st century. There is no doubt that the evaluation of the 11 functions will allow the member countries to strengthen their leadership, guidance, and governance of their health systems in order to achieve better health levels. Puerto Rico's experience it can be considered the first generation of public health renewal of some years ago. Was very gratifying. There were beneficial results for the health sector in Puerto Rico. Puerto Rico supports the approval of this strategy. Thank you.
Muchas gracias.
Thank you, Puerto Rico. I now call on the United Kingdom.
Thank you, Madam President. The UK Overseas Territories would like to thank PAHO for this plan of action. We have been committed to the implementation of PAHO's essential public health functions since their development, with Montserrat being the first small island developing state to pilot the WHO methodology on essential public health functions. We agree with the strategy's 3 lines of action. In particular, we welcome the need to adopt an integrated and intercultural approach and support the need to strengthen leadership to deepen the implementation of all public health functions. Thank you.
Muchas gracias, Reino.
I thank the United Kingdom. On this item, we have several non-state agents that would like to make a statement. I call on the Coalition Healthy America. Distinguished Chairman, distinguished delegates, the Coalition AmericasWashington class celebrates the commitment of the Pan American Health Organization and member states to primary health care. However, we're concerned by the very light mention of non-communicable diseases and their risk factors. Just a year away from the next meeting of the high-level meeting of the UN on non-communicable diseases 2025, we need to adopt concrete actions to attain the goals to which we were committed ourselves. We urged member states to mobilize investments, to accelerate implementation, and assess progress made. The COVID-19 pandemic has significantly affected access to health services, hitting hard the most vulnerable groups. The expenses for treatment of CNTs push many people into extreme poverty each year. We celebrate the resolution proposed and urge member states to increase the allocation of national resources. using the regulatory and tax instruments that are effective, such as tariffs on non-healthy products, tobacco, alcohol, sugared beverages, and processed products, and develop specific policies to address the risk factors of non-communicable diseases, including the social determinants of health and the integration of ENT services, or non-communicable diseases. We also welcome the strengthening of health and training of healthcare personnel and the significant participation of peoples who have the experience of living with these diseases and how it affects their health and their well-being. Thank you, Madam Chair.
Gracias.
Thank you. The Coalition America Saludable, Healthy America. I now call on the World Cardiology Association.
Thank you, Madam President, Senor Diretor, distinguished delegates. The World Heart Federation commends the World Health Organization and its member states for the strategy. Cardiovascular disease imposes significant economic burdens on individuals and households, often leading to catastrophic health expenditure and perpetuating generational poverty. Universal health coverage plays a key role in ensuring widespread access to cardiovascular health service for all. Essential public health functions serve as a foundation for health systems capable of achieving universal health coverage. Nonetheless, such systems require sustainable financing, empowered institutions, a well-trained health workforce, strengthened primary health care, and robust cross-sector collaboration. World Health Federation urges governments to adopt the proposed resolution and implement, in partnership with civil society organizations, the 11 EPHFs to uphold the right to the highest attainable standard of health. We further call on member states to accelerate progress towards universal health coverage through robust and well-financed PHC systems, ensuring accessibility, affordability, quality, and equity. Expand UHC to provide comprehensive care, including prevention, diagnosis, treatment, and rehabilitation for CVD and its associated risk factor. Integrate evidence-based and cost-effective cardiovascular intervention into national UHC. Benefits packages, drawing from Appendix 3 of the WHO Global NCD Action Plan. Implement the Hearts in the America initiative to provide a standardized model of care for cardiovascular risks. Develop of strengthened national cardiovascular health plans to ensure sustainable funding for and wider access to cardiovascular health service across the continuum of care. And engaging civil society organizations. Thank you.
Muchas gracias a la asociación.
I thank the World Heart Federation and now call on the International Federation of Students of Medicine, the Associations of Students of Medicine.
Delegates, the International Federation of Medical Students Association, active since 1951 and representing more than 1.3 million medical students, supports the proposed strategy for strengthening the essential public health functions, considering their methodology and objectives to be aligned with youth worldwide and our policies. We agree with the notion that achieving universal health coverage requires strong leadership, governance, and stewardship, which can be obtained with the Essential Public Health Functions (EPHF) framework. We also recognize the necessity of improving the ability to assess public health capacities and, most of all, we support the need of investment and training of the health workforce to meet each community's challenges. The item reports a rise from 34.1% to 41.5% in unmet healthcare needs across 8 countries during the COVID-19 pandemic. But we know this rise does not affect every country equally. For example, out of the 700 million doses of COVID-19 vaccine injected globally in 2021, Only 13% went to low or medium-income countries. It is necessary to fully strengthen EPHF to decolonize health and seek the development of strong health systems in the Global South. As a student representative institution, we believe education is the key to a more equitable future, and government action should enable each healthcare professional to reach their full potential. For that goal, the World Health Organization and other stakeholders must recognize and support the crucial role of youth in achieving health equity and foster youth inclusion in spaces, activities, and decision-making, for we are the future of healthcare professionals. Thank you.
Muchas gracias.
I thank the International Federation of Associations of Medical Students and now call on Modendi International.
Thank you, Madam President, Director PAHO, and delegates for the opportunity to deliver this statement on behalf of Modendi International. We commend the Secretariat and Member States on this strategy. In the Americas, the harm caused by alcohol is a serious public health crisis. It is the region with the second highest per capita alcohol consumption level in the world. In the age group 20-24 years, the Americas region has the highest rate of death due to alcohol in the world. More than 10% of adults in the Americas live with an alcohol use disorder. In the context of this strategy, the public health crisis of alcohol harm in our region matters in three ways. The magnitude of alcohol harm is a major burden on health system functioning and capacity. It is a serious vulnerability for member states, and it is worse among the most vulnerable groups, thus worsening inequities. Increasing capacities to better and earlier identify alcohol use disorders in primary health care settings is an essential public health function that holds substantial potential for improving multiple health outcomes across other priorities, across mental disorders, non-communicable and communicable disease targets. Preventing early initiation in alcohol consumption as well as its escalation should be a priority, and it is an essential public health function. This can be achieved with alcohol policies now proven to work and be cost-effective, which are recommended by WHO, PAHO, and several UN agencies. Movendi International stands ready to partner with PAHO and member states, making these issues a priority in the work to implement this strategy. Thank you.
Muchas gracias.
Thank you, Movendi International. I now call on the International Association of Hospice and Palliative Care.
President, distinguished delegates, the International Association for Hospice and Palliative Care welcomes the strategy's focus on primary health care. The 2018 Astana Declaration affirms palliative care as an essential element of primary health care. Primary care's interdisciplinary approach supports high-quality universal health coverage in general and palliative care in particular. Palliative care, primary care, usually the first point of contact with a health system, can provide continuity of care for early diagnosis and management of patients with potential palliative care needs. Primary care can deliver palliative care through integrated chronic disease management, combining treatment of underlying illnesses alongside health promotion, disease prevention, rehabilitation, and palliative care from point of diagnosis through end of life and bereavement. Primary care can deliver palliative care at or close to home, the local health facility, family home, senior living and nursing facility, homeless shelter, or detention facility. As primary care extends from cradle to grave, primary palliative care covers all ages from neonates to elders. Evidence shows that integrating palliative care into health systems can reduce out-of-pocket spending, especially that which generates impoverishment, improve public trust, promote healthcare utilization, and offer cost savings for health systems. A win-win. Thank you.
Muchas gracias a la Asociación Internacional.
I thank the International Association on Hospice and Palliative Care. And I now call on Dr. Fitzgerald to respond to the comment.
Thank you, Madam President, and a heartfelt thanks to all the member states for your comments, contributions and support for this strategy. This strategy is really intrinsically linked with a discussion that we had here at the Directing Council in 2021, where we discussed a strategy for building resilient health systems in the context of a post-COVID-19 recovery, but with a view to really recovering lost public health gains and sustaining action moving forward. And what we've seen since that period is really member states engaging in substantive efforts to transform health systems based on primary health care and using the essential public health functions as core capacities to drive the health sector transformation processes, recognizing that health systems are complex. They have complex administrative governance levels and functions, structures of governance, financing functions and service delivery mechanisms. And of course, there's intersectoral actions that involve key and core institutions involved within the health system. And so as we move towards a transformation of health systems based on primary health care, the capacities and stewardship of governance to be able to drive that process, to guide that process, recognizing the complexity of the system and actors is really central to this issue. Irrespective of whether we're talking about prevention, promotion, diagnosis, treatment around NCDs or communicable diseases, or during the life course approach, it really is the capacities and leadership and stewardship of the Ministry of Health and of the government as a whole to be able to lead that process moving forward. We've heard from many countries, such as Honduras, Panama, Peru, informing us of how this process has really led to national strategies around primary health care, while Paraguay, Jamaica and Dominican Republic have taken slightly different tracks, resulting in the development of national strategic health plans using the EPHF framework. And in each of those processes, I think it's been very interesting to see how countries have recognized that the essential public health functions facilitate the management of those processes of transformation based on a policy cycle that moves from assessment into policy review, into examining resource allocation, and then examining the issues around access to health in the country. The holistic system approach is required, not just at the central level or the federal level, and we've heard from Mexico, Colombia, and Chile how within various differing contexts of health systems that it has required complex discussions between central, regional and local levels to ensure implementation. In Mexico, for example, the health sector transformation has been extremely interesting, whereby the policy framework around the essential public health functions has been used to establish and strengthen the national public health system and the establishment of the national health services and the alignment between the federal and local or state levels. In Colombia, with the engagement of almost 10 states, the various reform processes that the Honourable Vice Minister mentioned, really strengthening the territorial planning process for primary health care. The essential public health functions have played a critical role in strengthening those capacities at the national level. And in Chile, in the processes of universalization of primary health care with the engagement and social participation at that level. We have 15 evaluation processes that are either completed or ongoing. And what's really interesting about the evaluation process is that in dialogue with you, we can tailor the assessment processes to the context of the health system and priorities of that country. And I think it was really good to hear from so many Caribbean countries their engagement in this process. Currently, 6 Caribbean countries are working actively to strengthen the essential public health functions. And we really recognize the Bahamas in their leadership also in this issue and also in the Economic and Health Forum of the Americas. But also Antigua, Barbuda, Belize, Jamaica, St. Kitts and Nevis, St. Lucia have really used this methodology, adapted it to the context of smaller health systems to move forward and define processes for strengthening of primary health care. What we are seeing as we collect data associated with the assessments is that there are significant gaps in institutional capacities for implementing the essential public health functions in 3 key areas. First of all, the development and implementation of policy frameworks. Secondly, the generation of evidence to support implementation of interventions within the health system. Thirdly, the public health workforce competency. And this issue has come back repeatedly in multiple documents across the discussions today. And these areas are particularly of importance in terms of access and resource allocation. And so that interface between policy, monitoring and evaluation, public workforce competencies is really important as we begin to look at how it impacts access and resource allocation within the system. We note in terms of monitoring and evaluation the importance of collecting data and analysing data. We do have an active platform with all the 11 indicators across the 4 elements of the policy cycle available for you, and we will continue to collect data and monitor the capacities as we move forward. So thank you very much. We really remain at your disposal and disposition to continue to provide technical cooperation in this really critical area of work. Thank you, Madam President.
Muchísimas gracias.
Thank you very much, Dr. Fitzgerald, for responding to these comments. Distinguished Director, do you have any comments?
President, thank you. I want to thank our member states. I think that this is a very important topic, a very good discussion. And this is a resolution that really kept all the real implementation that we already have had in recent years of the renewed essential public health functions. Many countries have already performed the assessment. And I agree that it's very important to have this resolution now because many countries, several countries in our region, they have started the transformation in their health systems, trying to overcome some historical problems that we have in our region, the fragmentation of the health systems, to strengthen the leadership of the ministries of health to address areas that were not highlighted in the past. So and now they were not a priority in the past, but now the pandemic highlighted how important they are to be addressed. So I think that is really important because this resolution and all these changes and improvements that were added in consultation with our member states to the essential public health functions will be very important to be implemented in the countries because they will identify clearly the gaps. They will identify what are the needs that they have to establish a solid roadmap to conclude this transformation process in the countries and to strengthen the national health systems with all these very important dimensions that we need to address currently. Thank you.
Muchas gracias.
Thank you very much, Dr. Barbosa, for your comments. And now I ask the rapporteur to please introduce the proposed resolution. Thank you very much, Madam Chair. Proposed resolution, strategy for strengthening the essential public health functions to accelerate the health systems transformation 2024-2034. The 61st Directing Council, PP1, having reviewed the strategy for strengthening the essential public health functions to accelerate health systems transformation 2024-2034, document CD 61/9, PP2, mindful of the urgency to advance in the development of more resilient, equitable, and inclusive health systems based on primary health care. PP3, recognizing the case for a renewed focus on the essential public health functions, given their central role in supporting the full exercise of the right to the enjoyment of the highest attainable standard of health, addressing social determinants of health, ensuring universal access to integrated individual and collective health interventions, and fostering collaboration in the implementation of public health actions. PP4, acknowledging that achieving universal access to health and universal health coverage requires bolstering the leadership, stewardship, and governance capacities of health authorities. PP5, considering that action by member states is essential to strengthen leadership, stewardship, and governance through a renewed emphasis on the EPHF. Resolves OP1 to approve the strategy for strengthening the essential public health functions to accelerate health systems transformation 2024-2034, document CD 61/9. OP2 to urge all member states, considering their contexts and needs, vulnerabilities, and priorities, to A. promote the implementation of the strategic lines of action contained in the strategy. B. Strengthen leadership. D. Promote the institutionalization of a standardized EPHF assessment, followed by systematic actions to incorporate findings into policy and investment priorities. E. Strengthen public health workforce competencies for the EPHF through policies, training, and collaborations. OP3 to request the director to A. provide technical cooperation to member states to support the implementation of the strategic lines of action contained in the strategy. B. Support the regional cooperation and dialogue in health, facilitating the sharing of knowledge and experiences to enhance the capacities of member states to evaluate and implement the EPHF effectively, as well as collaborative and intersectoral efforts to share best practices in health system strengthening based on public health care. C. Report periodically to the governing bodies of the Pan American Health Organization on the progress made and challenges faced in the implementation of the strategy through a progress report in 2029 and a final report in 2035. Thank you, Madam Chair. Thank you very much, distinguished rapporteur, for introducing this proposed resolution. Floor is open to plenary on the proposed resolution. If there are no objections, I declare the resolution adopted.
Continuamos con el punto.
Now let us move on to agenda item 4.7, strategy and plan of action to strengthen tobacco control in the region of the Americas, 2025-2030. I would like to bring to your attention document CD 61/10, and I invite Dr. Anselm Hennis, Director of the Department of Non-Communicable Diseases and Mental Health of the Pan American Sanitary Bureau, to please come up to the head table.
Le concedo.
I yield the floor to the representative of the Executive Committee to report on this agenda item. Thank you very much, Madam Chair. The Executive Committee welcomed the proposed strategy and plan of action, which provides a roadmap that prioritizes key actions to accelerate the implementation of the WHO Framework Convention on Tobacco Control and enable member states to meet their targets for reducing tobacco use and the associated morbidity and premature mortality. Delegates were pleased to note the incorporation of an equity perspective in the strategy and plan of action, and a focus on populations in situations of vulnerability. The strategy's inclusion of measures to counter interference by the tobacco industry and to regulate the use, commercialization, and advertising of novel and emerging tobacco products was also applauded. Delegates underscored the importance of collective and intersectoral action to combat the tobacco epidemic, including collaboration in banning trans-border advertising, promotion, and sponsorship of tobacco products. The importance of sharing experiences and best practices in tobacco control was also emphasized. Member states were urged to strengthen national measures and international cooperation to eliminate illicit trade in tobacco products. The Executive Committee adopted Resolution CE 174.R7, recommending that the Directing Council approve the strategy and plan of action to strengthen tobacco control in the region of the Americas for the period 2025-2030. Thank you, Madam President. This concludes my report on this agenda item. Thank you very much, distinguished representative of the Executive Committee, for reporting on this agenda item. And now I yield the floor to Dr. Hennis to introduce this item.
Madam President of the 61st Directing Council, Dr. Jarvis Barbosa, Director of the Pan American Health Organization, distinguished delegates, honorable ladies and gentlemen, colleagues, thank you for the opportunity to present the strategy and plan of action to strengthen tobacco control in the region of the Americas 2025 to 2030 on behalf of the Pan American Sanitary Bureau. Tobacco use continues to be a leading threat to global public health, generating a great social, economic, and environmental burden for countries, exacerbating household poverty and increasing inequalities. Significant progress has been made in recent years in combating the tobacco epidemic in the region. The economic, political, legal, and social feasibility of adopting evidence-based policies in alignment with the WHO Framework Convention on Tobacco Control, especially in the FCTC articles considered best buys for non-communicable disease prevention and control, has been clearly demonstrated. However, it is important to note that to date, only one country in the Americas has implemented all 5 best buys, highlighting the need for other member states to scale up their efforts to comply with global commitments. We must also note that youth remain a key target for the tobacco industry, which seeks to replace customers who quit or die. It is estimated that in the Americas, at least 5 million adolescents aged between 13 and 15 years use some form of tobacco. Available data indicate that electronic cigarette use is more prevalent among young people than older adults. Effective measures to protect children and youth, such as banning all forms of promotion and advertising and making tobacco products less affordable through higher taxes, are lagging in our region. The final report of the Strategy and Plan of Action to Strengthen Tobacco Control in the region of the Americas, 2018 to 2022, highlighted these concerns and emphasized that the tactics of interference by the tobacco industry and its allies remain the key factor limiting the achievement of tobacco control goals. We must recognize the growing challenge posed by novel and emerging nicotine and tobacco products, which are inappropriately marketed by the tobacco industry as being healthier alternatives to conventional cigarettes. This strategy provides member states with a roadmap to regulate these products, combat the surrounding misinformation, including attempts to promote these products as tools for harm reduction, and prevent their increased use, particularly among youth. This strategy and plan of action responds to requests from member states during the 60th Directing Council for a new strategy to continue tobacco prevention and control efforts in the Americas, and demonstrates the political will and commitment of member states to advance the tobacco control agenda, implement the most cost-effective control strategies, and tackle new and emerging threats. Furthermore, special attention is given to protecting populations in situations of vulnerability who often have higher rates of tobacco use compared to national averages. The strategy, therefore, not only reinforces the objectives of the prior mandate, building on the lessons learned, but also provides guidance on the regulation of electronic cigarettes, monitoring of tobacco industry interference, as well as provision of adequate treatment of tobacco dependence, and supports the PAHO Better Care for NCD's initiative. Madam President, we gratefully acknowledge the input and engagement of member states during the regional consultations held earlier this year, which significantly contributed to the development of this strategy and plan of action to strengthen tobacco control. The 5 strategic lines of action call on PAHO member states to 1. Implement effective measures to regulate the use, commercialization, and advertising of conventional tobacco products and other emerging products through smoke-free environments, banning of advertising, promotion, and sponsorship, and large health warnings with images. Secondly, implement measures related to pricing and taxes to reduce tobacco demand. Thirdly, provide comprehensive quality services that promote effective measures for tobacco cessation and proper treatment of tobacco dependence. Fourthly, ratify the WHO Framework Convention on Tobacco Control and the Protocol to eliminate illicit trade in tobacco products. And finally, to strengthen the capacity of member states in public health policies to address attempts by the tobacco industry to interfere with public health policies. The PAHO Secretariat remains committed to supporting member states in their efforts to end the tobacco epidemic and the resulting preventable loss of life. We invite the Directing Council to review the strategy and plan of action and its recommendations and consider its approval. Thank you for your attention.
Muchas gracias.
Thank you very much, Dr. Hennis, for introducing this report. And now I call on the Directing Council to review the information presented in this document, provide any comments it deems are relevant, and consider the possibility of approving the proposed resolution as presented in Annex A. I open the floor to the plenary to start the discussions on this document. The discussion on the resolution will take place once the rapporteur has read the proposed resolution.
Ahora ofrezco.
Now, let me give the floor to St. Lucia.
Good morning, Madam President, delegates. St. Lucia supports the comprehensive strategy and plan of action to strengthen tobacco control in the region of the Americas 2025 to 2030. The government of St. Lucia has set the focus of health as a major priority. This implies the promotion of a health policy that is patient-centered, evidence-based, equitable, accessible, and affordable. Major emphasis is being placed on the primary preventative services, which creates an environment of healthy lifestyle through education and promotion, encouraging regular exercise, healthy aging, and reduced toxic habits. Chronic non-communicable diseases continue to be a major health concern, contributing to over 80% of all cause mortality on the island. The prevalence of tobacco use across both sexes, aged 18 to 69, was 12.9% in 2019, based on the Behavior Risk Factor Survey. St. Lucia has achieved progress in the reduction of tobacco use through various programs and policies. In 2017, St. Lucia satisfied the requirements for labeling for cigarette packages with written and graphic warnings placed on all single-sale cigarette boxes to demonstrate the dangers of cigarette use. The ratification of the Framework Convention on Tobacco Control in November 2005, which came into effect in 2006. The government of St. Lucia, through the Ministry of Health in June 2020, implemented the Public Health Smoking Regulation 2020 as part of the Public Health Act to prohibit smoking in enclosed public spaces, workplaces, and public transportation. The government of St. Lucia also implemented the application of a 63% ad valorem tax to the cost of all tobacco cigarette brands. With the support and assistance of PAHO, St. Lucia established a tobacco cessation program to train and equip health workers with guidelines to facilitate successful tobacco cessation in populations. Over 30 agencies participated and are able to provide support to those seeking help. St. Lucia is currently in the planning phase for the implementation of the 5th round of the Global Youth Tobacco Survey, with implementation scheduled for 2025, and this data will support the development of campaigns and programs targeting the youth. St. Lucia thanks PAHO for the support in health systems, and we support the resolution. Thank you.
Muchas gracias.
Thank you very much, St. Lucia, and now I yield the floor to El Salvador. Thank you, Madam Chair. El Salvador has achieved a reduction in traditional tobacco consumption, as was shown by the latest tobacco and control in 2022, where we showed that it went from 8.8% in 2014 to 7.4% in 2022. However, we continue deploying efforts in order to have better information and data to assist us in key decision-making to face tobacco consumption and addictions. It is so much so that the trend showed by the World Survey in young people in 2021 led us to concentrate on the young population that is turning its eyes to the so-called novel tobacco products. The effort is huge, but we need an articulated response by all member countries and the support of WHO in order to create one front to reduce the incidence of tobacco addiction and revert the trend essentially amongst the young population in consumption in whatever means. El Salvador bets on it. However, the appeal is to continue joining efforts in order to address this phenomenon that has a negative impact on the quality of life, not only on people, but the entire world. Thank you very much. Thank you, El Salvador. And now I give the floor to Mexico. Thank you, Madam Chair. Mexico is in favor and committed to the actions in order to strengthen tobacco control and commends the organization for the strategy and plan of action at a regional level. My country has kept a firm commitment in compliance with the Framework Convention for Tobacco Control, in particular in the four most cost-efficient measures for its control, including the use of Article 8 of the Convention when publishing at the end of 2022 the decree in which we stipulate spaces for collective gathering as spaces that are 100% smoke-free spaces. We move forward based on the creation of the National Office for Tobacco Control, responsible for strengthening all activities related to public policies for tobacco control all throughout the national territory, with regional and international cooperation. Compliance with said commitments has earned the country international recognition by the World Health Organization. Based on the achievements made, the country acknowledges that there's still work to be done in order to strengthen public policies for tobacco control and supports the strategy presented. It renews the commitment of the country and towards the region in order to complete the fight against the tobacco pandemic. Thank you very much. Thank you, Mexico. And now we give the floor to Guatemala. Thank you very much, Madam Chair. We would like to thank PAHO for its support against tobacco consumption, one of the main determinants of harm to health. In spite of the progress in some countries, we must acknowledge that there's still much to be done. In Guatemala, we were pioneers in the region in smoke-free environments after Panama and Uruguay. Regrettably, after that progress made, we have not been able to implement any additional provision of the Framework Convention. Besides tobacco consumption, as conventional cigars and cigarettes, we're experiencing an alarming increase in the use of flavor electronic cigars and burnt tobacco. These emerging products do not have the necessary regulation, which turns them into a threat for tobacco control, particularly in Guatemala, where the implementation of the convention has been very weak. It is urgent for those countries that are lagging behind in that struggle to reinforce the efforts together with PAHO. We launch an appeal so that at least electronic cigarettes, non-nicotine flavored capsules, and other tobacco be regulated with their taxes, and we ban its publicity in the point of sale, one of the publicity stunts that still prevails in the region. So much so that it will enable us to move to an effective control of tobacco, particularly for the most vulnerable populations. Thank you. Thank you, Guatemala. And now I give the floor to Cuba. Thank you, Madam. Cuba shares the concern and the need for protecting the health of people when faced with tobacco consumption products. The Cuban government and public health institutions, as well as educational centers, carry out preventive actions on the harm caused by tobacco consumption on human health, including conventional and non-conventional and electronic cigarettes. Cuba draws your attention to the harmful impact of some of the aspects of the World Convention, including the impact on the economy and employment. Cuba is not a party to that instrument, and therefore Cuba currently cannot be reflected for all the purposes of the application of this strategy. However, this does not entail that we should give up on the achievements in the health sector and the commitment to continue working in the educational work that is done with the population because of the incidence and the impact of tobacco consumption and their consequences on human health, and most specifically the work we do with young people that contains excellent results in the country. Thank you. Thank you, Cuba. And now I give the floor to Uruguay. Thank you very much, Madam. Uruguay would like to express its gratitude for this document on the strategy and plan of action to strengthen tobacco control that proposes a roadmap to prioritize key measures to continue enforcing the Framework Convention for Tobacco Control and allow member countries to comply with the goals as set, reducing tobacco consumption and premature death caused by non-communicable diseases. This document has a point of view of equity, concentrating on groups in vulnerability, and agrees with mandates of a regional and global nature. Likewise, it includes the lessons of the goals not attained in the previous document, 2018-2022, both conventional and non-conventional products, as well as electronic non-nicotine and nicotine delivery system, known as electronic cigarettes altogether. That is to say, e-cigarettes. In May this year, we signed an MOU between the Ministry of Public Health and the Convention Secretariat, Framework Convention, renewing the agreement to continue with this work in order to promote international cooperation in the fight against tobacco consumption. The MOU establishes new basis for the Knowledge Center in Uruguay, which is a tool created for dissemination, development, and exchange of knowledge on tobacco, emphasizing Articles 8 and 14 of the Framework Convention, concentrating on the measures that have to do with dependence and dropping the consumption of tobacco. We've made significant progress that have to do with the control of tobacco consumption, but as new novelties crop up in the tobacco industry, we face new challenges that are added to the achievements made, and therefore a strategy and a plan altogether are welcomed for health policies for these purposes. In order to conclude, Uruguay makes available the Knowledge Center in order to think and coordinate cooperation mechanisms with the purpose of together fighting the consequences of tobacco consumption in keeping with this document. Thank you. Thank you very much, Uruguay. And now we give the floor to Bahamas.
Madam President, 2 years ago, member states, including the Bahamas, requested an extension to the tobacco control agenda beyond 2022. This agenda item affirms that PAHO is responsive to member states. While PAHO and member states have built strategies to counter big tobacco's disinformation, industry tactics and shifts targeting new groups, including youth, fuels increasing usage rates. This agility demands that we do more and innovate more. We therefore call on PAHO to provide a program of work to elaborate the unique country-level socio-political barriers and enablers of the FCTC implementation. Appreciating the foundational work on feasibility measures for tobacco control at global and regional levels, we also call on PAHO to translate feasibility measures more concretely into value for politicians and policymakers. Madam President, in 2024, the Bahamas conducted an in-country assessment of our progress on FCTC implementation with the support of PAHO, the WHO FCTC Secretariat, and the World Bank. We anticipate that the final assessment report will re-energize debate and action on tobacco control in our country. Finally, Madam President, the Bahamas draws attention to the indicators for this extended agenda. Under SLOA 1, we recommend an indicator addition as follows: number of member states with direct technical assistance to define country-specific barriers and enablers to implementation. We note the ambitious nature of Indicator 3 5.1.1, particularly given many member states are lagging to achieve universal health. The Bahamas welcomes details on the features and requirements of the observatory mentioned in Indicator 5.1.2, and we request PAHO make available the methodology in setting the 2030 indicator targets. The Bahamas supports this resolution, and I thank you.
Muchas gracias.
Thank you very much, Bahamas. And now I give the floor to Canada.
Canada welcomes PAHO's continued efforts to advance tobacco control in the region and accelerate implementation of the WHO Framework Convention on Tobacco Control. This strategy and plan of action aligns with our domestic policies and current efforts on tobacco control. We remain committed to working toward full implementation of the FCTC and enhancing tobacco control measures as we advance the goal of Canada's tobacco strategy to achieve less than 5% smoking rates by 2035. With the tobacco control landscape evolving over the past 2 decades, Canada firmly believes the FCTC and the strategy and plan of action, both evidence-based documents, contain all necessary articles and actions to guide member states' tobacco control measures, even as an industry adopts new tactics. Tobacco packaging and labeling remain one of the few channels available for promotion of tobacco products. Independent research has consistently shown plain and standardized packaging measures reduce appeal of tobacco products, particularly among young people. Last year, tobacco's new tobacco product appearance, packaging, and labeling regulations came into force, with new measures that require health warnings and toxicity information be included on all tobacco product packages and health warnings be displayed directly on certain tobacco products. Canada is the first country to require health warnings directly on individual cigarettes, little cigars that have tipping paper, and tubes. We are concerned to note continued barriers to tobacco control efforts and encourage member states to continue to strive for the implementation of the FCTC and this strategy and plan of action to limit the regional burden of tobacco-related illness and disease. We strongly support this strategy and plan of action and its resolution and look forward to continuing to work with PAHO and the region to achieve these objectives. Thank you.
Muchas gracias.
Thank you very much, Canada. We will now break for lunch, and I'd like to remind everyone that we will come back at 2 o'clock.
And finally address those, because that will put
Since 2021, the Pan American Health Organization, PAHO, has been implementing the Improved Health of Women and Adolescent Girls in Situations of Vulnerability project in Bolivia, Colombia, Ecuador, Guyana, Honduras, and Peru. With financial support from the Government of Canada, this project addresses some of the most pressing challenges related to the health of women and adolescents.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
By strengthening the capacities of more than 45,600 people, including healthcare providers, public servants, and community health workers, such as traditional midwives, the project has contributed to strengthening health systems from primary care and expanding access to sexual and reproductive health services in the 6 countries. The project has also supported the creation of about 100 technical guidelines to improve the quality of care and has developed innovative telehealth initiatives to optimize maternal and neonatal health outcomes. Taking a comprehensive approach and promoting gender equality, the project has fostered the empowerment of women and adolescents so they can make informed decisions about their well-being and actively participate in matters related to their sexual and reproductive health rights.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Additionally, considering cultural diversity, the Knowledge Dialogues methodology has been implemented by exchanging perspectives on issues such as teenage pregnancy and gender-based violence, encouraging communities to increasingly attend health centers. The project is carried out in coordination with ministries of health, civil society, and community leaders in the 6 countries, creating spaces for exchange, capacity building, and knowledge transfer. The alliance between the Government of Canada and PAHO is essential to continue efforts to improve the health of women and adolescents in situations of vulnerability. This collaboration aims not only to advance towards the achievement of the Sustainable Development Goals, but also to continue to positively impact the lives of women so that in the near future, all can exercise the sexual and reproductive health rights, leaving no one behind.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary health care system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child, it's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So.
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving, yes. Collaboration. Yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's right to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área da telesaúde. Isso aí, para mim, é como fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
dizer que o escritório da OPAS no Brasil está fazendo um monte de coisas legais para cuidar do meio ambiente e eu vim aqui ver de perto.
Oi, eu sou Matias. Será que a OPAS é verde mesmo? Oi, sou Liz, quero trabalhar aqui no futuro.
Oi, bem-vindos à OPAS, crianças!
Nós ainda temos containers maiores que também podem ser usados para papel, para papelão, ou seja, tudo aqui pode ser reciclado.
Tá vendo essas bicicletas aqui? Ó, isso aqui a gente fez para os colegas nossos aqui da OPAS que quiser pedalar, elas ficam aqui disponíveis para todo mundo.
Aqui na OPAS a gente não usa nada descartável, só copos e garrafas reutilizáveis. E olha só que legal, nosso mexedor é de bambu.
Nós também acabamos de instalar uns painéis para captar energia solar.
A OPAS também tem um sistema de irrigação e só uso o necessário.
Oi, Rafa, para finalizar, vou mostrar para vocês os 120 ipês amarelos que nós plantamos e que hoje estão pequenininhas, mas no futuro vão ficar grandes igual aquela lá atrás.
Nós estamos cuidando do planeta também aqui. Estamos cuidando para vocês.
Nosotros como oficina de país en Nicaragua nos encaminamos a una oficina verde tomando en consideración el consumo de papel para nuestras impresoras. Tenemos una estadística que desde el 2019 fue la última vez que se compraron resmas de papel en una cantidad de 180 resmas. En el 2024 tenemos un saldo de 136 resmas Eso indica de que solamente se han utilizado 44 resmas en 5 años, a razón de un promedio de 8.8 resmas por año en consumo. Esto también implica, si hay una reducción del consumo de papel, hay una reducción también de tóner para nuestras impresoras. La representación en Nicaragua se unió a la modalidad de trabajo en casa, lo que permitió una reducción de consumo de papelería y tóner en esta oficina. Como organización debemos de ser parte activa de la ecologización de nuestras instalaciones, adoptando políticas ambientalmente sostenibles con prácticas modernas de ahorro de energía, reducción de residuos y reciclaje.
Desde el equipo de OPS en Colombia estamos comprometidos con la sostenibilidad. La sostenibilidad para proteger el medio ambiente y sobre todo para cuidar de la salud de cada uno y cada una de nosotros, los habitantes en este hermoso planeta.
Desde el 2023, la representación en Colombia aplica dentro de la evaluación de eventos competitivos criterios de sostenibilidad.
Solicitamos a nuestros proveedores el uso de empaques biodegradables o de más de un uso, la alimentación saludable y el manejo de residuos al final de los eventos.
Promovemos desde la planificación del evento el uso de la tecnología en vez de la impresión de material. Esto con el fin de ayudar al medio ambiente y a la optimización de los recursos de la organización.
Hemos tenido muy presente la sostenibilidad, no solamente en términos de lo que ha sido toda la construcción para nuestras nuevas oficinas, sino también en cada una de nuestras actividades, pensando en cuáles son los mejores materiales, el poder reducir el uso del papel y, por supuesto, velando por esa salud de cada una y cada uno de los miembros del equipo del OPS en Colombia.
Los interruptores inteligentes nos ayudan a un ahorro más eficiente de la energía. Asimismo, contamos con UPS. Esto nos ayuda a hacer un ahorro entre el 20 y el 30% de nuestro consumo de todos los equipos que tenemos en la oficina.
El compromiso con la sostenibilidad es una tarea de todos. Es por eso que desde OPS Colombia queremos dar ese ejemplo y poder continuar en este trabajo.
Anissa, pour nous arriver à tout le monde même chance, nous travaillons avec un pile l'hôpital. Pour nous arriver, faire promotion à l'école maternelle et soutenir maman qui a été seulement pendant 6 premiers mois de la vie de monde. Comme ça, nous gagnons l'hôpital Tout du Nord, qui déjà passé 2 évaluations internes et qu'on y a capté une évaluation externe dans début mois de septembre pour nous arriver certifié comme hôpital ami des bébés. Ça veut dire un hôpital qui zanmi ti bébé, côté tout personnel là, depuis prend directeur pour arriver joindre sécurité dans barrière, tout le monde met ensemble pour faire toute femme qui est enceinte qui vient accoucher connaît que c'était seulement pour bailler ti moun nan pendant 6 premiers mois la ville.
L'initiative Hôpitaux Amis des bébés garantissent que les maternités dispensent des informations et du soutien continu aux mères en respectant aussi les besoins et les rythmes naturels des nouveau-nés.
Ensemble, ces actions contribuent à améliorer la santé et le bien-être des nourrissons en Haïti, offrant à chaque enfant un meilleur départ dans la vie grâce à l'allaitement maternel et contribuent à la réalisation des objectifs de développement durable.
Hoy visitamos esta sala de vacunas Padre Monchi, aquí en Foz de Iguazú, el equipo de evaluación externa, y hemos evaluado y analizado y conversado con los colegas y trabajadores de la salud del sistema del SUS.
La evaluación consiste de varias fases, la primera de las cuales es parte del país, en el cual utiliza un instrumento de autoevaluación, y posteriormente un equipo de expertos viaja al país, visita, conoce la realidad en territorio y de esa forma les permite identificar potenciales oportunidades de mejora, recomendaciones y también fortalezas que deben ser sostenidas a lo largo del tiempo y eventualmente compartidas con otros países de la región para fortalecer las capacidades no solo a nivel nacional, sino a nivel regional.
A avaliação externa voluntária ela vem num momento muito importante para o Brasil. É um momento que o Programa Nacional de Imunizações ele passa por mudanças e reajuste, ele está tendo uma reorganização, uma reestruturação.
Lo importante de las evaluaciones es que son un mecanismo que permite al país que la solicita poder tener una idea clara de cuál es su situación actual, no solo desde su propia autoevaluación que el país la hace, sino desde la visión de un evaluador externo, lo cual no solo les permite corregir aquellas situaciones en las cuales se pueden mejorar o confirmar que el camino es el correcto, que la situación está bien llevada adelante, de manera que es un ejercicio en el cual el país tiene todo para ganar.
We saw here a lot of aha moments. People, they have not seen like that with their own eyes. And so bringing these external perspectives and these opportunities for peer learning, it's great because they can actually see things with other eyes, bring fresh perspectives, and see what are the gaps that they have not thought through, and finally address those because that will put the programs in a much better position in the future.
O Programa de Imunizações ele tem um grande desafio que é o sistema de informação. Tem um sistema de informação nominal com informações importantes do indivíduo, como também garantir os estoques e garantir que a vacina que está prevista no calendário nacional de vacinação, ele chegue até a população, seja a população mais distante, como também reorganizar a estrutura interna do programa, fazer com que toda a equipe técnica consiga trabalhar de uma forma efetiva, que essa equipe consiga produzir adequadamente e propor estratégias de vacinação para o país de uma maneira efetiva.
A
I'm very impressed with how the Ministry of Health has adapted to low coverage after COVID-19 and the initiatives to improve routine immunization coverage as well as to restore vaccine confidence in the population.
Brazil is a very large and diverse country, and they've made tremendous progress. And one of the main recommendations is really strengthening laboratory and epidemiologic surveillance in support of the disease elimination goals. I think there's a lot of information systems that are really fantastic, but improving the linkages between those, as well as some improvements related to cold chain vaccine stock management and infrastructure as well.
Que lo que un país que acepta una evaluación está mostrando es que tiene capacidad autocrítica, que acepta ayuda externa, que no se queda con la única verdad que es la de ellos y que está dispuesta a seguir creciendo consiguiendo más información. Creo que los programas de inmunización tienen que convencer a sus autoridades de la importancia de mantener el intercambio con otros países y las evaluaciones.
Todavía hay mucho trabajo. Yo creo que la recuperación se está viendo, pero jamás podemos dar por sentado que eso se va a convertir en algo automático. Creo que en esta última milla para llegar a ese 95% donde todavía tenemos que emplearnos más, concentrarnos más, y por eso es que este tipo de ejercicios de evaluación, de ver cómo está el desempeño del programa de inmunizaciones, cobran una vital importancia, porque te permite justamente, o les permite a los países saber dónde está esa parte que le está apretando el zapato y cómo justamente salir adelante. Entonces, por eso es que son tan importantes ese tipo de ejercicios.
Brasil ha identificado muchas oportunidades de mejora que ya está implementando a través de este proceso. Brasil está demostrando que sí puede, que su política de salud en el Sistema Único de Salud con el programa de inmunización es una realidad para todos los brasileños y las personas que llegan a Brasil, sus fronteras y sus 5.570 municipios comprometidos con la salud de los brasileños y las brasileñas.
Los espacios subregionales son una oportunidad única para la cooperación entre países como una modalidad para la reducción de desigualdades y mejorar las condiciones de salud de sus poblaciones. Así, de esta manera, desde hace varios años, la organización puso en práctica la Iniciativa de Cooperación Sur-Sur para el Desarrollo en Salud, mejor conocido como CCHD. Y por medio de esta iniciativa, en el año 2023 se pusieron fondos semillas para financiar el proyecto de Cooperación Sur-Sur para la detección temprana del cáncer infantil en los países andinos. Esto en una estrecha colaboración con el convenio Hipólito Unanue, el Horas-CONU.
Dentro de los logros más importantes, tenemos la elaboración conjunta y aprobación por los ministros de salud andinos de la hoja de ruta para mejorar la atención del cáncer en niños, niñas y adolescentes en la subregión andina al 2030.
Este proyecto de cooperación sur-sur, que incluyó el intercambio de conocimientos y experiencias entre los países de toda la región andina, ha contribuido a la creación de una política subregional, de diferentes estrategias y planes nacionales que abordan de una manera muy objetiva, muy clara y muy directa lo que es la detección y el diagnóstico temprano de cáncer infantil en todos estos países de la subregión.
Lo más importante es que existe una agenda común interinstitucional que permite sumar conocimientos y experiencias en pro de la niñez y la adolescencia, generando un impacto positivo significativo en la atención del cáncer infantil.
El video que vemos ahora nos presenta de una manera muy clara, con testimonios muy sentidos, con una muestra muy definitiva del beneficio que tiene la cooperación sur-sur para el desarrollo en salud.
Los niños son de interés superior. Los niños, desde la Convención Marco de Naciones Unidas de Derechos Humanos de Infancia y Adolescencia, son de interés prioritario y su salud también. Y por eso salvar una vida de un niño es fundamental para los gobiernos y para todos los actores.
En estos momentos en La Guajira, pues tenemos varias dificultades en el acceso a la salud en las comunidades indígenas, ya que muchas de estas comunidades son comunidades dispersas, que no se encuentran muy cerca al área urbana. Entonces, esa es la primera dificultad, el acceso y las barreras que se presentan para esas comunidades para obtener un servicio de salud. Y todos los determinantes que puedan disminuir la incidencia de esas enfermedades que están afectando a la población, principalmente indígena, como es el cáncer infantil.
Cuando yo llegué a la clínica me hicieron exámenes, me hicieron radiografía, todo eso, y después me salió que yo tenía una masa. Y después ya descubrieron que es lo que yo tenía. Tenía leucemia y fibroblástica aguda. Es de esa maligna.
En ese momento cuando me dieron la noticia, eso fue duro, porque no me imaginé de que ella iba a tener eso, porque ella era una peladita sana, no tenía nada.
La OPS, desde la iniciativa de mejor atención para las enfermedades no transmisibles como el cáncer, busca fortalecer las competencias, el conocimiento de los equipos de atención primaria, y es en el marco de este enfoque de equidad, de lograr justamente afectación de los determinantes sociales, que se logra este proyecto de cooperación para fortalecer las competencias, el conocimiento de estas enfermedades del cáncer infantil en niños y adolescentes, tanto en profesionales de la salud, médicos, enfermeras y otros profesionales, asimismo también en gestores comunitarios y en toda la red de apoyo social y administrativo que se requiere para lograr un tratamiento de oportunidad, detección oportuna y también de calidad.
Para La Guajira tenemos una población bastante dispersa, una población con unos determinantes sociales muy críticos, en donde definitivamente tenemos que entrar a capacitar al personal que está cerca de esas comunidades, a los mismos líderes comunitarios, para que aprendan a identificar de manera temprana el cáncer infantil y así poder hacer un tratamiento rápido. Tenemos que fortalecer las redes de atención específicas para el manejo de esos pacientes.
Todavía hay pacientes que mueren por causas que pueden ser evitables. Por eso estamos acá, porque hacer los cursos de detección temprana le damos herramientas a los médicos para que ellos puedan detectarlo tempranamente, hacer un tratamiento oportuno y evitar así la muerte temprana en nuestros pacientes.
Hace poquito me dijeron que la masita que ella tiene se está reduciendo al 75%. Ha reducido mucho.
Dejo que lo cuiden mucho porque está dando mucho la leucemia y el cáncer. Y obsérvalos, no deje de observarlo.
Y aunque sea un niño, yo soy un vencedor. Yo vivo feliz porque tengo a Dios. Y aunque sea un niño, yo soy
a ella le preguntan qué se quiere ser y ella dice, no, yo quiero ser doctora.
Desde el 2021, la Organización Panamericana de la Salud pone en marcha el proyecto Mejorando la Salud de las Mujeres y las Adolescentes en Situación de Vulnerabilidad en Bolivia, Colombia, Ecuador, Guyana, Honduras y Perú, con el apoyo financiero del Gobierno de Canadá para abordar algunos de los desafíos más apremiantes relacionados con la salud de las mujeres y las adolescentes.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
Fortaleciendo las capacidades de más de 45.600 personas, incluyendo proveedores de salud, servidores públicos y trabajadores de salud comunitarios, como las parteras tradicionales, el proyecto ha contribuido a fortalecer los sistemas de salud desde la atención primaria y a expandir el acceso a los servicios de salud sexual y reproductiva en los 6 países. También ha apoyado la creación de alrededor de 100 orientaciones técnicas para mejorar la calidad de la atención y ha desarrollado iniciativas innovadoras de telesalud para optimizar los resultados de salud materna y neonatal. Partiendo de un abordaje integral y promoviendo la igualdad de género, el proyecto ha fomentado el empoderamiento de las mujeres y adolescentes para que puedan tomar decisiones informadas sobre su bienestar y participen activamente en aspectos relacionados con sus derechos de salud sexual y reproductiva.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Además, considerando la diversidad cultural, se ha implementado la metodología de diálogos de saberes, promoviendo que las comunidades se acerquen cada vez más a los centros de salud a través del intercambio de visiones sobre temas como el embarazo adolescente y las violencias de género. El proyecto se lleva adelante de manera coordinada con los ministerios de salud, la sociedad civil y líderes y lideresas comunitarias en los 6 países, haciendo posibles espacios de intercambio, capacitación y transferencia de conocimientos. La alianza entre el Gobierno de Canadá y la OPS es fundamental para continuar los esfuerzos de mejorar la salud de las mujeres y las adolescentes en situaciones de vulnerabilidad, con miras no solo de avanzar hacia el cumplimiento de los Objetivos de Desarrollo Sostenible, sino para continuar impactando positivamente en la vida de las mujeres y que en un futuro cercano, sin dejar a nadie atrás, todas puedan ejercer su derecho de salud sexual y reproductiva.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
En pile cas de complications obstétricales chez les grandes multiparts. C'est des complications que tu as éviter si tu as une campagne très large, si tu as une connaissance beaucoup plus accessible par rapport à la question de santé maternelle et reproductive.
M'tap di yo planin nan pa an, tout moun ap kouri di planin an pil bagay la dan. M'tap di yo planin nan pa an, y a an pil femme ka pense, y gon problem, Mais moi, même pendant que je suis informé, je ne suis pas rentrer dedans, je pense que c'était un problème, mais pendant que je suis rentré, moi, il n'y a pas rien.
WHO support to the Ministry of Public Health and Population in the field of reproductive health in Haiti is made possible through the Universal Health Coverage Partnership. It's a core component of WHO's special program on primary health care. It aims to strengthen the leadership of ministers of health in building equitable, resilient, and efficient health systems on our primary health care approach. PAHO WHO technical cooperation is not limited to trainings and the provision of contraceptive devices. It also aims to create an environment where every woman can make informed decisions about her reproductive health. Improving women's access to family planning and long-acting contraceptive methods is essential to ensuring their autonomy and well-being.
La semana de vacunación en las Américas se ha convertido en el movimiento más grande de la región en favor de la vacunación desde hace 22 años. Con más de 40 países y territorios participantes y la generosa contribución de socios y donantes, hemos logrado un hito extraordinario. Más de 1.15 billones de personas vacunadas y la eliminación de 6 enfermedades en nuestra región. Cada año, los profesionales de la salud llegan a los lugares más remotos para unirse a miles de personas que celebran la seguridad y la protección que traen las vacunas a sus vidas. Los esfuerzos de los países por recuperar las coberturas de vacunación durante la semana de vacunación en las Américas ponen de manifiesto su determinación para construir comunidades más fuertes y saludables. Este es el momento para asegurar un mañana más seguro para todos. La inversión y el fortalecimiento de los programas de inmunización debe continuar para proteger a las poblaciones de las amenazas latentes. La vacunación es un compromiso por el bienestar.
we introduced the Jerónimo Venegas Strategic Reserve for Health Emergencies and Disasters of the Pan American Health Organization, located at the United Nations Humanitarian Response Depot in the Regional Logistics Center in Panama. The reserve has been established as part of a regional operational mechanism that supports countries in emergency situations by sending supplies when needed, providing a rapid, coordinated, and effective response. This is achieved thanks to the coordination among different teams, needs assessment, integration of logistics systems, and the connection of special emergency administrative processes. The technical and operational management of the reserve is under the responsibility of the Department of Health Emergencies of the Pan American Health Organization, in close coordination with technical areas and support entities at the regional level. The benefits of this mechanism include reducing delivery times, decreasing the risks of delays, ensuring safe storage, compliance with quality standards, and an integral vision of health service delivery. The reserve has provided support in situations such as floods, earthquakes, volcanic eruptions, tropical storms, hurricanes, disease outbreaks, and prolonged emergencies in the region. In addition, there is an identified and updated inventory through technical analysis based on lessons learned and experience from previous events. With this, the Jerónimo Venegas Strategic Reserve for Health Emergencies and Disasters demonstrates that, in the face of emergency situations in our region, it is a fundamental mechanism of support for affected countries to protect the most vulnerable and save lives.
La Alianza por la Atención Primaria de Salud en las Américas, lanzada en diciembre de 2023 por la Organización Panamericana de la Salud, el Banco Interamericano de Desarrollo y el Banco Mundial, tiene como objetivo fortalecer los sistemas de salud de la región basados en la atención primaria, para que sean resilientes y equitativos, y avanzar hacia la salud universal. Bajo el liderazgo de los Ministerios de Salud y la colaboración entre la OPS, el BID y el Banco Mundial, la alianza promueve una acción coordinada que oriente y articule las inversiones en la salud, aproveche las innovaciones y acelere la transformación de los sistemas para mejorar el acceso y reducir las inequidades.
Desde el lanzamiento de la Alianza por la Atención Primaria de Salud, hemos visto un enorme interés por parte de los países de América Latina y Caribe. Estamos trabajando con 10 países para aumentar el compromiso y financiamiento en la atención primaria de salud, bajo el liderazgo de los Ministerios de Salud y con nuestros socios de la Alianza, mejorando la planificación estratégica y la asignación de recursos. Ya sea para mejorar la salud materna e infantil, prevenir y gestionar las enfermedades transmisibles, ou mejorar a atenção e tratamento de enfermidades não transmissíveis, a Aliança está apoiando a los países para que inviertam, inovem e implementem melhor, basando-se na estratégia de atenção primária de saúde. Como hemos visto en el diálogo sobre financiamento de la salud organizado para el Caribe, a Aliança pode unir a los setores de salud e finanças em torno de uma agenda comum, mejorar a saúde para todos.
La Alianza está liderando intervenciones integradas y planes de acción en 10 países de Latinoamérica y el Caribe, y ha apoyado el diálogo entre salud y finanza en 8 países del Caribe. Los esfuerzos conjuntos también están enfocados en el desarrollo de 4 bienes públicos regionales.
Desde el Banco Mundial y trabajando en alianza con el BID y la OPS, estamos comprometidos en apoyar a los países a través de financiamiento, asistencia técnica y ampliando el conocimiento. Hemos formado, por ejemplo, la Comisión Lancet de las Américas, que nos ayudará a entender mejor cómo proveer una atención primaria más efectiva y que llegue a todos. Celebramos el compromiso político de varios países de la región en apostar por la atención primaria de salud como un vehículo transformador y fundamental para alcanzar la cobertura universal y cumplir nuestra meta para el 2030 de ofrecer servicios sanitarios asequibles y de alta calidad a más de 1.500 millones de personas en el mundo.
En el BID, nuestro compromiso con la salud de América Latina y el Caribe es constante. La atención primaria es una prioridad y la estamos llevando al siglo XXI. Una atención primaria moderna es fundamental para abordar los retos de salud de nuestra región, como las enfermedades crónicas y la salud mental. Además, es crucial para enfrentar desafíos globales como el cambio climático y futuras epidemias. Nuestra alianza con la OPS y el Banco Mundial fortalece aún más este compromiso. Juntos y bajo el liderazgo de los países, estamos creando un futuro donde cada persona en nuestra región tenga acceso a sistemas de salud digitales y resilientes.
Con un enfoque participativo y centrado en la acción en los países, se ha avanzado en alianzas estratégicas a nivel nacional, impulsadas por las autoridades, basándose en sus necesidades y prioridades de salud.
Con esta alianza haremos que la atención primaria sea más fuerte en cada rincón de la República Dominicana. Trabajaremos para que nadie se quede atrás. Además, promoveremos una mayor coherencia entre las iniciativas regionales de la APS para hacer que la atención médica sea más ágil, con menos fragmentación, mejor acceso y sobre todo más equidad. Invertir en la atención primaria es invertir en un futuro más justo y sostenible. La salud es un derecho de todos. Juntos estamos construyendo un sistema de salud más fuerte para un futuro donde todos estemos incluidos.
El enfoque absoluto de la Secretaría de Estado en la atención primaria en salud es absoluto. Hemos necesitado socios valiosísimos para poder hacer realidad ese enfoque que nos permita llegar a más personas y a mayor territorio. A pesar de las diferencias o de las dificultades que podamos tener en ese alineamiento, que hay que reconocer no es fácil, son más los puntos de encuentro que los de desencuentro. Y eso nos ha permitido como país grandes mejoras y mejores cosas que vendrán. Estamos optimistas, estamos esperanzados, estamos agradecidos, pero sobre todo comprometidos. La atención primaria es la clave para tener países saludables y productivos.
La alianza continuará trabajando para fortalecer los sistemas de salud en la región, basados en la atención primaria, para ampliar la cobertura y garantizar el acceso universal a la salud, para todas las personas, en todas partes.
La resistencia antimicrobiana es cuando no tomas tu medicina a su debido tiempo y a su debida hora, y eso hace que tengas una resistencia en tu cuerpo.
Los microorganismos para evolucionar necesitan determinados mecanismos que les permitan seguir viviendo. Los antibióticos, los antiparasitarios, que las hemos utilizado como medidas terapéuticas, hacen que ellos, para poder seguir sobreviviendo, desarrollen mecanismos de defensa y mecanismos que se llaman de resistencia.
La resistencia antimicrobiana es un proceso natural, pero que la actividad humana la ha acelerado a través del consumo excesivo de los antibióticos, tanto para tratar enfermedades como también para la alimentación en los animales.
Se vuelve un problema porque las enfermedades que antes se podían combatir más fácilmente, hoy nos encontramos con que no está pasando así, ¿no?
Es un problema médico porque muchos pacientes, uno les da un determinado tratamiento y ese tratamiento no funciona. Entonces tenemos que buscar líneas de antimicrobianos más elaboradas y a veces no funciona ninguna. Pero también tenemos que pensar que es un problema de la salud planetaria, porque los antibióticos no solamente llegan a nosotros por una prescripción médica, por una automedicación, sino que también vienen en alimentos.
Lo mismo que pasa en la agricultura, gran uso de plaguicidas, lo que vemos con los sistemas ganaderos
aún muchas veces los de pequeña escala, es que están altamente hacinados los animales en base a alimentos que no son propios y fundamentalmente con gran cantidad de antibióticos. Cada vez más antibióticos porque la resistencia recrea esto, más necesidad. Por un lado, punto de vista económico, más caro. Por otro lado, esos antibióticos terminan en el suelo, terminan en el agua y después terminan en nosotros los seres humanos.
Tiene que ver con que se ha perdido ese sentido de equilibrio. Ya no puedo protegerme. Y esa desprotección hace que sienta otra vez, entramos a ese círculo de violencia, de desprotección, de sentirme atacado, entonces tener que volverme en un depredador.
Tenemos que pensar un paradigma productivo diferente, cómo hacemos para que nuestros animales tengan salud. No pensar en la enfermedad y poner un antibiótico, sino qué hacemos para que no necesitemos antibióticos.
Por eso directamente, si queremos hablar también de la resistencia a los antimicrobianos y cómo vamos a paliar esto, cómo vamos a detener esto, pues hay que volver necesariamente al origen, que es volver a cuidar a nuestra madre tierra.
Es importante hablar de comunidades empoderadas. Siempre que nosotros mencionamos una sola salud, tenemos que comenzar de abajo hacia arriba. Porque abajo están las sabidurías, están los conocimientos.
Porque es la gente desde abajo, desde las comunidades que han sido también formadas en ese sentido, ¿verdad? Para que tengan información suficiente para saber cómo es el problema y para proponer soluciones. Y es importante que se haga desde abajo, desde los liderazgos comunitarios, porque son quienes están sufriendo los efectos de toda esta condición.
Todo eso hace una sola salud. Los médicos solos, esto no es un problema de salud, esto es un problema que involucra médicos, veterinarios, agrónomos, comunidad.
Y dentro de la comunidad hay actores sociales que son fundamentales, ¿no? Y entre ellos, en el área educativa, los docentes, los promotores de salud, promotores comunitarios, tienen un rol fundamental en lo que tiene que ver con la formación, con la transmisión de conocimientos, de maneras diversas, diferentes, creativas, artísticas.
Es un esfuerzo grande, hay que trabajar con productores, consumidores, con los tomadores de decisión, con los comunicadores y nos queda un largo camino.
Desde las comunidades tendríamos que hacer un llamado bastante fuerte a los gobiernos, ir a la posibilidad de retomar cambios profundos.
Porque se necesita que los estados tomen acción a través de sus autoridades y la gente tiene que presionar a sus gobernantes para que ese proceso se dé.
Muchas veces los tomadores de decisión piensan siempre en incrementar la producción, ¿no? Incrementar la producción parece, digamos, este monocultivo mental. Necesitamos producir más, necesitamos exportar más, necesitamos producir más alimentos, necesitamos ganar más plata.
Lo que yo le diría a los líderes de los países es que ellos son decisores y nosotros necesitamos que nos escuchen como comunidad, como profesionales, como ellos mismos también, ¿no? Porque ellos están involucrados en este problema.
Me parece que los adultos y sobre todo los líderes tenemos siempre una deuda hacia las infancias y que tiene que ver con respetar lo que está en la Declaración de los Derechos del Niño, el derecho a la participación, a la libre expresión en todas aquellas temáticas que a ellos los afectan.
Si cuidamos a la madre tierra, cuidamos el aire, los alimentos, los ríos y también a las bacterias.
Quiero mirarlo a los ojos, a los tomadores de decisión, para que podamos comprender las problemáticas que estamos transitando.
Habría que impulsar políticas públicas a favor de la gente, políticas públicas a favor de las comunidades.
Tomemos en cuenta esta problemática, esta gran problemática del abuso en el uso justamente de los antibióticos que está generando resistencia.
Me gustaría que las autoridades hagan campañas de salud para el buen uso de los antibióticos.
Este es un llamado por el derecho humano a la salud y la vida.
Los enfoques para abordar la RAM,
basados en la participación social y la colaboración global,
son la clave para encontrar soluciones efectivas.
Unidos en la diversidad,
mantenemos nuestro compromiso en esta causa global.
En la Asamblea General de las Naciones Unidas 2024.
Hay mucho por ver aquí. Se ha trabajado mucho por generar un impulso en el incremento de la calidad de vida de las personas.
En un mundo con menos enfermedades transmisibles, más personas tienen la oportunidad de construir vidas mejores, más saludables y seguras. Pero el impulso no puede detenerse aquí.
La pandemia de COVID-19 nos ha demostrado que mientras las enfermedades transmisibles sigan propagándose, nuestra calidad de vida está en peligro. Todos estamos en riesgo hasta que estemos seguros.
Por eso, la iniciativa de eliminación de la OPS se ha propuesto eliminar más de 30 enfermedades transmisibles y afecciones relacionadas para el 2030.
Para lograrlo, debemos asegurarnos de que todos en las Américas tengan acceso a vacunas y atención médica de calidad, que incluya diagnóstico y tratamiento oportunos, instalaciones de higiene, agua y saneamiento.
Esto no es un sueño, es un derecho y una responsabilidad de todos. Todos deberíamos tener igualdad de oportunidades para disfrutar de una vida saludable y plena. Hay mucho por ver aquí. Trabajemos juntos por un futuro libre de enfermedades para todos.
La semana de vacunación en las Américas se ha convertido en el movimiento más grande de la región en favor de la vacunación desde hace 22 años. Con más de 40 países y territorios participantes y la generosa contribución de socios y donantes, hemos logrado un hito extraordinario. Más de 1.15 billones de personas vacunadas y la eliminación de 6 enfermedades en nuestra región. Cada año, los profesionales de la salud llegan a los lugares más remotos para unirse a miles de personas que celebran la seguridad y la protección que traen las vacunas a sus vidas. Los esfuerzos de los países por recuperar las coberturas de vacunación durante la semana de vacunación en las Américas ponen de manifiesto su determinación para construir comunidades más fuertes y saludables. Este es el momento para asegurar un mañana más seguro para todos. La inversión y el fortalecimiento de los programas de inmunización debe continuar para proteger a las poblaciones de las amenazas latentes. La vacunación es un compromiso por el bienestar y la salud de las Américas. Actuemos ahora y protejamos el futuro de todos.
Más de 50 profesionales de la salud de 29 países de América Latina y el Caribe se reunieron en la ciudad de Panamá para un taller de 3 días, organizado por la Organización Panamericana de la Salud, OPS, en colaboración con el Centro Nacional de Capacitación y Educación en Patógenos Emergentes Especiales, NETEC.
Creo que es una excelente oportunidad por reunir como equipo bastante multidisciplinario para abordar una parte quizá que lo que la preparación en general a la emergencia, más sobre todo también a que lo que puede ser epidemia, pandemia, que muchas veces creo en los últimos años no hemos considerado suficiente. Hablamos mucho de que lo que puede ser los planes de preparación, hablamos mucho de la vigilancia, hablamos mucho de los servicios de laboratorio, y son seguramente muy importantes en el ámbito de lo que la seguridad sanitaria. Sin embargo, muchas veces nos olvidamos que al inicio de la pandemia, siempre, de una epidemia, siempre hay un brote, ¿no? Hay siempre la emergencia o la importación de un patógeno y tenemos oportunidades en ese momento también, en esta primera 100 millas, en esta primera 4 semanas, ¿no? De realmente poder interrumpir la transmisión justamente al inicio de cuando se está generando.
Los participantes aprendieron las directrices revisadas para el transporte seguro de pacientes con enfermedades infecciosas, garantizando una mejor preparación para futuros brotes.
The partnership between NETAC and PAHO is critically important. When we talk about communication, coordination, and collaboration, we have to be able to work together. We have to have succinct and synergistic plans. So this workshop has really given us the opportunity to partner together and continue that collaboration and be able to foster future collaborations as well.
importancia de estos talleres donde reunimos personal asistencial, expertos en temas de manejo clínico, control de infecciones y evacuación médica, y además el personal logístico, es importante porque nos permite darle una visión integral a las operaciones de emergencia. Las operaciones de emergencia van desde lo técnico hasta lo logístico y operativo. Y la manera de garantizar que podamos brindar el mejor servicio a las comunidades es tener personal entrenado, no solo en su campo, sino que pueda ser interoperable con los demás, para poder tener un sistema congruente que se permita monitorear, que pueda llenar las brechas en cuanto a conocimiento o necesidades de otro tipo, y pueda garantizar esa última milla que permite que la gente que sabe qué tiene que hacer tenga los elementos necesarios para operar y garantizar la intervención ante un brote o un brote de alguna enfermedad o algún evento de origen natural o de cualquier otro origen.
Enriquecedor, maravillosa.
It is very informative and I think very practical. Very often we get information, but when you put both of those together, it just makes the entire concepts very much more meaningful. So I think it's beautiful the way it has been designed and for learning purposes as well.
Sensacional, la verdad es como lo definiría. Mucho aprendizaje, mucho enriquecimiento cultural por parte de todos los compañeros. Nos da como una perspectiva más amplia para llevar a nuestros países de cómo se hace en el resto de las Américas, y básicamente el curso con todos los temas que se tocaron yo lo pudiera catalogar como sensacional.
Excelente, muy integrador, con muy buena combinación de la teoría y la práctica, muy bueno.
Interesante, y lo más novedoso es la integración de toda Latinoamérica y el Caribe.
Interesante, innovador y con muy buenos puntos y temas a tocar.
Académico y pedagógico.
Me parece muy enriquecedor esos espacios, sobre todo el saber cómo se maneja en otros países, el escuchar cómo se da el manejo de la vigilancia de los pacientes, de la parte clínica, y pues todo lo que la Organización Panamericana de Salud nos ofreció. Me pareció muy atractivo las herramientas que utilizaron.
Los participantes mejoraron el uso de equipos de protección personal y protocolos de descontaminación, y recibieron las últimas guías para tratar la influenza grave, incluidas demostraciones de expertos de la red Sarinet de Brasil, Chile y Colombia. Este taller proporcionó actualizaciones clave, formación práctica y oportunidades de crear redes de contacto, fortaleciendo la capacidad de los profesionales de salud de la región para responder mejor a los brotes de enfermedades infecciosas.
Since 2021, the Pan American Health Organization, PAHO, has been implementing the Improved Health of Women and Adolescent Girls in Situations of Vulnerability project in Bolivia, Colombia, Ecuador, Guyana, Honduras, and Peru. With financial support from the Government of Canada, this project addresses some of the most pressing challenges related to the health of women and adolescents.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
By strengthening the capacities of more than 45,600 people, including healthcare providers, public servants, and community health workers, such as traditional midwives, the project has contributed to strengthening health systems from primary care and expanding access to sexual and reproductive health services in the 6 countries. The project has also supported the creation of about 100 technical guidelines to improve the quality of care and has developed innovative telehealth initiatives to optimize maternal and neonatal health outcomes. Taking a comprehensive approach and promoting gender equality, the project has fostered the empowerment of women and adolescents so they can make informed decisions about their well-being and actively participate in matters related to their sexual and reproductive health rights.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Additionally, considering cultural diversity, the Knowledge Dialogues methodology has been implemented by exchanging perspectives on issues such as teenage pregnancy and gender-based violence, encouraging communities to increasingly attend health centers. The project is carried out in coordination with ministries of health, civil society, and community leaders in the 6 countries, creating spaces for exchange, capacity building, and knowledge transfer. The alliance between the Government of Canada and PAHO is essential to continue efforts to improve the health of women and adolescents in situations of vulnerability. This collaboration aims not only to advance towards the achievement of the Sustainable Development Goals, but also to continue to positively impact the lives of women so that in the near future, all can exercise the sexual and reproductive health rights, leaving no one behind.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child, it's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So.
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's right to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área da telesaúde. Isso aí, para mim, é como fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Oi, eu sou a Rafaela e eu ouvi dizer que o escritório da OPAS no Brasil está fazendo um monte de coisas legais para cuidar do meio ambiente e eu vim aqui ver de perto.
Oi, eu sou Matias. Será que a OPAS é verde mesmo? Oi, sou Liz, quero trabalhar aqui no futuro.
Oi, bem-vindos à OPAS, crianças!
Nós ainda temos containers maiores que também podem ser usados para papel, para papelão, ou seja, tudo aqui pode ser reciclado.
Tá vendo essas bicicletas aqui? Ó, isso aqui a gente fez para os colegas nossos aqui da OPAS que quiser pedalar, elas ficam aqui disponíveis para todo mundo.
Aqui na OPAS a gente não usa nada descartável, só copos e garrafas reutilizáveis. E olha só que legal, nosso mexedor é de bambu.
Nós também acabamos de instalar uns painéis para captar energia solar.
A OPAS também tem um sistema de irrigação e só uso o necessário.
Oi, Rafa, para finalizar, vou mostrar para vocês os 120 ipês amarelos que nós plantamos e que hoje estão pequenininhas, mas no futuro vão ficar grandes igual aquela lá atrás.
Nós estamos cuidando do planeta também aqui. Estamos cuidando para vocês.
Nosotros como Oficina de País en Nicaragua nos encaminamos a una oficina verde tomando en consideración el consumo de papel para nuestras impresoras. Tenemos una estadística que desde el 2019 fue la última vez que se compraron resmas de papel en una cantidad de 180 resmas. En el 2024 tenemos un saldo de 136 resmas. Eso indica de que solamente se han utilizado 44 resmas en 5 años, a razón de un promedio de 8.8 resmas por año en consumo. Esto también implica, si hay una reducción del consumo de papel, hay una reducción también de tóner para nuestras impresoras. La representación en Nicaragua se unió a la modalidad de trabajo en casa, lo que permitió una reducción de consumo de papelería y tóner en esta oficina. Como organización debemos de ser parte activa de la ecologización de nuestras instalaciones, adoptando políticas ambientalmente sostenibles con prácticas modernas de ahorro de energía, reducción de residuos y reciclaje.
Desde el equipo de OPS en Colombia estamos comprometidos con la sostenibilidad. La sostenibilidad para proteger el medio ambiente y sobre todo para cuidar de la salud de cada uno y cada una de nosotros, los habitantes en este hermoso planeta.
Desde el 2023, la representación en Colombia aplica dentro de la evaluación de eventos competitivos criterios de sostenibilidad.
Solicitamos a nuestros proveedores el uso de empaques biodegradables o de más de un uso, la alimentación saludable y el manejo de residuos al final de los eventos.
Promovemos desde la planificación del evento el uso de la tecnología en vez de la impresión de material. Esto con el fin de ayudar al medio ambiente y a la optimización de los recursos de la organización.
Hemos tenido muy presente la sostenibilidad, no solamente en términos de lo que ha sido toda la construcción para nuestras nuevas oficinas, sino también en cada una de nuestras actividades, pensando en cuáles son los mejores materiales, el poder reducir el uso del papel y, por supuesto, velando por esa salud de cada una y cada uno de los miembros del equipo del OPS en Colombia.
Los interruptores inteligentes nos ayudan a un ahorro más eficiente de la energía. Asimismo, contamos con UPS. Esto nos ayuda a hacer un ahorro entre el 20 y el 30% de nuestro consumo de todos los equipos que tenemos en la oficina.
El compromiso con la sostenibilidad es una tarea de todos. Es por eso que desde OPS Colombia queremos dar ese ejemplo y poder continuar en este trabajo.
Anissa, pour nous arriver à tout le monde même chance, nous travaillons avec un pile l'hôpital. Pour nous arriver, faire promotion à l'école maternelle et soutenir maman qui a bay tété seulement pendant 6 premiers mois la vie on petit monde. Comme ça, nous gagnons l'hôpital Trou du Nord qui déjà passé 2 évaluations internes et qu'on y a capté une évaluation externe dans début mois de septembre pour nous arriver certifié comme hôpital ami des bébés. Ça veut dire un hôpital qui est ami des bébés côté tout personnel là depuis prend directeur pour arriver joindre sécurité dans barrière, tout le monde met ensemble pour faire toute femme qui est enceinte qui vient accoucher connaît que c'était seulement pour bailler petit monde pendant 6 premiers mois la ville.
L'initiative Hôpitaux Amis des bébés garantissent que les maternités dispensent des informations et du soutien continu aux mères en respectant aussi les besoins et les rythmes naturels des nouveau-nés.
Ensemble, ces actions contribuent à améliorer la santé et le bien-être des nourrissons en Haïti, offrant à chaque enfant un meilleur départ dans la vie grâce à l'allaitement maternel et contribuent à la réalisation des objectifs de développement durable.
Hoy visitamos esta sala de vacunas Padre Monchi, aquí en Foz de Iguazú, el equipo de evaluación externa, y hemos evaluado y analizado y conversado con los colegas y trabajadores de la salud del sistema.
Buenas tardes, delegados y delegadas. Vamos a contar el...
Delegates, I'm going to count the number of people in their seats. I would ask the delegates to please take their seats behind their name card.
La evaluación consiste de varias fases, la primera de las cuales es parte del país, en el cual utiliza un instrumento de autoevaluación, y posteriormente un equipo de expertos viaja al país, visita, conoce la realidad en territorio y de esa forma les permite identificar potenciales oportunidades de mejora, recomendaciones y también fortalezas que deben ser sostenidas a lo largo del tiempo y eventualmente compartidas con otros países de la región para fortalecer las capacidades no solo a nivel nacional, sino a nivel regional.
A avaliação externa voluntária ela vem num momento muito importante para o Brasil. É um momento que o Programa Nacional de Imunizações ele passa por mudanças y reajuste, ele está tendo una reorganización, una reestructuración.
Lo importante de las evaluaciones es que son un mecanismo que permite al país que las solicita poder tener una idea clara de cuál es su situación actual, no solo desde su propia autoevaluación que el país la hace, sino desde la visión de un evaluador externo, lo cual no solo
perspectives and these opportunities for peer learning, it's great because they can actually see things with other eyes, bring fresh perspectives, and see what are the gaps that they have not thought through, and finally address those, because that will put the programs in a much better position in the future.
O programa de imunizações ele tem um grande desafio que é o sistema de informação. Tem um sistema de informação nominal com informações importantes do indivíduo, como também garantir os estoques e garantir que a vacina que está prevista no calendário nacional de vacinação, ele chegue até a população, seja a população mais distante, como também reorganizar a estrutura interna do programa, fazer com que toda a equipe técnica consiga trabalhar de uma forma efetiva, que essa equipe consiga produzir adequadamente e propor estratégias de vacinação para o país de uma maneira efetiva.
Perfecto, ahí tenemos.
We have the statutory quorum with which to start our meeting. Madam President, thank you. Good afternoon. Now resuming 4.7, Strategy and Plan of Action to Strengthen Tobacco Control in the Region of the Americas, 2025-2030. We give the floor to Costa Rica. Thank you very much, Madam President. In November of 2023, Costa Rica had its first case of pulmonary infection resulting from the use of electronic cigarettes in a teenager. There are increasingly more people who are diagnosed with diseases associated with vaping. Now, the text says that the consumption of tobacco, the use of tobacco, continues to be one of the main threats in public health and urges for there to be full compliance with the commitments adopted in 2003. Now, we do know that electronic systems for administering nicotine and vaping or electronic cigarettes are included, but now there are even more advanced vaping devices, but the nomenclature that we use and the actions proposed here, that is, we're fighting against an industry that reinvents itself daily, zeroing in on young people. It's very worrisome that these new devices are being exploited to administer not just nicotine, but harder drugs. Now, I want to know what are the components that some of these vaping cartridges contain. 42 compounds, according to according to European Chemical Agency. 8 of them are toxic. Now, with higher levels of nicotine than are allowed in the European Union. Based on that, it's necessary for us to have regulations that regulate the content of these liquids with technological health oversight so that we can have the necessary information and have all of this mapped out. Now, my work is to push through a draft law to address this void of legislation, but I think that PAHO needs to move forward as quickly as industry does, because only one country has done something about the importance of these strategies.
Yes, Costa Rica.
Thank you, Costa Rica. I give the floor to Panama.
Gracias, señora Presidenta.
Thank you, Madam President. Panama welcomes this and reiterates its commitment to this strategy and plan of action that will strengthen the effective application of the framework agreement, strengthening national tobacco control regulations with some specific regulations in keeping with the 6 measures recommended by WHO with better provisions to prevent and control use. Now, the 5 strategic lines are in keeping with sustainable moving toward the achievement of these goals by 2030 and reducing mortality and the disease burden associated with tobacco use in keeping with the SDGs. Scientific evidence shows with statistical certainty that applying these measures to all tobacco products is the best way to avoid the change of use from one product to the next. I feel compelled to mention the inequalities in the implementation of these measures in our region, because the promotion and the application of measures and legal technical assistance and ongoing development of capacities, including mobilizing financial resources, will strengthen the application of these measures that are not very well implemented yet in our region. Panama agrees with these measures, and we stress the importance of there being a technical cooperation to ensure a comprehensive application. And the strategic line 5 is of the utmost importance given the attempts of meddling or interference by tobacco companies who define their interests. Now, with sustainability, equity, and responsibility to protect the most vulnerable among our populations, we should speed up the application of the framework agreement in the Americas.
Ahora sigue Guyana.
Thank you, Panama. Guyana.
Madam Chairman, Guyana acknowledge the high prevalence of morbidity and mortality related to the NCD and the impact of tobacco use as a preventable risk factor. Guyana also acknowledge the importance of taking strategic steps towards reducing the heavy social, economic, and environmental burden related to tobacco use and the threat it poses to public health. We are also cognizant of the ongoing growing marketing strategies of the industry and of the tobacco industry and the products together, like use of e-cigarettes and also heat-related tobacco products, and the targeting of our youths. Over the past year, Guyana has undertaken key steps that have aligned to the strategy. These included things like the 2017 Tobacco Act that we passed in 2017, also the increased taxation for tobacco products, the implementation of the packaging requirements, and also enforcement of the tobacco smoking-free tobacco smoke space. To advance the implementation of the Framework Convention on the Tobacco Control, Guyana supports the 5 strategic lines of action as proposed, and also support the proposed M&E framework that is related to this strategy. Thank you.
Muchas gracias, Guyana.
Thank you, Guyana. I give the floor now to Antigua and Barbuda.
Cedo la palabra ahora a...
I give the floor to Honduras. Good afternoon. Thank you, Madam President. Honduras agrees with the draft resolution strategy and plan of action to strengthen tobacco control in the region of the Americas 2025-2030, and believes that the greatest priority should be given to tobacco use as a public health problem, and to adopt the plan of action of WHO PowerCo 2025-2030 in order to effectively apply the sustainable agenda for the Americas and the world strategy to reduce the use and consumption of tobacco, given that this is a pandemic that daily harms the health of Hondurans, leading to a rise of non-communicable chronic diseases associated with tobacco use. B, the world strategy to accelerate the control of tobacco. That is, we have to promote sustainable development by applying the framework agreement for the control of tobacco 2019-2025 of the WHO, which was extended until 2030, as well as through different international human rights instruments that have been ratified by the member states. C, that the standards governing or regulations governing the sale or putting sanctions be enforced, and that the FCTC of WHO be viewed as the best investment to avoid non-communicable diseases. That's the basis and the essential part of this plan of action to create a more sustainable, healthy, and equitable environment, prioritizing the protection of young people, women, and low-income people. E, to undertake preventive work with the purpose of reducing considerably mortality and the burden of disease resulting from tobacco use in the short and mid-term. F, to work toward the elimination of illicit trade in tobacco products. The law for the oversight and control of tobacco use achieves the most effective measures for the purpose of preventing and controlling nicotine or tobacco use and addiction to nicotine, ensuring that everyone can enjoy the best possible health possible. The National Center for Treatment of Addictions in Honduras offers care to that part of our population that seeks assistance in kicking the tobacco habit. Thank you. Thank you, Honduras. I give the floor to Brazil. Thank you very much, Madam President. Brazil welcomes its new strategy and plan of action to strengthen the control of tobacco in the region of the Americas 2025-2030 and supports wholeheartedly the resolution before us. The lines of actions contained in the document will strengthen the implementation of the FCTC and the adoption of measures to reduce the use of these harmful products derived or not from tobacco and leading to and all the death and morbidity and mortality associated with tobacco use. Now, we promote the following measures: tax laws that selectively tax certain tobacco products, keeping up the ban of vaping devices, moving toward forwarding this protocol, protective measures for the environment, and finally, ensuring that the tobacco industry pay back all costs incurred by the use of tobacco products and that these cases be carried out in court. The Brazilian government is grateful for the document that's been prepared by PAHO, and thank you very much. Thank you, Brazil. I'll give the floor now to Argentina. Thank you, Madam President. Argentina takes note of and is grateful for the presentation of this strategy. After the passing of the tobacco control law, Argentina has moved forward in strengthening the oversight or enforcement process called for in our national legislation at the local level as well, monitoring the impact of raising taxes and also improving standards on promoting and developing regulations for tobacco in primary health care centers of the country. In the same line, the health ministry promotes the renewal of health warnings for alcohol and tobacco to discourage consumption among young people and to strengthen the oversight carried out at the provincial level. Now, on this, Argentina bans the sponsorship or the advertising as well as the sale of electronic cigarettes since 2011 and related products from 2016 on. This is a priority topic in the region, given that the threat that these products represent for children and adolescents. Regarding the strategic lines, we think that it's very important to establish guidelines, and WHO, PAHO are a part of that, so that we can eliminate all forms of cross-border advertising, especially of those new and emerging products, such as electronic devices that liberate nicotine, as well as heated tobacco products. We would also like to see strengthened national policies to ban all types of advertising and promotion of these products, and to regulate the sale right through to its banning where appropriate, especially of flavored products and that are otherwise attractive to children and adolescents, and also to ban the sale of these products to children and adolescents. So we do think that the approval of this proposed resolution is the right thing to do. Thank you, Argentina. I give the floor now to Belize.
Thank you, Madam President. On behalf of Belize, I would like to express our gratitude for the opportunity to address Agenda Item 4.7 concerning the strategy and plan of action to strengthen tobacco control in the region of the Americas for 2025-2030. This initiative holds critical importance for our nation as we continue to confront the pervasive impacts of tobacco use on public health. Tobacco use remains a leading cause of preventable death and illness in Belize, contributing significantly to our burden of non-communicable diseases. As a nation, we recognize the urgent need to implement comprehensive tobacco control measures in alignment with the WHO's Framework Convention on Tobacco Control. Belize is committed to advancing tobacco control and is already making strides through the development of our draft tobacco bill, which was supported by the Pan American Health Organization. This bill encapsulates our dedication to regulate the use, commercialization, and advertising of tobacco products, including emerging products like e-cigarettes. We are eager to see its approval by our Parliament, which will enable us to commence the implementation of its provisions. We endorse the outlined strategic actions particularly those focusing on regulatory frameworks, taxation measures, and public health campaigns. Increasing taxes on tobacco products is a proven method to reduce consumption and generate revenue for health initiatives, an approach Belize is keen to adopt. Public awareness and education are pivotal. We are preparing to implement the 2024 Global Youth Tobacco Survey, which will furnish us with essential data to inform our campaigns, focusing on youth education and prevention. Integrating tobacco control education into our curriculum will empower our young people with knowledge about the dangers of tobacco use. Belize is committed to enhancing smoke cessation support by expanding access to cessation programs treatment. We aim to provide individuals with the necessary resources to quit smoking, thereby improving health outcomes and reducing healthcare costs. Thank you.
Muchas gracias.
Thank you, Belize. I give the floor to Chile. Thank you very much, Madam President. Chile has worked hard to align our national laws with the WHO, FCTC, and the Protocol for the Elimination of the Illicit Trade in Tobacco Products. We have no doubt that the proposed measures in this strategy under examination are necessary to reduce the prevalence of tobacco use in our population, and policies for smoke-free environments, as well as the banning of advertising, promotion, and sponsorship. And, without a doubt, will help us achieve our goals. While our country has made meaningful strides, we recognize the need to strengthen our strategy to achieve the proposed goals, which is why we are progressing in the implementation of programs that are affordable and effective, and to step up the measures that would raise the price of tobacco, as well as controls on products, and also the adopting the protocol of illicit use of tobacco products. We continue to work toward reducing the impact of tobacco use in our population, thereby protecting public health and promoting a future free of tobacco. Chile fully backs the presented strategy. Thank you very much.
Muchas gracias, Chile. Ahora se...
Thank you, Chile. I give the floor to Jamaica.
Thank you very much, Madam President. Jamaica wishes to thank PAHO for this timely updated strategy to accelerate action to meet targets of tobacco control in the region of the Americas. Jamaica wishes to confirm our unwavering commitment to achieving these targets, and thanks PAHO for their continued leadership and technical support in advancing tobacco control in Jamaica. Madam President, we are concerned about the slow progress of member states in making environments completely smoke-free, which requires further assessment to close this gap. Of significant concern to Jamaica is the use of e-cigarettes and vaping among children and adolescents and young adults, along with the general use of cannabis and the proliferation of hookah bars. The regulation of e-cigarettes is a significant step that will address this concern. Accompanying this proposed strategy and action plan, it will be essential to have a robust public education campaign, especially to debunk the myths around e-cigarettes and use of hookahs, that they are safe alternatives to smoking and not harmful to health. We should also ensure that the tobacco control response is integrated into the NCD response. The existing tobacco control regulations of 2013 reflects protection from exposure to tobacco smoke, regulation of tobacco products, disclosures, and packaging and labeling of tobacco products. Jamaica is promulgating a new legislation which will include the regulations of the interactions of government officials with the tobacco industry, testing and measurement of contents and emissions of tobacco products, promoting of communication and public awareness of tobacco control issues, and the health risk of tobacco consumption and exposure to tobacco smoke-free, prohibition of tobacco advertising, promotion, and sponsorship, including a ban on point-of-sale tobacco displays, and the increase in the size of graphic health warnings from 60% to 80% of the principal areas of tobacco products. Finally, Jamaica will embark on a public education campaign to address these issues, supporting the enforcement of existing regulation and garnering support for the new legislation, Tobacco Control Bill 2020, which will bring us into full compliance with our obligations under the Framework Convention on Tobacco Control in the coming months. Thank you, Madam President.
Muchas gracias, Jamaica.
Thank you very much, Jamaica. I give the floor now to the U.S.
The United States appreciated the intersessional consultations and work leading to the strategy and plan of action to strengthen tobacco control in the region and welcomes the 5 strategic lines of action outlined. We are pleased to see the inclusion of measures to regulate the use, commercialization, and advertising of tobacco and other emerging products, as well as price and tax-related measures to reduce consumption and to counter interference attempts by the tobacco industry. Despite progress, tobacco use and exposure to secondhand smoke still claim lives daily. A commitment to health equity involves understanding social, economic, and demographic factors that drive disparities in tobacco use and ultimately contribute to a non-communicable disease, disability, and death. The United States thanks PAHO for its steadfast commitment to work to accelerate progress in reducing tobacco use and premature death from NCDs. The United States continues to take action to reduce tobacco use and related disparities with programs like BeTobaccoFree.gov's tobacco-free campaigns, Tools to Quit Now, and other similar initiatives. We look forward to updates on implementation of the strategy as well as its midterm review in 2028. Thank you.
Muchas gracias.
Thank you, United States of America. I now give the floor to Antigua and Barbuda.
Thank you. Antigua and Barbuda supports the strategic lines of action found within document CD 61/10 to facilitate the implementation of the WHO Framework Convention on Tobacco Control in line with reaching Sustainable Development Goal Target 3.4 on non-communicable diseases and mental health. The 4 groups of diseases which account for more than 80% of premature deaths, cardiovascular diseases, cancers, respiratory diseases, and diabetes all have a strong risk factor, tobacco use. The Caribbean region acknowledges the rising threat of tobacco use, which has been fueled by the introduction and marketing of new and emerging nicotine-containing products. Antigua and Barbuda recognizes the urgent need for a whole-of-government and whole-of-society approach to enactment of comprehensive regulations. Tobacco control is strengthened by the implementation of the 2018 Tobacco Control Act and 2024 Tobacco Control Regulations, which will allow bold label warnings, increased prices, and importation taxation on tobacco and nicotine-containing products, addressing tobacco industry interference and conflict of interest, bans on sale of tobacco and nicotine-containing products to minors, and tobacco advertising, promotion, and sponsorship. A strong collaborative multi-sectoral approach is essential to the successful outcomes of combating the raging epidemic and the dire consequences of tobacco use. I wish to underscore the country's continued commitment and express our gratitude to PAHO for the technical support in the execution of the plan of action. We seek continued assistance in this regard. Thank you.
Thank you, Antigua and Barbuda. There is a specialized UN agency that is one of the NSAs that would like to speak. So I call on Movendi International.
Madam President, we commend the Secretariat and Member States on the strategy. We support the full implementation of the FCTC. The members of Movendi International in the Americas region are deeply concerned about the health and development burden caused by the tobacco industry. In response to the tobacco epidemic, we see that it is important to identify and address the deep links between the tobacco and alcohol industry. Already in 2013, a landmark study revealed that the combined resources of tobacco and alcohol companies have affected tobacco control legislation. These alliances help to create the perception that there is a broader base of opposition to tobacco control. The researchers wrote, Advocates should be aware of the covert alliances between tobacco, alcohol, and other industries and expose them to correct this misperception. And in 2019, my Cambridge and Morris showed unmistakably that tobacco company internal documents reveal how the big alcohol and big tobacco have long collaborated in advancing shared interests in interfering against public health policy. Importantly, internal tobacco documents show that there is a long history of cross-ownership that makes it unwise to think of them as separate entities. In the response to the tobacco epidemic, Movendo International calls for more integrative perspectives and greater attention to the harms of the alcohol industry and how both industries support each other in profit maximization and public health policy interference. We need greater policy coherence, and we need partnerships to advance the WHO best buys for both tobacco and alcohol. Thank you.
Thank you. I thank Movendo International, and I call in the UN Program for the Environment. Madam President, distinguished delegates, thank you for the opportunity to speak. The UN Program for the Environment welcomes a presentation of the Strategy and Plan of Action to Strengthen Tobacco Control in the Region of the Americas 2025-2030. UNEP recognizes the need to prevent the adverse effects of production, consumption, and post-consumption of tobacco on the environment and its contribution to climate change, loss of biodiversity, and pollution, including plastic pollution. Tobacco has a legacy that remains for a long time in the environment. Cigarette butts lead the list of waste. This affects biodiversity. It becomes part of the food chain, and this is associated with serious changes in human health. That would be changes in genetics and cerebral chemistry. So packets of cigarettes produce waste along with other e-products. This added to the direct effect of smoking and also secondary smoke, as well as the lack of biodiversity, pollution, and CO2 emissions associated with raising tobacco. We recognize this strategy as an important opportunity to strengthen intersectoral work to deal with the threat that tobacco represents to human health, to our ecosystems, and to the environment. Thank you. I wanted to thank the United Nations Environment Program, and I call on the World Heart Association. Thank you.
Federation applauds the World Health Organization and its member states for the strategy. We note with concern that tobacco industry interference remains the single greatest obstacle to the implementation of life-saving tobacco control policies. The industry has a long-standing history of systematic interference in health and regulatory science, creating unnecessary and harmful controversy among the public, healthcare professionals, and policymakers through industry-funded research to promote its products. The spread of misleading claims and aggressive marketing strategies have largely contributed to the misconception that newer tobacco and nicotine products are harmless. However, contrary to industry narrative, studies have associated products such as e-cigarettes and heated tobacco products with a greater risk of cardiovascular disease. In addition, they demonstrate limited effectiveness as cessation tools in real-world settings. We urge member states to fully implement the WHO Framework Convention on Tobacco Control to protect their populations from the health, social, economic, and environmental harms of both traditional and newer tobacco and nicotine products, specifically focusing on Article 5.3, 6, Article 6, Article 8, Article 11, Article 13, and 14. Further, we call on all stakeholders to implement the recommendations outlined in our WHF policy briefs on nicotine and e-cigarettes to protect younger generations. Thank you.
Muchas gracias a la Asociación.
I wanted to thank the World Heart Organization, and I recognize the Caribbean Coalition, the Healthy Caribbean.
The Coalition applauds PAHO for the development of this strategy. In particular, for the Caribbean region, we are delighted to see the incorporation of an equity perspective to encourage prioritization of population health over industry profits, responsiveness to changing consumption patterns covering conventional and emerging tobacco products, support for a total ban on advertising, promotion, and sponsorship of tobacco products, recognizing the challenge posed by digital marketing, and endorsement of health-harming products by social media influences, and highlighting tobacco taxes as the most cost-effective intervention for reducing tobacco use. Uneven progress among CARICOM member states in implementing tobacco control measures, in particular smoke-free public spaces, tobacco taxes, and bans on tobacco advertising, promotion, and sponsorship, has been compounded by an alarming increase in the use of electronic cigarettes amongst adolescents and youth. One of the main obstacles to implementing the mandates of the FCTC remains persistent industry interference, worsened by overall weak governance, including the absence of effective conflict of interest policies. We call on member states to commit to implementing the strategy and plan of action, prioritizing tobacco taxation, bans on tobacco product advertising, expanding tobacco control policies and programs to include emerging tobacco products, public education campaigns to highlight the health harms of tobacco and e-cigarette use, and strengthening of measures to proactively prevent tobacco industry interference. Finally, Madam President, the HCC wishes to use this opportunity to register our concern with the absence of an agenda item on regional preparations for the 4th UN high-level meeting on NCDs in 2025. Thank you.
Thank you. I thank the Healthy Caribbean Coalition. Now I give the floor to Tobacco-Free Kids.
I would like to address the strategy and plan of action to strengthen tobacco control in the region of the Americas from 2025 to 2030. Nearly 20 years since the entry into force of the WHO Framework Convention on Tobacco Control, there are success stories throughout the region of the Americas, where it has been demonstrated that tobacco control measures consistent with the Framework Convention are viable from legal, economic, and political perspectives. This success is largely due to the strong collaboration between PAHO, national government, civil society, and academia. Tobacco is uniquely dangerous, and all tobacco products are harmful to health. By extension, health warnings, plain packaging, and advertising bans should be universally applied and without exception, especially as these are evidence-based and proven measures that reduce consumption and protect everyone, especially children and adolescents. Indeed, the right to health must be above any commercial interest. We applaud Brazil for being the second country after Turkey to achieve all Empower measures, even in the face of industry opposition and even as the world's second largest tobacco producer. Other tobacco-producing countries in the Americas can and should follow these examples and commit to the policies embedded in the Framework Convention. We know that this is possible because of what has already been achieved. Together, PAHO and its partners successfully countered tobacco industry arguments, defended the strength of policies, and responded when their legality was questioned. This has been the experience of the campaign for tobacco-free kids, including in Brazil, Mexico, Colombia, Costa Rica, Peru, and Panama. As representatives of civil society, we celebrate this strategy serving as a roadmap for the period up to 2030 for member states to accelerate the implementation of the Framework Convention policies. Further, we are excited that this strategy addresses the most cost-effective measures to tackle NCDs while also addressing two crucial issues: policies to counter industry interference and a roadmap for regulating electronic cigarettes, products aggressively promoted to youth in recent years. All these policies are crucial in ensuring everybody's right to the enjoyment of the highest attainable standard of health, especially for those in vulnerable situations. We stand ready, alongside PAHO, to continue advancing tobacco control efforts in the region and to prevent any setbacks. Thank you again.
Thank you. I thank the Tobacco-Free Kids campaign. With that, I call on corporate accountability. Thank you very much, distinguished President, honorable delegates. From corporate accountability, the Alliance for Tobacco Control, from Class and Action on Smoking and Health, we applaud the commitment of member states and the support of the Pan American Health Organization to preparing a new strategy and plan of action to strengthen tobacco control in the region of the Americas. A strategy that undeniably shows the political will and the adoption of the most cost-effective strategies to offset the growing influence of the tobacco industry, and also the commitment to move ahead on matters that are emerging and that are related in the region. The strategy and the plan of action are categorical and point out that the main barrier is the persistent influence of the tobacco industry and those who defend their interests. That would be involvement in policy making by sectors not related to health and also using litigation. Also, there is concern regarding the ever greater availability of emerging products like e-cigarettes and heated tobacco products, as well as ever more aggressive strategies on the part of the industries that promote these products for the young population. This is a situation that has been well documented by civil society in the Index on Activities of the Tobacco Industry in Latin American Caribbean countries. So this strategy, this plan of action, will hopefully be approved in its entirety and that no efforts will be spared in implementing it. We stand ready to support you in this endeavor. Thank you. I thank you. I thank corporate accountability. Now I offer the floor to Dr. Hennis. Dr. Hennis, would you please respond to the comments?
Let me acknowledge the contributions from the 19 member states and from the 6 non-state associations who also have contributed. I think we all recognize the importance of tobacco prevention and control. There's no question about it. I think, as we said, this new strategy and plan brings the components of equity. And when we consider that those who are most vulnerable are those who probably have greater use of tobacco than the general population. What was also important was the whole idea of the importance of tobacco and marketing to youth, as well as the use of novel tobacco products. And we saw a lot of the impact of that during the recent pandemic. And I think we all agreed that we have to reverse this trend, which tackles youth and harms and creates new generations of persons who are smokers. And it's done through propagation of misinformation and false marketing. The industry has been promoting this whole concept of harm reduction, but in fact, they are marketing to people who have never smoked before. And I think it's been recognized by the member states. Let me thank Costa Rica for mentioning the fact that there actually are harms from vaping, particularly lung disease, which we don't mention as much now as when it first became obvious. But I think these are other challenges that we have to be well aware of. I think also a lot of countries have made progress in terms of smoke-free environments and warnings. But as pointed out, even by Healthy Caribbean Coalition and other member states, the greatest impact is through implementation of tobacco taxes. The Framework Convention has been implemented in our region for 20 years, and to date, only 4 countries of the 30 countries which are parties have actually implemented, actually raised tobacco taxes to the recommended levels of the Framework Convention on Tobacco Control. So there's so much more that member states need to do to achieve what they have agreed to. Additionally, only 9 of 30 countries in our region have actually implemented bans into advertising, promotion, sponsorship of tobacco products. So there's much more that member states need to do to make the impact that is appropriate. And in fact, even with this new strategy and plan, the targets are really not the ceiling, they are the floor. So there's a lot of room for what really can be done. So I would implore you to prioritize and do this urgently. Tobacco taxes bring a situation of win-win-win. By taxing tobacco, it creates revenue streams, it has benefits to the health of the populations, and also it saves lives. So these are issues that only the member states can do, and we are here to accompany you. We take note of the issues raised by Bahamas and Cuba, and these will be recorded and followed up appropriately in terms of Bahamas. Thank you very much, Madam President, and thank you to the member states and to the civil society organizations.
Muchas gracias, doctor.
Thank you very much, Dr. Hennes. Thank you for responding to the comments. Director, do you have any comments to make?
I think that to thank member states because this was a proposal, I think that originated by Brazil. When we presented, the Secretariat presented the final report about the previous strategy and plan of action to strengthen tobacco control in the region of the Americas 2018-2022. And I think that is really important because despite the fact that we have made a very important progress in the region, the Americas, now we are the region among the 6 WHO regions with the lowest prevalence of tobacco users. We still have many areas to improve, as Anselm Hennis has highlighted. In countries that have disaggregated data, it's clearly seen that among the poorest, the prevalence of tobacco is 2 to 2.5 times higher than the prevalence of tobacco amongst the people with a higher level of education or income. So the discussion about the tax and pricing strategy is clearly a very important tool to reduce the smoking use among these poor families that are losing income and are losing their health when they don't quit the tobacco use. It's also important to highlight this new threat that we have related to electronic cigarettes among youth, adolescents. I also want to thank the Minister and Vice President of Costa Rica for bringing this to our discussion. And I really encourage you, the countries that allow the use of electronic cigarettes to perform assessment to test what is the components that are part of these cigarettes. When I went to Mexico last year, the regulatory authority in Mexico had found the same situation that the Minister of Costa Rica reported. The substances are not the same that the manufacturers are reporting. So I think that this is very important because despite the fact of the damage that they can produce, all the damages can be produced because there are underreported or non-reported substances in what they are offering to adolescents and young adults in our region. Finally, I think that is really important to have this new strategy and plan of action. So we will support our member states to achieve a more even implementation of all the measures that were agreed on the FCTC, because we have many progresses yet to make. We have some in many countries that the implementation of all the measures that are part of the FCTC can, I think, that provide a very important progress in the next year. So I think that it is really very important for us to receive this renovation of the commitment of our member states and to guide our technical cooperation to improve the way that we are reducing the use of tobacco in our region and improving the health of the population. Thank you.
Thank you very much, Dr. Barbosa, for your comments. I would now ask the rapporteur to present the proposed resolution. Thank you very much, Madam President. Proposed resolution, strategy and plan of action to strengthen tobacco control in the region of the Americas, 2025-2030. The 61st Directing Council, PP1, having reviewed the strategy and plan of action to strengthen tobacco control in the region of the Americas, 2025-2023, document CD61/10, PP2, recognizing that tobacco use continues to be one of the greatest threats to global public health, and that, in addition to generating a heavy social, economic, and environmental burden for countries, it exacerbates household poverty and increases inequalities. PP3, considering that while conventional cigarettes remain the most widely used tobacco product, the use of electronic cigarettes is increasing among children and adolescents in some countries. PP4, recognizing that there is abundant evidence and international consensus on how the tobacco epidemic and nicotine addiction should be addressed in a cost-effective manner through the implementation of the mandates of the World Health Organization Framework Convention on Tobacco Control, the protocol to eliminate illicit trade in tobacco products, the decisions taken by the Conference of the Parties to the FCTC, and the meeting of the parties to the protocol, the World Health Organization Empower Package Guidance, and the best buys for prevention and control of non-communicable diseases. PP5, recognizing that there are various circumstances that have made it difficult to implement at the national level the national and international mandates and commitments undertaken by member states to address the issue, but stressing that the common and most important challenge faced by all countries is the interference of the tobacco industry and those working to further its interests. PP6, recognizing that the objective of this strategy and plan of action is to accelerate the implementation of the FCTC in the region of the Americas by all member states, whether or not they are states parties to the convention. PP7, noting that the Global Action Plan for the Prevention and Control of Non-Communicable Diseases 2013-2020 and the Global Strategy to Accelerate Tobacco Control, Advancing Sustainable Development through the implementation of the WHO FCTC 2019-2025 have been extended to 2030 owing to the challenges presented by COVID-19 pandemic and to ensure coherence and harmonization of the 2030 Agenda for Sustainable Development Resolves, OP1, to approve the strategy and plan of action to strengthen tobacco control in the region of the Americas 2025-2030, document CD61/10, OP2, to urge member states considering their context, needs, vulnerabilities, and priorities to A, promote the implementation of the objectives and indicators contained in the strategy and plan of action to strengthen tobacco control in the region of the Americas 2025-2030. B, prioritize the adoption of comprehensive legal measures relating to smoke-free and emissions-free environments, health warnings, and plain packaging, and total bans on the advertising, promotion, and sponsorship of tobacco products in accordance with their constitutions or constitutional principles, and adapting to new digital realities, covering both conventional tobacco products and other emerging products. C, strengthen the use of tobacco tax policies as a means of reducing the affordability of products that are harmful to health, that discourage consumption, especially among lower income groups, and that provide member states with an additional source of revenue that can be used to strengthen health and social welfare programs. D, strengthen primary health care services to increase the coverage, access, availability, and quality of tobacco cessation treatment services in the context of building stronger and more resilient health systems in the post-COVID-19 pandemic period. E, consider ratifying the FCTC and the protocol in order to assume legally binding obligations to protect the right of every person to the enjoyment of the highest attainable standard of health. F, strengthen national measures and international cooperation to eliminate illicit trade in tobacco products. G, counter attempts by the tobacco industry and its allied groups to interfere with, delay, hinder, or impede the implementation of tobacco and nicotine addiction control measures aimed at protecting the public health of the population. H, strengthen their national surveillance systems in order to assess not only the prevalence of tobacco and nicotine use, but also the effectiveness of the measures implemented, and to obtain information broken down by sex, gender, ethnicity, and other factors, including usage data where possible, and to use this information to develop evidence-based interventions aimed at reducing disparities. I, take into account the environmental impact of tobacco and the need to strengthen liability regulations for the tobacco industry, ensuring respect for and protection of human rights of all people. OP3, to request the director to A, provide support to member states to strengthen national capacities that will contribute to the implementation of this strategy and plan of action and the achievement of its objectives. B, promote the exchange of information among member states and partnerships with other international agencies and sub-regional bodies, and with members of civil society and academia at the national and international levels, including the mobilization of human and financial resources in support of the implementation of this strategy and plan of action. C, report periodically to the governing bodies of the Pan American Health Organization on the progress made and the challenges faced in the implementation of the strategy and plan of action through a midterm review in 2028 and a final report in 2031. Thank you very much, Madam President. I thank the rapporteur. Thank you for presenting this proposed resolution. With that, I offer the floor to the plenary to discuss this proposed resolution. Costa Rica has the floor.
Thank you, Madam President. The topics addressed here are very broad, and we would have to approach them according to each country's needs. It does seem timely for me to stress once again that we do have new technologies and that we should focus our technical support on strengthening national surveillance systems, especially on the regulation of this type of device, which is entails a health risk. Each country is used to doing its own regulation according to health benefits, but as far as risk, not so much so. We don't even know what the compounds are, and it's very easy to change in countries. It's being changed quickly, so it should be language that is more readily understood by the population, traditional population, regarding the content that it has, and standardizing regulation across countries so that we can be current in the language we use. And the new devices are being more problematic than cigarettes. There's reporting, and stats are going to be showing us, new generations, what the actual effects of these new devices is going to be.
Muchas gracias.
Thank you. Costa Rica. I give the floor to Dr. Hennis.
Yes, thanks so much, Minister from Costa Rica. I guess the issue is if Costa Rica is comfortable with approving the resolution, and the Secretariat will work with you in terms of advancing issues that you have raised as part of the technical cooperation.
Muchas gracias, doctor.
Thank you, Doctor. If there aren't any objections, I So, what I would like to have stated here explicitly is that there would be regulation of the content of the liquids of these devices such that we can standardize what the presence of these dangerous toxins are with new regulations that, at least in Costa Rica and the Central American region, I have not yet found, and that we should have. The fact that it entails risk does not mean that we shouldn't regulate.
Thanks so much, Madam Minister. There's actually scope for that, that concern to be included on the indicator 1.4.1. So it can be included on the pre-existing indicator, if that is considered satisfactory.
¿Estás de acuerdo?
Do you agree?
¿Estamos de acuerdo?
Costa Rica, do you agree? That's fine. Thank you.
Le cedo la...
I give the floor to Dr. Barbosa. If you'd allow me, I just have a suggestion I would like to make in 141. I do think that what we could add is the suggestion of including in technical cooperation as one of the actions that should first be adopted is giving support to countries regarding their regulation. I think that's what the minister was stressing regarding monitoring, regulation of substances that many countries don't have the wherewithal to do because they may not have a laboratory. So we could change that indicator 145, but I do say that this should be one of the priorities of our technical cooperation. Thank you, Dr. Barbosa. I declare approved this declaration, resolution.
Continuamos con el siguiente.
Now moving on to the next item, which is 5.4. Update on the status of the Latin American Center for Perinatology, Women and Reproductive Health. I would like to bring the document CD 6115 to the attention of the Council, and I invite Dr. James Fitzgerald, Director of the Department of Health Systems and Services of the Pan American Sanitary Bureau, to come to the head table. I give the floor to the representative of the Executive Committee to report on this item. Thank you very much, Madam President. The Executive Committee reviewed a report on the status of the Latin American Center for Perinatology, Women, and Reproductive Health and considered a proposal by the Bureau to close the center and transfer its functions to the Department of Health Systems and Services at PAHO headquarters. In the committee's discussion of the report, delegates expressed gratitude to the Center for the technical cooperation it has provided to member states to support capacity building and the development of evidence-based public policies. Support was expressed for the proposed closure of the center and transfer of its functions to PAHO headquarters. The committee approved Resolution CE 174 R9, recommending that the Directing Council approve the closure of the center and the transfer of its functions to PAHO headquarters. Thank you, Madam President. This concludes my report on this item. Thank you, Madam Representative of the Executive Committee. I give the floor to Dr. Fitzgerald for him to present this item.
Madam President of the 61st PAHO Directing Council, delegates to the Council, Director Dr. Barbosa. The Latin American Center of Perinatology was created in 1970, 54 years ago, through an agreement between the government of the Republic of Uruguay, the National University of Uruguay, and the Pan American Health Organization. As a specialized center of the Pan American Health Organization, CLAP was established as a center for academic research and higher education, specializing in the clinical management of pregnancy, childbirth, and neonatal health. During the period 1970 to 2005, CLAP trained more than 4,500 clinical professionals in perinatology and strengthened the capacity of countries in the development of women's reproductive and neonatal policy frameworks. As capacity in medical education advanced and academic centers developed throughout the region, CLAP shifted its focus to issues of public health, delivering technical cooperation to countries in policy development, capacity building, guideline development, health information systems, and operational research in reproductive, maternal, and neonatal health. Commencing in 2005, CLAP assumed a dual role within the organization, both as a specialized Latin American center and a decentralized technical unit in women's and reproductive health. Pan American centers have been an important modality of PAHO's support to Latin America and the Caribbean for more than 60 years in specialized areas of research and capacity development, a situation that continues to evolve as academic capacity in human resource training and research develops throughout the region. The document presented today presents an overview of the work of CLAP since its establishment and presents a proposal to close CLAP as a specialized center in Uruguay, transferring and integrating its functions as a technical unit of PAHO headquarters here in Washington, D.C. The rationale for this proposal is provided for, firstly, by the fact that the center does not meet financing conditions for operations of a center in a country. Secondly, that the region has significant capacity in areas of research and development in perinatology. And thirdly, by the need to intensify PAHO's technical cooperation in women's, maternal, neonatal, and reproductive health across the region, and in a manner that is more fully integrated with strategies for the strengthening of health systems based on primary health care. The proposal will also provide benefits to the organization and its member states in that it will contribute to operationalizing and strengthening integrated action with technical areas across the organization in established strategies and priorities aimed at recovering lost gains in maternal mortality, improving maternal and neonatal health through the expansion of primary health care, and strengthening the capacity of health systems to deliver quality, integrated, and inclusive sexual and reproductive health services. Additionally, the transfer of technical functions to PAHO headquarters will result in a 28% reduction in operational costs for the organization relative to the cost of operations in Uruguay, as efficiencies are achieved through the absorption of programmatic and administrative operations within PAHO headquarters. In presenting this proposal, Madam President, the Secretariat would like to recognize and thank the government of the Oriental Republic of Uruguay for hosting this center in Montevideo, Uruguay, and for its continued support to CLAP's work program over the past 54 years. Thank you very much.
Thank you, Dr. Fitzgerald, for that report. I now invite the Directing Council to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution presented in Annex A. I'll open the floor to the plenary to start the discussions on this document. The discussions on the resolution will take place once the rapporteur has read the proposed resolution. I give the floor to Uruguay. Thank you very much, Madam President. Uruguay is grateful for the report on the update on the status of the Latin American Center for Perinatology, Women and Reproductive Health. We would like to recognize the huge contribution that this center has made. In June 28th, as has been said, had reached its 54th anniversary without any interruptions. Based on an agreement between a university in Uruguay and PAHO, this was stood up as a response to the alarming maternal mortality in Latin America. So this has been a center of reference, saving untold lives and enhancing perinatal health in the region. Now, this report is very important because this center needs to be brought up to speed with the current needs of the region regarding the response offered through timely technical cooperation, as well as its viability, budget feasibility, and with its new location, a synergy will be created with other programs of this organization for it to achieve its goals. We are grateful for the recognition given to the work done by CLAP, and we recognize that this new stage that CLAP will be going through will redound to the benefit of our region. Thank you. Thank you, Uruguay. I give the floor to Jamaica.
Madam President, Jamaica wishes to thank the Executive Committee for providing a status report on the Center for Perinatology, Women and Reproductive Health. Jamaica achieved a significant public health milestone in May 2024 when we received validation of elimination of mother-to-child transmission of syphilis and HIV. This achievement is a demonstration of several years of commitment, dedication, and teamwork among a wide range of health professionals and several local and international stakeholders, including PAHO WHO. Jamaica has benefited from technical cooperation provided by PAHO through the center, including capacity building for clinical management of postpartum hemorrhage, a leading cause of maternal mortality in Jamaica. There are also considerations for implementation of the Perinatal Information System, digital surveillance platform for maternal and neonatal health, as well as accessing and learning management for systems for capacity building in contraceptive technologies for local practitioners. Madam President, achieving the SDG target for maternal mortality rate remains a sore point for many countries. Globally, maternal mortality is unacceptably high. About 287,000 women died during and following pregnancy and childbirth in 2020. Almost 95% of all maternal deaths occurred in low and lower middle income countries in 2020, and most could have been prevented. Between 2000 and 2020, the global MMR fell by 34.3%. Almost all the progress achieved during 2000 to 2020 period had occurred by 2015. The positive declining trends in MMR during the MDG era, however, have largely stalled in the first 5 years of the SDG era. Assessed from the start of 2016 to the end of 2020, the global MMR has stagnated. In Jamaica, there have been concerns regarding the trend of increasing maternal mortality ratio over the past decade, with an increase in 2021 during the COVID-19 pandemic. We have no objection to the seamless transfer of the center's functions to PAHO's headquarters in Washington, D.C., and look forward to even more commitment and comprehensive attention to the critical area of reducing maternal mortality ratios under this new arrangement. Thank you.
Thank you, Jamaica. I give the floor now to Panama. The Republic of Panama thanks the Executive Committee for this update on the status of the Latin American Center for Perinatology, a unit that for decades has worked hand in hand with our Ministry of Health on maternal health information, perinatal information system, neonatal health, and reproductive health, whose work has been quite extensive. We are fully aware that it is necessary to overhaul this, to optimize technical assistance given throughout the Americas. However, our desire would be to submit to this Council that there be broad information regarding the the expansion of the personnel, and that would be necessary to continue carrying out the actions that are offered throughout Latin American countries, and the subsequent effect this will have on the plans for execution under CLAP. After the clarifications we requested, and given what I've just said, we are very pleased and welcome this proposal, including Annex 1. Thank you. Thank you, Panama. I give the floor to the Bahamas.
Thank you, Madam President. Since its inception in 1970, the Latin American Center for Perinatology, Women and Reproductive Health has been instrumental in improving women's maternal, neonatal, and reproductive health across the Americas. The Bahamas believes that establishing a dedicated unit for these areas at PAHO headquarters in Washington, D.C. will significantly enhance the organization's ability to deliver critical technical support. In 2019, the Bahamas experienced an increase in maternal mortality. However, by 2020, we saw a decline, along with a subsequent reduction in the infant mortality rate. Despite these improvements, considerable work remains to achieve the Sustainable Development Goals by 2030, particularly in the areas with high maternal and perinatal morbidity and mortality rates, noting that in 2017, 295,000 women worldwide lost their lives due to pregnancy and childbirth complications, with 94% of these deaths occurring in low and middle income countries, many of which were preventable through established medical interventions. Every day, individuals face important decisions regarding their sexual and reproductive health, including contraception, infection prevention, and family planning. Unfortunately, many are still unaware of their rights and options. The Bahamas, through its community clinics and family planning sessions, continues to make progress in advancing reproductive health. Finally, Madam President, the Bahamas seeks PAHO technical cooperation to further advance our national programs and enhance SIP+, reaffirming our commitment to improving reproductive health services. Thank you.
Muchas gracias, Bahamas.
Thank you, Bahamas. I give the floor to Canada.
Thank you, Chair. Good afternoon. Canada wants to recognize the critical work conducted by the Latin American Center for Perinatology, Women and Reproductive Health, CLAP, in partnership with the University of Uruguay and PAHO over the last decades. Canada believes that the new Women, Maternal, Neonatal, and Reproductive Health Unit's work is critical to support the goals of the Plan of Action for Women's, Children's, and Adolescents' Health 2018-2030, and the recent call to action from Dr. Barbosa to reduce maternal mortality in the Americas. We strongly encourage the full integration of this unit within the Department of Health Systems and Services and hope that it helps to facilitate gender mainstreaming efforts in the longer term and better integration of women's health in all PAHO's interventions. At the same time, we strongly encourage the Secretariat to ensure that this new unit retains the autonomy it had as CLAP, allowing it to continue effectively advancing its goals and objectives. In line with Canada's Feminist International Assistance Policy and our 10-year commitment to global health and rights, Canada supports these efforts to access the full range of maternal, neonatal, in addition to sexual and reproductive health services and information. Comprehensive approaches are necessary to bring transformative changes. Maternal health is intrinsically linked to sexual and reproductive rights, as it relies on women's ability to make informed decisions about their bodies and reproduction. Protecting maternal health care and sexual and reproductive rights is crucial for promoting health equity. Women from marginalized backgrounds often face limited access to these services, By advocating for policies that ensure accessible and rights-respecting care, we contribute to reducing inequalities and ensuring that women and girls in all their diversity can benefit from the care they need. Thank you.
Thank you, Canada. I give the floor to Honduras. We thank you for the update on the status of the Latin American Center for Perinatology, Women and Reproductive Health. On this, we would request that the new unit for perinatology and reproductive health would ensure that countries have a comprehensive approach to health, including ongoing care throughout the life course for women, girls, adolescents, and women from preconception to postmenopause. It's essential that we continue to strengthen care and given during pregnancies and especially at adolescents, and also on matters of sexual violence and the right to health and abortion services and others. That would be a priority of the annual plans. Now, the Secretary of Health requests that the perinatal information system continue to be a key tool to gather, analyze, and improve the quality of care given during neonatal maternal health, and that PAHO support its integration into our digital system, which has been an essential component in our strategy to modernize health services. We request that it be kept and strengthened, that is, that technical support be kept and strengthened. Thank you. Thank you, Honduras. I give the floor back to Dr. Fitzgerald.
Thank you very much, Madam President, and thank you to all the Member States for your appreciation of the tremendous work that this centre has been providing to the region in maternal, neonatal, reproductive health over the past 54 years. I think we've heard from the floor a number of very important issues in terms of the current status, in particular, of maternal mortality in the region of the Americas. Jamaica, and in addition, I think it was Canada, mentioning the increased and sustained challenges we face in maternal mortality, particularly since 2015, where we saw a certain stagnation in maternal mortality ratios, with subsequent increases, I have to say, from 2015 to 2020, increasing from 58 to 68 per 100,000 live births, which constitutes a 3.1% annual increase. The Director, noting this, requested us to prepare a call for action. The Director made that call for action this year in June, identifying 12 priority countries in which we really need to have targeted actions addressing the critical determinants associated with maternal mortality, access to services based on primary health care, and then really empowering women to ensure that their rights are protected in terms of accessing sexual and reproductive health services. And so we are currently developing specific country action plans, very much focused at territorial planning, looking at context-specific issues in the 12 priority countries that essentially constitute 90% of maternal deaths at this point in time. In addition to that, we really want to thank Canada. Earlier this year, we also had a very important event with CLAP on promoting access to sexual and reproductive health services. And we've seen very closely the linkages between maternal morbidity, near misses, and maternal mortality, and access to sexual and reproductive health services in the region. And so we really want to thank Canada for the promotion of that, and we will continue to work very closely with all countries to ensure that we continue to provide the necessary instruments, modalities, advocacy, and political engagement to ensure access to sexual and reproductive health services. A number of specific questions, I think, came up also in the comments, particularly with regard to integration and the implications for staffing. On staffing, 4 specific positions, professional positions are being transferred to Washington, D.C. And we are currently reprofiling those technical staff positions to be able to respond to areas around maternal health, maternal mortality, neonatal health, sexual reproductive health, and then general women's health in particular, with an overview in terms of development of policy frameworks. A number of positions also have been integrated to the Uruguay PAHO office at the local level. We have a number of Ministry of Health staff also that will be returning to their positions. And of course, we have a number of local staff where the contracts of which are being finalized through mutual agreement. The issue of integration, I think, is extremely important in this area because the principal rationale, in addition to not meeting the financing conditions within Uruguay, is to ensure greater integration of our approaches in women's health here in Washington, D.C., in providing technical cooperation to our member states. And if we look at some of the opportunities for greater integration, we see them, for example, within health systems, in the primary healthcare approach, in the life course approach, in child and adolescent health. We really note here and want to thank the Dominican Republic for hosting a very important meeting recently on unintentional adolescent pregnancies, to note that the region of the Americas remains the region with the second highest rates of unintended adolescent pregnancies, which obviously contributes then significantly to maternal near misses and mortality in the region. So specific actions, intersectoral actions required in that area. And so our interprogrammatic cooperation in this area across technical areas will, I think, really support countries and accelerate our capacity to respond to your needs in this area. Also, integration in terms of gender and rights in the control of sepsis, hypertension and control, and obesity, all these programs that are essentially run from the office in Washington, D.C. So we really see this also as an opportunity to strengthen integrated interprogrammatic action and to support countries in scaling capacity, policies and interventions to improve women's and neonatal health moving forward. Thank you very much.
Muchas gracias, doctor.
Thank you, Dr. Fitzgerald. Thank you for responding to the comments. Director, do you have any comments? Yes, thank you very much, Madam President. Also, I wanted to thank the countries for their comments. First of all, I would like to express my appreciation for the valuable support provided by CLAP. It has supported all of the member states in the region. It has a cadre of professionals, people who are very devoted, committed, and they have provided very important technical cooperation in areas that continue to be a priority in the region. So my recognition to our colleagues in CLAP. Also, I would like to thank the government of Uruguay. It has been very generous in supporting CLAP during the last 50 years of its existence. PAHO has a long history with these centers. The centers began to be established with PAHO back in the 50s. That was last century. And it was in the 60s when most centers were established. PAHO at one point had 13 different centers, and right now we only have 3. And why did the number change? Because the idea behind the centers initially, back in the 50s and the 60s, the idea was that these would be research centers that could provide, coordinate scientific research for issues that were important to the region. And that gradually changed during last century because many universities, schools of medicine, research centers were set up in countries, and those PAHO centers were closed down and were turned into units, or they were incorporated into units that already existed, because our main mandate is not to replace academic or research centers. Our desire is to provide technical cooperation. So the truth is, CLAP, when we look at what CLAP does today, it's quite different from what it did 50 years ago. So what we're currently doing is we are beginning this process of transforming what is done de facto with what is being done actually, because CLAP is not a center of academic characteristics the way it was when it was founded 50 years ago. CLAP now provides technical cooperation to countries for essential issues. And to provide TC to countries, it will be doing it much more effectively if it is integrated into other areas of the organization, if it becomes part of the Health Services Center. That would be working with the centers already mentioned by Mr. Fitzgerald. So this is definitely the time to take the step so that we can have more effective coordination here from headquarters. And this is important, as the countries have said. Maternal mortality got worse during the pandemic, but even before the pandemic, we had leveled off. Actually, rates were actually going up in some countries, and we know that maternal mortality is perhaps the most straightforward indicator, showing a lack of access, a lack of quality in health services. And we also know that maternal mortality, unfortunately, is an indicator of inequity, because the women who die are, generally speaking, women from the poor neighborhoods in large cities, or they live in rural areas. They are women belonging to indigenous populations, they're Afro-descendants, they are part of other vulnerable groups. So this appeal, the appeal that we launched in June of this year, and that we are focusing on 12 countries in the region with packages of interventions that are designed to quickly lower maternal mortality if we combine the policies on the part of ministries with involvement of the whole health system. That would be hospitals, maternity centers, agencies that provide prenatal care. We need them to work in coordination. There are other issues that were touched on here that are priorities for us. We have rates that are completely unacceptable in terms of pregnancies in teenage girls and even little girls at the age of 10. And that shows inequity. These are poor girls, girls from indigenous populations, from remote areas, and this too is a factor that feeds into the vicious cycle between disease, poverty, and these girls, when they become pregnant, drop out of school, and that increases the burden on their families. Often they miss out on the opportunity. They do not grow up. They do not mature as a young adolescent girl should. And that basically affects their life potential. So here I wanted to thank Canada, USAID, Spain, those who have helped us implement programs working with the countries so as to lower those unacceptable rates that we still see when we look at pregnancy of girls and teenage girls in the region. So I think that those issues and other issues that countries know about, where we'll be providing with technical cooperation, by turning this center into a technical unit, we will get better integration with the other programs that deal also with sexual and reproductive health. Also, those working on reducing maternal mortality and the other issues currently being worked on by CLAP. So I wanted to thank member states, and I think that this is definitely a step forward. We are transforming, we are turning what is currently the reality, where we provide technical cooperation, where we translate scientific evidence into TC and interventions. And that way we can leave research or producing scientific research to the collaborating centers that exist in the region. We have 170 different centers in the region, and we have to develop even more partnerships with more centers, more universities, more schools of nursing, medical schools that can support us as we carry out scientific research that can fine-tune the evidence that we already have available. Thank you. Thank you, Madam President. Thank you, Dr. Barbosa, for your comments. And with that, I would ask the rapporteur to present this proposed resolution. Thank you very much, Madam President. Proposed resolution update on the status of the Latin American Center for Perinatology, Women, and Reproductive Health. The 61st Directing Council, PP1, having examined the update on the status of the Latin American Center for Perinatology, Women, and Reproductive Health, document CD 61/15, PP2, recognizing that Pan American centers have been an important modality of technical cooperation for the Pan American Health Organization for more than 60 years, a situation that has evolved with the development of national capacities in the areas of human resource training and research, PP3, considering that appropriate measures should be taken to improve the cost effectiveness and the efficiency of centers in terms of the use of available resources to respond to the needs identified by PAHO member states. PP4, recognizing the contribution of the Latin American Center for Perinatology, Women, and Reproductive Health in promoting, strengthening, and improving the capacity of countries of the region of the Americas in relation to women's maternal, neonatal, and reproductive health since its creation in 1970, PP5, considering the need to increase PAHO's capacity for technical cooperation in the areas of women's, maternal, neonatal, and reproductive health, and to efficiently and effectively integrate this with cooperation for the strengthening of primary health care and the development of health systems, resolves. Operative paragraph 1, to take note of the proposal to update the institutional status of CLAP-WR, OP2, to note that the creation of a women's, maternal, neonatal, and reproductive health unit that incorporates the center's functions at PAHO's headquarters in Washington, D.C., will enhance PAHO's technical cooperation capacity in the area of women's, maternal, neonatal, and reproductive health. OP3, to approve the closure of CLAP-WR as a PAHO Pan-American Center and the transfer of its functions to PAHO headquarters in Washington, D.C. OP4, to request the director to A, take the necessary measures to close CAP-WR as a Pan-American Center, terminate the current agreement with the government of Uruguay, and transfer CLAP's functions to PAHO headquarters in Washington, D.C. as of January 2025. B, ensure that the functions and operations of CLAP-WR are seamlessly transferred to PAHO headquarters. And C, thank the government of Uruguay for its support, acknowledging its contributions during the different stages of CLAP's existence in the country. Thank you very much, Madam President. Thank you. I thank the rapporteur for reading this proposed resolution. I now open the floor to the plenary to begin the discussion on this proposed resolution. If there are no objections, I declare the resolution adopted. We now move to 5.5, report on the charge assessed on the procurement of public health supplies for member states. I would bring to attention of the meeting, document CD61/16, and I call on Mr. Santiago Cornejo, Executive Manager of the Regional Revolving Funds Special Program of the Pan American Sanitary Bureau, to come to the head table. Thank you. I give the floor to the representative of the Executive Committee for a report on this item. Thank you very much, Madam President. The Executive Committee reviewed a report concerning the administrative component of the charge assessed on the procurement of public health supplies for member states through the organization's revolving funds, and considered proposals by the Bureau aimed at accelerating progress on the priorities identified for the funds and introducing a degree of flexibility into the operations of their capital accounts, with the goal of improving access in the region. The Executive Committee applauded the Bureau's efforts to ensure that the organization's procurement funds remain responsive to the region's changing needs. The new strategic priorities for the funds were welcomed, namely to strengthen regional innovation and manufacturing, establish regional supply agreements for rapid response. The committee adopted Resolution CE 172R10, recommending that the Directing Council endorse the strategic priorities of the revolving funds and authorize the Director to implement the flexibilities outlined in document CD61/16. Thank you, Madam President. This concludes my report on this item. Thank you very much, representative of the Executive Committee. I now call on Mr. Cornejo for him to present this item. Thank you very much, Madam President, Director, distinguished members of the Directing Council. Thank you for giving me this opportunity to present the document. It provides us with an update on the financial resources collected through the regional revolving funds and proposes strategic action to improve health in the Americas. For more than 40 years, the regional revolving funds have proven to be an essential tool for member states in the elimination and control of diseases. In the last biennium alone, the revolving funds have contributed to protecting 160 million people in the region. In 2020, the resolution R4 kept the charges at 425% applied to the cost of the products. But the composition was adjusted. The administrative expense went up by 125% to 175%, reducing the contribution to the capital account from 3 to 2.5%. The 175%, which was administrative charge of the regional revolving funds of PAHO, continued to be one of the lowest rates when compared to other international mechanisms that are 3.5% up to 8.5%. The resources collected from that 175%, the administrative charge, are crucial and serve to finance operational and administrative functions of PAHO secretariats, including staff, technical cooperation, and investment projects. For example, the digital portal for member states. The COVID-19 pandemic increased resources in 2021-2022, but in 2023, we saw a reduction, which meant that there was a drop in our revenue to levels that were pre-pandemic. The funds that came from the 2.5% for capital accounts have financed a line of credit for all member states that have requested one without having to use all of the funds available in said lines. Although revolving funds, regional revolving funds, have made important progress in supporting regional health, we have to recalibrate our priorities so as to deal with emerging challenges like lessons learned from the pandemic or the challenges of gaining access to expensive medications. This presents three strategic priorities for our revolving funds. First, strengthening innovation and regional production. Promoting production and regional innovation is absolutely essential to improve health security and to reduce dependence on outside sources. Second, the establishment of regional agreements for a rapid response. These efforts could use the financial resources from regional revolving funds to obtain better terms for early access to essential products and thus assure a regional response that will be timely to public health emergencies and future pandemics. Third, the creation of a reserve, a regional hub that could stock essential medical supplies to mitigate any interruption in the supply chain and also reduce transportation costs. That would especially help small developing island states. This is a priority established in the document. But in order to accelerate these priorities, the document is suggesting three adjustments in the way the funds operate. The first suggestion, once the line of credit covers the needs of member states, we should be able to use remainders of up to 15% of the capital account for interventions that would improve access to regional public health assets. For example, this flexibility would enable us to provide guarantees of volume to regional providers so as to offer visibility, predictability of demand, and thus promote the necessary investments in production. Also, this flexibility could be used so as to make advance payments. This is a tool that is already being used by high-income countries and was used during the COVID-19 pandemic. Or this flexibility could be used to set up a reserve of products, and that would lower transportation costs and also emissions and provide a more rapid response for member states. These uses could be done working with other financiers, for example, development banks, so as to create innovative financial instruments and to encourage additional investments in the region. The second proposal, the idea of exempting this fee of 2.5% for capital burdens, would promote the competitiveness of our region. The elimination of this charge would reduce the cost for member states and could be an additional benefit and encourage buying regional products. The third proposal is to exempt the 2.5% for the capital account, also for purchasing high-cost products at a high volume so as to get better prices and to take advantages of economies of scale. This would make our revolving funds more competitive in countries with a high demand volume. And in this way, we could extend benefits to all the member states that would like to procure these products, including that exemption of the 2.5%. These measures will improve our regional resilience and will promote equity and encourage an approach based on solidarity. The priority of the capital account will continue to be access to lines of credit for member states, but the flexibilities being proposed will enable us to accelerate the priorities identified, encouraging production, regional innovation, implementing lessons learned from the COVID-19 pandemic, and improve conditions for access to expensive medicines. These flexibilities would benefit all member states, and the principles of solidarity, Pan-Americanism would continue to be the core of our efforts. The document makes an appeal to all member states to reaffirm their commitment to these values by using the regional revolving funds and supporting regional manufacturers or producers. Together, we can continue to move forward to promote health and well-being in the Americas. Thank you very much for your attention and for your support. Thank you. Thank you very much, Mr. Cornejo. Thank you for your report. I now invite the Directing Council to review the information presented in this document, provide any comments, and consider approving the proposed resolution presented in the annex. I open the floor to the plenary to start the discussion on this document. The discussion on the resolution will take place once the rapporteur has read the proposed resolution. I offer the floor to Paraguay. Thank you very much. President, delegates, Paraguay takes note of this document, CD 6116, presenting up-to-date information on the progress done by this office in the biennium 2022-2023 regarding the resources that were collected by charging the administrative fee of 1.75%. Also, new priorities to be financed with this component are presented, and the idea is to support regional innovation and manufacturing by applying lessons learned from the pandemic. We accept this financial information, this situational analysis, and the differences have to do with the administrative fee of the 175%. Now, having read the priorities of the revolving funds that were introduced in 2024-2025, we think that we should assure the compliance with the new priorities. Therefore, we are in agreement with the proposals. This recognizes the importance of the strategic revolving funds in providing equitable access, including high-cost products. And also, we appreciate the fact that it promotes solidarity and Pan-Americanism, encouraging regional production and innovation. Furthermore, my delegation calls for ongoing follow-up and the idea of using up to 15% of the regional capital funds, and that there be equitable access to products related to public health in the region, so as to make decisions that benefit all member states. All of this considering that use could limit the availability of funds for other pressing needs on the part of the countries. Thank you. Thank you, Paraguay. I now give the floor to Costa Rica. Thank you very much. This is music to Costa Rica's ears, believe me. Innovation, regional production, supplies for a rapid response, to think of having a regional stockpile or reserve, how we can work with high-cost medication. You understand what is being proposed here, right? We have learned our lesson, and we're going to apply the lessons learned. So these are strategic lines that all countries in the region should begin to work on as of now. This is part of our day-to-day, and it's also a vision where we look for opportunities for investment. This can have a high impact for member states without this coming from our own budgets. It's intelligent, and so Costa Rica is eager to get started, and we actually provided information already so as to provide feedback in real time, but also this can provide us with a clear view of how we can make sustainable all of the investment being generated, not only on the part of PAHO, but it's also an opportunity to invest in other countries that also need these inputs, these medicines at an affordable price. So thank you very much, and Costa Rica takes note of this report. Thank you, Costa Rica. I now recognize Bahamas.
Madam President, in a rapidly changing world with increasing access to medicines and products, procuring through trusted sources is more crucial than ever for safeguarding public health. PAHO's role in improving access to essential health supplies through the regional revolving funds is invaluable. For decades, the Bahamas has gained value from the PAHO revolving fund, ensuring access to safe, high-quality, efficacious vaccines. Recently, expansion of UHC has prompted greater procurement through the strategic fund. We applaud the thoughtful changes to the procurement charge, aimed at optimizing resources for regional manufacturing, enhancing pandemic preparedness, and boosting access to innovative technologies. Madam President, the proposed updates to the revolving and strategic funds present both opportunities and challenges for small island states like the Bahamas. On one hand, we stand to benefit from better access to essential supplies, potential cost reductions, and stronger health security through regional manufacturing initiatives. Stockpiling and enhanced collaboration will also prepare us better for future emergencies. However, challenges remain. Our geographical architecture poses logistical difficulties, and financial contributions to capital accounts could strain limited resources. Despite potential risks, the RRFs ensure fairness, and we trust that they will continue to serve all member states equitably. We fully support the RRFs, endorse the flexible, innovative priorities, and authorize the director to use up to 15% of the RRF's capital to boost regional innovation and pandemic preparedness. We support providing short-term financing through credit lines as a priority and request a report on these efforts by 2026-2027. I thank you.
Muchas gracias.
Thank you very much, Bahamas. I now give the floor to Mr. Cornejo to respond to these comments. Thank you very much, Paraguay, Costa Rica, and Bahamas, for your comments and for the confidence deposited on the revolving funds and the support for these new priorities that we are just identified, that you have identified, and that we've taken on, so that they will also become the banners of the regional revolving funds. We also propose in the document stressing the importance of monitoring and having a report on how these flexibilities are being used and what we'll do at the end of the 2027 biennium, so that we can learn from the lessons learned and thus to continue improving.
For the comments, and part of the proposals, or particularly regarding the formation of a stockpiling, and for the region, is particularly targeted to the challenges that we are facing with small countries, small islands, and the high cost in terms of transportation. That's exactly what we want to reduce, and hopefully will generate benefits in terms of savings to all of the member states. For example, for OECS countries, for every dollar that we're spending more than 50 cents in transportation, when for all other states it's around 5. So this is something that we would like to improve through these mechanisms, and having a consolidation of demand, having the resources, will allow us to create those economies of scale. Similarly, having these stockpiles will benefit those countries where the demand is very small, but we have a strategic stockpile, we will be able to respond quickly. So I hope, and we look forward to working with all of you, with all the member states. We are already advancing. Dr. Barbosa, the director, mentioned how we are already advancing in terms of incentivizing regional manufacturing, and we hope that we'll continue to work together in these priorities to improve the health in the Americas. Thank you.
Muchas gracias.
Thank you very much, Mr. Cornejo, for responding to the comments. Distinguished Director, any comments? Yes, Madam President, thank you. Thank you very much to our member states for their comments. Listen, first of all, it seems to me that it is important that these changes that are being proposed will make it better so that the funds will comply with the objective. They will enable the funds to meet the objective of ensuring access to countries in the region, but also for us to better use the funds in order to support regional production, which undoubtedly is one of the most important lessons that we got from the pandemic. First of all, what I'd like to say is to underscore the fact that out of the 4.25% that PAHO contributes on procurement, 1.75 is for the recovery of administrative costs. And this is less than half than what UNICEF invests when procuring vaccines. So it seems to me that this is important information to be borne in mind so that member states will be certain that we have always sought to improve the quality of our resources so that we can always have more effective operations. It is also important to stress that with these changes, this is what we're going to do. And Paraguay expressed a concern that has to do with access to credit lines. The 2.5% that go to the credit line are very important. This credit line enables countries, and there are several countries in the region where the laws do not allow you to pay in advance for the procurement of medicines, vaccines, or medical supplies. So the credit line allows the countries to be able to submit their order. The fund uses a credit line to purchase, and when they deliver the equipment, the supplies, the medicines, the country pays back to the credit line. Up until today, in recent years, this credit line is always growing. You see a credit line that is always growing because what comes out to the country in order to pay for the vaccine that was requested, the country returns the same amount of funds to the credit line. So that credit line grows every year. And in the last 2 or 3 years, countries have used approximately 60 to 70% of that credit line. That is why we proposed that the use of up to 15%, which enables us to have a safe margin, allowing us to realize that the line of credit will continue providing support to all countries in the region without endangering the need for access. But that 15%, as Santiago Cornejo has stated, these are important for the following. First of all, to establish this stockpiling. Let me switch to English.
Development states, they pay more for the transportation because when they procure a small volume of vaccines, 10,000 doses, 20,000 doses, the transportation is more expensive than the vaccine itself. And we know that there are some goods like syringes and others that we can have a stockpile because every year we have a request for that product. So I think that is important to use this 50% to ensure a stockpile, but also for strategic stockpile to face pandemics and the public health emergency. Unfortunately, we learned the lessons from the pandemic, and the manufacturers also learned. So when we approach the manufacturer of the mpox vaccine, for instance, or when we are in negotiation with the manufacturer of the avian flu vaccine, they want to have some financial guarantee to advance the negotiations. So with this, we can present a financial guarantee to move forward in the negotiations in order to have the vaccines available if there is a public health emergency. So I think that this will be very important for the use of this, the flexible use up to 15% of the credit line. The other proposal that the member states are considering in this resolution is to make an exemption of the 2.5% in 2 situations, one for products that are manufactured in our region. So I think that I already mentioned that we have a manufacturer in our region that is in advanced negotiation, with globally known producer, Pfizer, to have a tech transfer process to a vaccine. This will be the first tech transfer process that will be supported by the regional revolving fund, because this will be a very innovative vaccine that will be offered to our member states by the best price in the world. So in this case, to give this exemption for the 2.5% is another support, another incentive to the regional manufacturing. And this is the first, but we really want to have this unique situation that we have in our region, a pool procurement mechanism to incentivize the regional production. We cannot have sustainable regional production if we don't have a regional market. And the PAHO's revolving fund and PAHO's strategic fund, they shape a regional market because we have already overcome the regulatory barriers. So this new product, that is the tech transfer process, they will not have to go to Mexico, to Brazil, to Colombia, to Argentina, to Chile, to Panama, to everyone presenting a dossier to receive the license for their product. Because all the countries in Latin America and the Caribbean have already changed their laws and regulations, and they accept the vaccines that are purchased through PAHO's revolving fund with no need to have a national licensing process. And secondly, bringing together the countries, we can have a volume that will allow us to negotiate a better price. So I think that is another thing that is very important. This is so important that we received 2 weeks ago a mission, around 10 people, our brothers and sisters from the Africa CDC that was created by the African Union heads of state, because they want to receive to learn with us how to establish a pool procurement mechanism. Because they have some manufacturers that are building factories in Africa, but they don't know how to have the proper regulatory approach. They don't know how to have this regional market to make this effort sustainable. So they came to us, we signed a memorandum of understanding, and we are working with them, exploring possibilities that we can better support their efforts to have also a pool procurement mechanism. And our colleagues from the WHO regional office of the Eastern Mediterranean region made the same request for us. Because all the countries in EMRO, our sister region, and in many countries in Africa, they are graduating from Gavi. So because they are increasing their GDP, so they are not more eligible to receive donations from Gavi. They need to purchase their own vaccines. And if they negotiate country by country, countries that don't have a large population, in general, they pay a higher price than when we have this negotiation being conducted together. So I think that this will allow us to improve our regional funds, as Santiago Cordeiro has mentioned, and at the same time to support the development of regional production. So I think that this will really be a very important improvement in the way that we have the revolving funds supporting you and serving the population of our countries.
Muchas gracias.
Thank you very much, Dr. Barbosa, for your comments. And now I'll ask the rapporteur to be kind enough to read out the proposed resolution. Thank you very much, Madam President. Proposed resolution: review of the charge assessed on the procurement of public health supplies for member states. The 61st Directing Council, PP1, having reviewed the report on the charge assessed on the procurement of public health supplies for member states, document CD 61/16, PP2, recognizing the historic role of the revolving fund for access to vaccines, Revolving Fund, the Regional Revolving Fund for Strategic Public Health Supplies, and the reimbursable procurement on behalf of member states, collectively known as the Regional Revolving Funds of the Pan American Health Organization, in facilitating access by member states to essential public health supplies and the evolving needs of the region of the Americas, driven by the rapid advancement of innovations and new technologies in vaccines and medicines, which often come with significant costs. PP3, noting the need to strengthen regional supply chain resilience, innovation, and manufacturing to improve equitable access to quality-assured health technologies, including during emergencies. PP4, considering the potential benefits of utilizing a small portion of the capital accounts of the regional revolving funds to aggregate financing for regional public goods and incentivize investments in regional innovation and manufacturing. Resolves. OP1, to urge all member states, considering their context, needs, vulnerabilities, and priorities, to A, continue to recognize the RRFs as the strategic regional technical cooperation mechanisms most suitable for providing equitable access to public health supplies, including high-cost products and medical countermeasures. B, promote solidarity and Pan-Americanism through participation in the regional revolving funds, exploring areas beyond current engagement. C, endorse the strategic priorities of the RRFs to support member states in addressing emerging challenges and opportunities while allowing for increased flexibility and innovative approaches in the use of these funds. D, authorize the director to use at his discretion and subject to availability of funds up to 15% of the capital accounts of the regional revolving funds to incentivize regional innovation and manufacturing, implement innovative procurement strategies, negotiate the pre-pandemic agreement, and/or develop financing initiatives, all with the aim of responding more effectively to member states' emerging health needs. OP2, to request that the director to A, use the capital accounts of the regional revolving funds to continue providing short-term financing through the credit lines as a priority. B, exempt at his discretion the 2.5% capital account component of the charge assessed on the procurement of public health supplies when, I, the goods are regionally manufactured to incentivize regional production and self-reliance, and/or, I, the products that have high budgetary impact, such as for large volumes of high-cost products. And C, report on the implementation of the above flexibilities to the governing bodies of PAHO at the end of the biennium 2026-2027. Thank you very much, Madam Chair. Thank you, Madam Rapporteur, for presenting this proposed resolution. I give the floor to the plenary to begin the discussion on the proposed resolution.
Al no ver objeción.
Seeing no objections, I declare the resolution adopted. We will now have a 20-minute coffee break, and then we'll come back to continue with the rest of the reports. Thank you.
I'm very impressed with how the Ministry of Health has adapted to low coverage after COVID-19 and the initiatives to improve routine immunization coverage, as well as to restore vaccine confidence in the population.
Brazil is a very large and diverse country, and they've made tremendous progress. And one of the main recommendations is really strengthening laboratory and epidemiologic surveillance in support of the disease elimination goals. I think there's a lot of information systems that are really fantastic, but improving the linkages between those, as well as some improvements related to cold chain vaccine stock management and infrastructure as well.
Que lo que un país que acepta una evaluación está mostrando es que tiene capacidad autocrítica, que acepta ayuda externa, que no se queda con la única verdad que es la de ellos y que está dispuesta a seguir creciendo consiguiendo más información. Creo que los programas de inmunización tienen que convencer a sus autoridades de la importancia de mantener el intercambio con otros países y las evaluaciones.
Todavía hay mucho trabajo. Yo creo que la recuperación se está viendo, pero jamás podemos dar por sentado que eso se va a convertir en algo automático. Creo que en esta última milla para llegar a ese 95% es donde todavía tenemos que emplearnos más, concentrarnos más, y por eso es que este tipo de ejercicios de evaluación, de ver cómo está el desempeño del programa de inmunizaciones, cobran una vital importancia, porque te permite justamente, o les permite a los países saber dónde está esa parte que le está apretando el zapato y cómo justamente salir adelante. Entonces, por eso es que son tan importantes ese tipo de ejercicios.
Brasil ha identificado muchas oportunidades de mejora que ya está implementando a través de este proceso. Brasil está demostrando que sí puede y que su política de salud en el Sistema Único de Salud con el programa de inmunización es una realidad para todos los brasileños y las personas que llegan a Brasil, sus fronteras y sus 5.570 municipios comprometidos con la salud de los brasileños y las brasileñas.
Los espacios subregionales son una oportunidad única para la cooperación entre países como una modalidad para la reducción de desigualdades y mejorar las condiciones de salud de sus poblaciones. Así, de esta manera, desde hace varios años, la organización puso en práctica la Iniciativa de Cooperación Sur-Sur para el Desarrollo en Salud, mejor conocido como CCHD. Y por medio de esta iniciativa, en el año 2023 se pusieron fondos semillas para financiar el proyecto de cooperación Sur-Sur para la detección temprana del cáncer infantil en los países andinos. Esto en una estrecha colaboración con el convenio Hipólito Unanue, el Horas-CONU.
Dentro de los logros más importantes, tenemos la elaboración conjunta y aprobación por los ministros de salud andinos de la hoja de ruta para mejorar la atención del cáncer en niños, niñas y adolescentes en la subregión andina al 2030.
Este proyecto de cooperación Sur-Sur, que incluyó el intercambio de conocimientos y experiencias entre los países de toda la región andina, ha contribuido a la creación de una política subregional, de diferentes estrategias y planes nacionales que abordan de una manera muy objetiva, muy clara y muy directa lo que es la detección y el diagnóstico temprano de cáncer infantil en todos estos países de la subregión.
Lo más importante es que existe una agenda común interinstitucional que permite sumar conocimientos y experiencias en pro de la niñez y la adolescencia, generando un impacto positivo significativo en la atención del cáncer infantil.
El video que vemos ahora nos presenta de una manera muy clara, con testimonios muy sentidos, con una muestra muy definitiva del beneficio que tiene la cooperación Sur-Sur para el desarrollo en salud.
Los niños son de interés superior. Los niños, desde la Convención Marco de Naciones Unidas de Derechos Humanos de Infancia y Adolescencia, son de interés prioritario y su salud también. Y por eso salvar una vida de un niño es fundamental para los gobiernos y para todos los actores.
En estos momentos en La Guajira, pues tenemos varias dificultades en el acceso a la salud en las comunidades indígenas, ya que muchas de estas comunidades son comunidades dispersas, que no se encuentran muy cerca al área urbana. Entonces, esa es la primera dificultad, el acceso y las barreras que se presentan para esas comunidades para obtener un servicio de salud. Y todos los determinantes que puedan disminuir la incidencia de esas enfermedades que están afectando a la población, principalmente indígena, como es el cáncer infantil.
Cuando yo llegué a la clínica me hicieron exámenes, me hicieron radiografía, todo eso, y después me salió que yo tenía una masa. Y después ya descubrieron que es lo que yo tenía. Tenía leucemia y florástica aguda. Es de esa maligna.
En ese momento cuando me dieron la noticia, eso fue duro, porque no me imaginé de que ella iba a tener eso, porque ella era una peladita sana, no tenía nada.
La OPS, desde la iniciativa de mejor atención para las enfermedades no transmisibles como el cáncer, busca fortalecer las competencias, el conocimiento de los equipos de atención primaria, y es en el marco de este enfoque de equidad, de lograr justamente afectación de los determinantes sociales, que se logra este proyecto de cooperación para fortalecer las competencias, el conocimiento de estas enfermedades del cáncer infantil en niños y adolescentes, tanto en profesionales de la salud, médicos, enfermeras y otros profesionales, asimismo también en gestores comunitarios y en toda la red de apoyo social y administrativo que se requiere para lograr un tratamiento de oportunidad, detección oportuna y también de calidad.
Para La Guajira tenemos una población bastante dispersa, una población con unos determinantes sociales muy críticos, en donde definitivamente tenemos que entrar a capacitar al personal que está cerca de esas comunidades, a los mismos líderes comunitarios, para que aprendan a identificar de manera temprana el cáncer infantil y así poder hacer un tratamiento rápido. Tenemos que fortalecer las redes de atención específicas para el manejo de esos pacientes.
Todavía hay pacientes que mueren por causas que pueden ser evitables. Por eso estamos acá, porque hacer los cursos de detección temprana le damos herramientas a los médicos para que ellos puedan detectarlo tempranamente, hacer un tratamiento oportuno y evitar así la muerte temprana en nuestros pacientes.
Hace poquito me dijeron que la masita que ella tiene se está reduciendo al 75%. Ha reducido mucho.
Dejo que lo cuiden mucho porque está dando mucho la leucemia y el cáncer. Y obsérvalos, no deje de observarlo. Y aunque sea un niño, yo soy un vencedor. Yo vivo feliz porque tengo a Dios. Y aunque sea un niño, yo soy
ella le preguntan que qué quiere ser y ella dice, no, yo quiero ser doctora.
Desde el 2021, la Organización Panamericana de la Salud pone en marcha el proyecto Mejorando la Salud de las Mujeres y las Adolescentes en Situación de Vulnerabilidad en Bolivia, Colombia, Ecuador, Guyana, Honduras y Perú, con el apoyo financiero del Gobierno de Canadá para abordar algunos de los desafíos más apremiantes relacionados con la salud de las mujeres y las adolescentes.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including in the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
Fortaleciendo las capacidades de más de 45.600 personas, incluyendo proveedores de salud, servidores públicos y trabajadores de salud comunitarios, como las parteras tradicionales, el proyecto ha contribuido a fortalecer los sistemas de salud desde la atención primaria y a expandir el acceso a los servicios de salud sexual y reproductiva en los 6 países. También ha apoyado la creación de alrededor de 100 orientaciones técnicas para mejorar la calidad de la atención y ha desarrollado iniciativas innovadoras de telesalud para optimizar los resultados de salud materna y neonatal. Partiendo de un abordaje integral y promoviendo la igualdad de género, el proyecto ha fomentado el empoderamiento de las mujeres y adolescentes para que puedan tomar decisiones informadas sobre su bienestar y participen activamente en aspectos relacionados con sus derechos de salud sexual y reproductiva.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Además, considerando la diversidad cultural, se ha implementado la metodología de diálogos de saberes, promoviendo que las comunidades se acerquen cada vez más a los centros de salud a través del intercambio de visiones sobre temas como el embarazo adolescente y las violencias de género. El proyecto se lleva adelante de manera coordinada con los ministerios de salud, la sociedad civil y líderes y lideresas comunitarias en los 6 países, haciendo posibles espacios de intercambio, capacitación y transferencia de conocimientos. La alianza entre el Gobierno de Canadá y la OPS es fundamental para continuar los esfuerzos de mejorar la salud de las mujeres y las adolescentes en situaciones de vulnerabilidad, con miras no solo de avanzar hacia el cumplimiento de los Objetivos de Desarrollo Sostenible, sino para continuar impactando positivamente en la vida de las mujeres y que en un futuro cercano, sin dejar a nadie atrás, todas puedan ejercer su derecho de salud sexual y reproductiva.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
En pile cas de complications obstétricales chez les grandes multipares, c'est des complications que tu as éviter si tu as une campagne très large, si tu as une connaissance beaucoup plus accessible par rapport à la question de santé maternelle et reproductive.
Di yo planin nan paran, tout moun ap kouri di planin an pil bagay la dam. Dap di yo planin nan paran, y a an pil femme ka pense, y gon problem, Mais moi-même, pendant que je suis informé, je ne suis pas rentré dedans, je pense que c'était un problème, mais pendant que je suis rentré, moi, il n'y a pas rien.
WHO support to the Ministry of Public Health and Population in the field of reproductive health in Haiti is made possible through the Universal Health Coverage Partnership. It's a core component of WHO's special program on primary health care. It aims to strengthen the leadership of ministers of health in building equitable, resilient, and efficient health systems on a primary health care approach. PAHO WHO technical cooperation is not limited to trainings and the provision of contraceptive devices. It also aims to create an environment where every woman can make informed decisions about her reproductive health. Improving women's access to family planning and long-acting contraceptive methods is essential to ensuring their autonomy and well-being.
La semana de vacunación en las Américas se ha convertido en el movimiento más grande de la región en favor de la vacunación desde hace 22 años. Con más de 40 países y territorios participantes y la generosa contribución de socios y donantes, hemos logrado un hito extraordinario. Más de 1.15 billones de personas vacunadas y la eliminación de 6 enfermedades en nuestra región. Cada año, los profesionales de la salud llegan a los lugares más remotos para unirse a miles de personas que celebran la seguridad y la protección que traen las vacunas a sus vidas. Los esfuerzos de los países por recuperar las coberturas de vacunación durante la semana de vacunación en las Américas ponen de manifiesto su determinación para construir comunidades más fuertes y saludables. Este es el momento para asegurar un mañana más seguro para todos. La inversión y el fortalecimiento de los programas de inmunización debe continuar para proteger a las poblaciones de las amenazas latentes. La vacunación es un compromiso por el bienestar y la salud de las Américas. Actuemos ahora y protejamos el futuro de todos.
We introduced the Jerónimo Venegas Strategic Reserve for Health Emergencies and Disasters of the Pan American Health Organization, located at the United Nations Humanitarian Response Depot in the Regional Logistics Center in Panama. The reserve has been established as part of a regional operational mechanism that supports countries in emergency situations by sending supplies when needed, providing a rapid, coordinated, and effective response. This is achieved thanks to the coordination among different teams, needs assessment, integration of logistics systems, and the connection of special emergency administrative processes. The technical and operational management of the reserve is under the responsibility of the Department of Health Emergencies of the Pan American Health Organization, in close coordination with technical areas and support entities at the regional level. The benefits of this mechanism include reducing delivery times, decreasing the risks of delays, ensuring safe storage, compliance with quality standards, and an integral vision of health service delivery. The reserve has provided support in situations such as floods, earthquakes, volcanic eruptions, tropical storms, hurricanes, disease outbreaks, and prolonged emergencies in the region. In addition, there is an identified and updated inventory through technical analysis based on lessons learned and experience from previous events. With this, the Jerónimo Venegas Strategic Reserve for Health Emergencies and Disasters demonstrates that, in the face of emergency situations in our region, it is a fundamental mechanism of support for affected countries to protect the most vulnerable and save lives.
La Alianza por la Atención Primaria de Salud en las Américas, lanzada en diciembre de 2023 por la Organización Panamericana de la Salud, el Banco Interamericano de Desarrollo y el Banco Mundial, tiene como objetivo fortalecer los sistemas de salud de la región basados en la atención primaria, para que sean resilientes y equitativos, y avanzar hacia la salud universal. Bajo el liderazgo de los Ministerios de Salud y la colaboración entre la OPS, el BID y el Banco Mundial, la Alianza promueve una acción coordinada que oriente y articule las inversiones en la salud, aproveche las innovaciones y acelere la transformación de los sistemas para mejorar el acceso y reducir las inequidades.
Desde el lanzamiento de la Alianza por la Atención Primaria de Salud, hemos visto un enorme interés por parte de los países de América Latina y Caribe. Estamos trabajando con 10 países para aumentar el compromiso y financiamiento en la atención primaria de salud, bajo el liderazgo de los Ministerios de Salud y con nuestros socios de la Alianza, mejorando la planificación estratégica y la asignación de recursos. Ya sea para mejorar la salud materna e infantil, prevenir y gestionar las enfermedades transmisibles, ou mejorar a atenção e tratamento de enfermidades não transmissíveis, a Aliança está apoiando a los países para que inviertam, inovem e implementem melhor, basando-se na estratégia de atenção primária de saúde. Como hemos visto no diálogo sobre financiamento da saúde organizado para el Caribe, a Aliança pode unir a los setores de saúde e finanças em torno de uma agenda comum, melhorar a saúde para todos.
La Alianza está liderando intervenciones integradas y planes de acción en 10 países de Latinoamérica y el Caribe, y ha apoyado el diálogo entre salud y finanza en 8 países del Caribe. Los esfuerzos conjuntos también están enfocados en el desarrollo de 4 bienes públicos regionales.
Desde el Banco Mundial y trabajando en alianza con el BID y la OPS, estamos comprometidos en apoyar a los países a través de financiamiento, asistencia técnica y ampliando el conocimiento. Hemos formado, por ejemplo, la Comisión Lancet de las Américas, que nos ayudará a entender mejor cómo proveer una atención primaria más efectiva y que llegue a todos. Celebramos el compromiso político de varios países de la región en apostar por la atención primaria de salud como un vehículo transformador y fundamental para alcanzar la cobertura universal y cumplir nuestra meta para el 2030 de ofrecer servicios sanitarios asequibles y de alta calidad a más de 1.500 millones de personas en el mundo.
En el BID, nuestro compromiso con la salud de América Latina y el Caribe es constante. La atención primaria es una prioridad y la estamos llevando al siglo XXI. Una atención primaria moderna es fundamental para abordar los retos de salud de nuestra región, como las enfermedades crónicas y la salud mental. Además, es crucial para enfrentar desafíos globales como el cambio climático y futuras epidemias. Nuestra alianza con la OPS y el Banco Mundial fortalece aún más este compromiso. Juntos y bajo el liderazgo de los países, estamos creando un futuro donde cada persona en nuestra región tenga acceso a sistemas de salud digitales y resilientes.
Con un enfoque participativo y centrado en la acción en los países, se ha avanzado en alianzas estratégicas a nivel nacional, impulsadas por las autoridades, basándose en sus necesidades y prioridades de salud.
Con esta alianza haremos que la atención primaria sea más fuerte en cada rincón de la República Dominicana. Trabajaremos para que nadie se quede atrás. Además, promoveremos una mayor coherencia entre las iniciativas regionales de la APS para hacer que la atención médica sea más ágil, con menos fragmentación, mejor acceso y sobre todo más equidad. Invertir en la atención primaria es invertir en un futuro más justo y sostenible. La salud es un derecho de todos. Juntos estamos construyendo un sistema de salud más fuerte para un futuro donde todos estemos incluidos.
El enfoque absoluto de la Secretaría de Estado en la atención primaria en salud es absoluto. Hemos necesitado socios valiosísimos para poder hacer realidad ese enfoque que nos permita llegar a más personas y a mayor territorio. A pesar de las diferencias o de las dificultades que podamos tener en ese alineamiento, que hay que reconocer no es fácil, son más los puntos de encuentro que los de desencuentro. Y eso nos ha permitido como país grandes mejoras y mejores cosas que vendrán. Estamos optimistas, estamos esperanzados, estamos agradecidos, pero sobre todo comprometidos. La atención primaria es la clave para tener países saludables y productivos.
La alianza continuará trabajando para fortalecer los sistemas de salud en la región, basados en la atención primaria, para ampliar la cobertura y garantizar el acceso universal a la salud, para todas las personas, en todas partes.
La resistencia antimicrobiana es cuando no tomas tu medicina a su debido tiempo y a su debida hora, y eso hace que tengas una resistencia en tu cuerpo.
Los microorganismos para evolucionar necesitan determinados mecanismos que les permitan seguir viviendo. Los antibióticos, los antiparasitarios, que las hemos utilizado como medidas terapéuticas,
We are ready now to start the last session of the day, and we are ready to start with the reports. So, Madam President, por favor.
Muy buenas tardes. Good afternoon. I hope all of you were able to enjoy your coffee. We now continue with item 8.4, implementation of the international health regulations. I'd like to bring the Council's attention to document CD 61/IMP/4, and I would like to invite Dr. Ciro Ugarte, Director of the Department of Health Emergencies of the Pan American Sanitary Bureau, to come to the head table.
Le concedo el uso de...
I yield the floor to the representative of the Executive Committee to report on this item. Thank you, Madam Chair. After reviewing an earlier version of the report on this item, the Executive Committee commended the efforts of states parties of the region to improve the detection and evaluation of acute public health events and to strengthen their core capacities under the international health regulations. It was pointed out that global health crises, including the COVID-19 pandemic, had served to underscore the importance of compliance with the regulations, and it was emphasized that concerted efforts are needed to ensure their effective implementation and to strengthen preparedness for and response to public health emergencies. States parties of the region were urged to review their national legislation, strengthen their national focal points, and allocate sufficient resources to develop and maintain their core capacities. The value of regional collaboration in preventing, detecting, and responding to infectious disease outbreaks was underscored. Delegates welcomed the adoption of the amendments to the regulations, the inclusion of the principles of equity and solidarity, and the agreements reached on crucial issues, such as on access to health products and finance arrangements, were commended, as was the initiative to establish an intermediate level of alert for better emergency preparedness. Thank you, Madam Chair. This concludes my report on this item.
Muchas gracias, señora representante.
Thank you very much, Madam Representative of the Executive Committee. I now call on Dr. Ugarte to present this item. Thank you very much, Madam Chair, Distinguished Director, and delegates and members of member states, distinguished colleagues.
The agenda item 8.4, implementation of the international health regulations, that is included in document CD 61/INF/4. In accordance with the IHR provisions, the current report centers on acute public health events and the states parties' core capacities, the administrative requirements, and governance. Finally, this document highlights issues requiring concerted actions by states parties in the region of the Americas and by the Pan American Sanitary Bureau to enhance future application and implementation of the regulations in compliance with them. Between 1st January 2024 and 31st March 2024, all 35 states parties in the Americas, that is 100%, confirmed or updated the contact information for the national focal points. As of 15th of July 2024, 202 users from all 35 states parties had the credentials to access the WHO event information site. In June 2024, routine tests of connectivity were successful for 94%, that is 33 of 35 states parties in our region. From July 16, 2023 to July 15, 2024, 169 acute public health events of potential international concern were identified and assessed in the region, and 79% of national authorities were the initial source of information. This is extremely important. Now, this is a big change across the several years of reports. Previously, there were 40% of those events were reported first by the national authorities, and now we have 79% of those initial source of information is the national authorities. 90 events affecting 24 states parties and 4 territories in the region were of substantiated international public health concern, and 87% of them were attributed to infectious hazards. For the first time in a consecutive year, all 35 states parties in the region of the Americas fulfilled their obligation to report to the World Health Assembly on the implementation of their capacity requirements under these regulations. PAHO's Secretariat developed a series of orientations for each of the 15th IHR core capacities to better support the member states on the submission of the State Party Self-Assessment Annual Report, SPAR, and conducting the voluntary external evaluations under the IHR Monitoring and Evaluation Framework. In 2023, the regional average for core capacities was 64%, showing a decrease of 3 percentage points compared to 2022 and 2021, when the average was 67%. Surveillance continues to achieve the highest regional average score, 79%. However, it decreased 6 percentage points compared to 2022, when it was 85%. The lowest average was reported for policy, legal, and normative instruments to implement the IHR, that is 50%, decreasing 5 percentage points compared to 2022, when it was 55%. For your reference, the Americas is the only WHO region that has combined the voluntary external evaluations using the SPAR tool, and we are the only WHO region that has performed the VEs, voluntary external evaluations, together with the evaluation of the national immunization programs. We congratulate Guyana, Guatemala, and Brazil for completing the VE, and the United States of America, Jamaica, and Peru, who have already started the process. The outcomes of these evaluations support the decision-making process to prioritize interventions for strengthening the core capacities, particularly the ones that have lower scores. The IHR roster of experts includes 449 professionals, 103, that is 23% of them, belong to the region of the Americas. They comprise experts designated by 11 of the 35 states parties in the region, that is Argentina, Barbados, Brazil, Canada, Cuba, Jamaica, Mexico, Paraguay, Nicaragua, Peru, and the United States of America. We highly encourage all member states to designate national professionals for the IHR roster of experts. The resolution of the World Health Assembly 77th, strengthening preparedness for and response to public health emergencies through targeted amendments to the International Health Regulations 2005, will mark the future governance and implementation of the IHR. The Director General notified the state parties of the amendments of the International Health Regulations 2005 adopted through this resolution in accordance with paragraph 1 of Article 65 of the International Health Regulations on the 19th of September of 2024. It is essential that member states continue to engage actively in the implementation of the IHR, including the amendments that for the Americas would enter into force on 19th September 2025. The Directing Council is invited to take note of this report and provide any comments it deems pertinent. Thank you, Madam President.
Muchas gracias, doctor.
Thank you very much, Dr. Ugarte, for introducing this item. I now invite the Directing Council to take note of this report and make the necessary comments. I open the floor to the plenary to begin the brief discussion and call on Jamaica.
Madam President, Jamaica's experience over the last 5 years has served to underscore the importance of health system resilience that includes attainment of the core capacities defined in the IHR. The health system has been in a constant state of response from the protracted dengue outbreak, followed by emergency of the COVID-19 pandemic and multi-country outbreak of Mpox, to several occurrences of severe weather events, including protracted drought, periods of severe heat stress, and occasions of flooding. We most recently recognized the Mpox outbreak in the African region, declared a PHEIC for the second time. It is therefore critical that a national action plan for health security be developed, and ideal if this can be developed out of an evaluation of our system through a voluntary external evaluation. Our existing programs for health system strengthening will improve our compliance with the IHR. There are some persistent gaps identified in the SPAR and the COVID-19 interaction reviews that indicate the need for external support. Some are already aligned to PAHO's Health Emergency Strategic Plan lines of action, including emergency workforce and laboratory strengthening, health information system strengthening, surge capacity development, and enhancement of emergency medical care. We commend the work of the Bureau and the Secretariat for adoption of the amendments to the IHR in May 2024 and will endeavor to support their implementation. In the interim, we want to highlight that Jamaica is submitting another proposal to the Pandemic Fund that includes activities to enhance One Health capacities, including laboratory services, to strengthen health systems and address antimicrobial resistance, and strongly urge favorable consideration for Jamaica and other small island developing states. Thank you.
Muchas gracias.
Thank you very much, Jamaica. Now I call on Chile. Thank you very much, Madam Chair. Chile believes that within the context of public health emergencies that we face, the amendments to the international health regulations will be an important channel for states party to have the necessary tools in order to achieve better preparedness to deal with future emergencies. On the one hand, the introduction of a definition of a pandemic emergency will facilitate international cooperation for a timely response with less interference in international traffic and trade. Whilst on the other hand, the commitment towards solidarity and equity will enable the states that so require timely access to medical supplies and to funding in order to develop the required response. Chile sees with good eyes the establishment of a committee in order to facilitate the effective implementation of the regulations in its amended version, and the appointment of a national authority for the IHR, which will underscore the important role that this tool plays in facilitating the coordination for the enforcement of the regulations at a national as well as international level. We express our firm will to implement the amended IHR in Chile, and which undoubtedly will become a new and improved IHR. Thank you.
Muchas gracias.
Thank you very much, Chile. And now I give the floor to Cuba. Thank you very much, Madam Chair. Cuba, as a state party and signatory of the international health regulations, continues its enforcement and systematic assessment and development to enrich its implementation and sustainability. Our country moves forward with the implementation of the IHR and complies with what was agreed by the states party of the region of the Americas. We have 24 points of international entry, 7 points of entry covered by health personnel and with the necessary basic capacities as stipulated in the IHR. We've stipulated the relevant coordination between the different agencies of the central administration of the state for the good operation of the IHR and all the plans of action that involve each agency. We've implemented the performance protocols that link from the border with the 3 levels of health. We've expanded the clinical lab and microbiological lab at the different levels in the country, as well as national reference lab at the Pedro Cubrí laboratory, having 28 molecular laboratory institutes covering the whole territory, which belong to the health system, with 18 labs. We've implemented the digital completion of forms before arrival to the country, and also location and placement of travelers. We work on acquiring resources and diagnostic means for operation and expansion in basic necessary capacities installed in the country. Thank you.
Muchas gracias.
Thank you very much, Cuba. And now I give the floor to Brazil. Madam Chair, thank you very much. Brazil would like to thank for this presentation of the rapporteur that has detailed information. We would like to stress our commitment with compliance with the international health regulations at a technical level as well as at a political level as a multi-sectoral approach aligned with the universal health coverage. Brazil concluded in August the first voluntary external assessment using the high assessment tool. We thank PAHO for its support in this important process. It was possible to identify some challenges, and Brazil has already begun introducing changes. The assessment will contribute to medium-term and long-term planning to introduce those changes, and we will await the results. Between July 2023 and July 2024, it assisted us to identify 35 acute cases that required verification, with the creation of millions of assets in public health emergencies. We understand that this is a valuable opportunity to better understand how much useful this tool could be. I'd like to ask the Secretariat to share their thoughts in this regard. Last but not least, Brazil welcomes the positive results of the working group on the IHR. The new provisions agreed will strengthen the preparedness and response to public health emergencies that are essential for developing countries, such as access and funding mechanisms as agreed. In this last September, we received a notification of the state's party on these changes, and we're moving forward with the implementation in Brazil. We appealed to PAHO to work with the state's party to ensure full implementation of these amendments, even through the translation of the text to the official languages in the region of the Americas. Thank you.
Muchas gracias, Brasil.
Thank you very much, Brazil. And now I give the floor to Ecuador.
Muchas gracias, señora Presidenta.
Thank you very much, Madam President. Ecuador would like to express its gratitude for this document and reiterate the importance of the implementation of the IHR and its amendments for the country, since it enables us to ensure health on Ecuador at a regional and global level. Ecuador is committed to preventing international spread of diseases while it prepares the measures for the implementation of the IHR with an interministerial approach in such a way that the risk analysis and the responses will comply with a comprehensive view of public health emergencies of any nature. In this regard, the Public Ministry of Health of Ecuador has deployed several efforts in order to further strengthen the core capacities stipulated in the IHR. An example is the issuance of health certificates on board at the maritime ports Simón Bolívar in the city of Guayaquil, as well as land points of entry at the northern border, which will be reinforced in the core capacities and will allow to establish the binational care center with Colombia. On the other hand, Ecuador has been a pioneer in the region in raising the diagnosis with the implementation of the gender approach within the surveillance process, epidemiological surveillance process, improving the capacity 1.2 of the IHR and implementing 20% of the score in this capacity. In spite of these efforts, Ecuador urges PAHO to continue strengthening international cooperation because for some countries, as is the case of Ecuador, we still see some challenges that persist and that have to do with the shortage and scarcity of the human talent that are covered by the National Liaison Center. Ultimately, Ecuador ratifies the support to the amendments made to the IHR, which enable us to have greater clarity in the definition of health products and supplies in order to face health emergencies. Ecuador takes note of the report. Thank you very much.
Gracias,
Thank you, Ecuador. And now we give the floor to the U.S.
Thank you very much, Madam President. The United States thanks PAHO for the report and commends member states for their continued commitment to implementing and adhering to the International Health Regulations 2005. We sincerely appreciate the open dialogue and close cooperation throughout the negotiations with our fellow PAHO member states in both the IHR negotiations and the INB. And Dr. Barbosa and Dr. Garte, I just want to also thank you and your whole team for the incredible work of the PAHO Secretariat, frankly, to bring us together in really innovative ways, including health and foreign ministries, to find solutions that actually worked for the amended IHR and hopefully in the future for the INB as well. On a personal note, I want to thank the region, everyone in the region for their trust in me over the last 3 years to serve as a member of the Bureau for the WGIHR and the Working Group on Preparedness and Response. All of this highlights the significance of regional cooperation in successfully preventing, detecting, and responding to infectious disease outbreaks and driving public health progress in multilateral fora. COVID-19, the recent Mpox outbreak, as others have discussed, and other global health crises continue to highlight the vital necessity of fully implementing and complying with IHR obligations. And just want to say that the United States remains fully committed to working together with PAHO member states and global stakeholders to implement the amended IHR in a way that operationalizes equity and more effectively and results in more effective pandemic prevention, preparedness, and response for all of our communities and people. As Dr. Garte noted, the United States has just completed its second joint external evaluation using the revised third edition of the tool, which includes a greater elaboration in a number of technical areas, including legal preparedness, sustainable financing, and IHR coordination, as well as new areas like infection prevention and control. And we are grateful to hear of the many other countries around the region that are undertaking similar voluntary external evaluations and would commend this process to all of our colleagues in the region to improve our collective prevention, preparedness, and response. I thank you very much.
Muchas gracias.
Thank you very much to the U.S. And now I give the floor to Panama. Thank you, Madam Chair. Panama would like to thank the Secretariat for this report, after which we'd like to say that regarding public health acute events, we're pleased to see that for the second consecutive year, all states party have updated and confirmed their focal points, thus complying with the commitment of maintaining availability of these at all times. On the other hand, Panama has implemented the epidemiological intelligence open source system to strengthen event-based surveillance. However, it is essential to continue strengthening the system and the timely response when faced with events that might constitute a public health emergency. Regarding core capacities of states party, the average of 64% of the self-assessment reports as a result of the responses to the guiding questions of the external evaluation leads us to believe that we ought to continue working in order to improve these core capacities, focusing on capacities that historically show backlogs as capacities 1, 2, 6, 9, 14 by means of strategies and regional adequate budgets. We are facing several challenges. The first one is to implement the 28 amendments adopted at the last World Health Assembly, the inclusion of new definitions and key elements such as the national authority for the IHR, and secondly, to articulate the amended IHR with the pandemic accord, even under negotiation, and therefore we cannot discard our concern for the negotiation of that agreement because after 11 INBs, we're not able to reach a consensus on sensitive issues. We hope to perform our external assessment in the short term. Thank you. Thank you very much, Panama. And now I give the floor to the Dominican Republic. Thank you very much, Madam President. The DR would like to welcome the report submitted and the progress made in the last period. We also thank and acknowledge the efforts made by PAHO to support countries in the region in the implementation and compliance with the IHR. Our country maintains the commitment with the implementation of the IHR and continues working on key areas in order to improve the surveillance and response capacity and to ensure effective compliance with the regulations. We've achieved significant progress in our efforts in order to improve the surveillance capacity, detection, assessment, early reporting in cases of acute events in public health. Also, we have had progress in the implementation of tools, epidemiological intelligence, improvement in health infrastructure, as well as cooperation as regional organizations to ensure compliance with international standards. This includes the implementation of measures for the control of diseases, the concern for outbreaks, and the concern about health outbreaks. We've intensified efforts and contacts with PAHO's office, such as international points of entry to the country, and with that, we hope to see progress in the coming years in capacities such as zoonosis and laboratories through the development of the One Health strategy and all the other relevant structures. We reiterate our commitment and compliance with the IHR, particularly the new package of amendments that was adopted at the last World Health Assembly, as well as our willingness to work in cooperation with member states and PAHO in building a better future for the countries of the region. Thank you.
Muchas gracias.
Thank you, Dominican Republic. And now we give the floor to Honduras. Thank you, Madam President. Honduras agrees with the report on the international health regulations. We greatly appreciate the proposal as a state to continue with preparedness, prevention, and response when dealing with public health emergencies of national and international concern. Compliance with the IHR implies a series of strategies and efforts to be made by the authorities in the country in order to fully comply with the core capacities in preparedness, prevention and response, which were weakened with the COVID-19 pandemic. Honduras continues to strengthen its intersectoral and interinstitutional coordination in One Health in order to reduce the threats to human health, to improve surveillance in the points of entry, and to improve the core capacities is key for the detection of events such as potentially epidemic or pandemic outbreaks, and to give a public health response that is well guided and coordinated. It is important to highlight the coordination between states or parties in surveillance and exchange of information that is supported with the understanding that threats to health have no borders. Honduras participated in these sessions on the amendments adopted in 2024 to the international health regulations in 28 of the 66 provisions of the IHR, including 3 new definitions in Article 1 and in 6 of the annexes, where we adopted the creation of a committee for the implementation of the IHR to facilitate the effective enforcement in its amended version, which shall promote and support cooperation amongst states party for the effective enforcement of the same. As a priority country, we raised the proposal of being able to carry out an external voluntary evaluation, thus being a voluntary, cooperative, and multi-sectoral process in order to assess the capacities of the country to prevent, prepare, and quickly respond to risks to public health. Thank you.
Gracias, Honduras.
Thank you very much, Honduras. And now I call on Guyana.
Thank you, Madam Chairman. Guyana takes this opportunity to congratulate the member states of the 61st Directing Council and thank PAHO WHO team that delivered this report on the implementation of international health regulation. Guyana is encouraged to continue its national effort to advance the implementation of the IHR 2005 and its recent amendments, while working towards the improvement of national capabilities. In Guyana, has undertaken key steps that facilitate the implementation of IHR 2005, These steps include, but are not limited to, reformation of a national multi-sectoral committee to serve as the IHR national focal point, revised approach to the completion of the annual SPAR report, completion of the first ever joint external evaluation in the format of a voluntary external evaluation using SPAR indicators in 2023 with the support of PAHO, completion of a national action plan for health security in July 2024, which have been costed and partially proposed for inclusion in the domestic budgetary allocation, collaboratively with PAHO, based on these findings and recommendation with the V and JEE 2023 and the National Action Plan on Public Health Security 2024, efforts are underway to develop several other capabilities, including one, increasing capacity building for laboratory personnel and development of new testing modalities, the development of a national laboratory strategy and the potential certification of a national reference laboratory as a national influenza center, the first-time introduction of the DHIS2 influenza surveillance and epidemic intelligence forum, the development of a national AMR strategy with focus on improving IPC programs, conducting mass casualty management training at point of entry, the ongoing process of updating the health multi-hazard emergency management plan with focus on pandemic prevention, preparedness, and response, and the ongoing work to operationalize and achieve targets for the National Disease Elimination and Control Initiative, which target communicable and non-communicable diseases for elimination and control by 2030. Finally, we encourage PAHO, WHO and member states with developed capacity to provide support via bilateral and multilateral efforts to enhance IHR implementation throughout the region of the Americas. Thank you.
Muchas gracias.
Thank you very much, Guyana. Now I call on Costa Rica. Thank you, Madam President. Costa Rica has significantly increased the core capacities in a satisfactory way in communication test, managing emergencies, preparedness in acute events, and surveillance in public health. We still have to work on rules and regulations, but we're on the right track. We need to follow a strong consensus and articulation at an international level in order to come up with the IHR. Although this is temporarily being developed, but you can amend this internally to begin enforcing it or attempt to do it with the current one. But the message here is for all member countries to begin translating this into practice. This is what is important. In general, Costa Rica welcomes the document as a guide for the strengthening of core capacities of states in the response to health emergencies and as a platform in order to improve international cooperation, and urges all countries in the region to concentrate their efforts in operationalizing these regulations. Why? Just think about it. There is an individual responsibility here in order to come up with a collective result. If each one of us does not translate into practice the IHR, we will not truly be able to achieve what is intended, which is to be prepared when faced with a potential emergency. So I would once again express my gratitude for this appeal, and particularly to all members, to respond to the commitment that we have. Thank you very much.
Muchas gracias.
Thank you very much for Costa Rica, and now I give the floor to Bahamas.
Madam President, the Bahamas is appreciative of the report on the status of IHR implementation for the region. For acute public health events, while connectivity improvements signal stronger communication frameworks, the volume and significance of the identified events call for increased focus on strategic public health systems, strengthening public health systems and policies across the region. Examining the core capacities of public health systems reveals both commendable achievements and concerning trends. On the positive side, all 35 states successfully completed the SPAR for the second consecutive year, indicating a commitment to accountability and oversight. However, this achievement may be overshadowed by the decline in regional average core capacities. While surveillance remains the highest scoring capacity, 79%, a significant decline of 6% points suggests potential deterioration in this crucial function. Alarmingly, the average score for policy, legal, and normative instruments stands at just 50%, indicating a critical gap in the ability to create and enforce effective health regulations. The disparity between average scores across the region, with the Caribbean prominent, highlights uneven resource distribution, while decline in low scores in key areas in other subregions further underscore possibility of systemic issues. Madam President, for the PAHO Program Budget 2024-2025 to drive improvement, translating indicators into meaningful action is essential. A strategic focus on policy development, strategic resource allocation for implementation and compliance, and enhanced regional collaboration is crucial for strengthening public health systems throughout the Americas. The Bahamas remains committed to improvements in health infrastructure to achieve national, regional, and global health security, and we thank PAHO for the ongoing support. I thank you.
Muchas gracias.
Thank you very much, Bahamas. And now I call on Dr. Ugarte to respond to the comments. Thank you very much, Madam President. I would like to thank all countries for their comments, and I would like to stress the commitment of each one of our member states in completing the annual evaluation. But beyond this, in looking and trying to find in these evaluations more sincerity with the results, considering how we answered to COVID-19. When one conducts or performs an evaluation and we want to translate that evaluation into a concrete response, so we see that the levels of the core capacities of the IHR in some countries, and in general in the world, are not related to the way they responded to the pandemic. And this exactly same thing has to do with the Global Security Index that was developed with the World Bank. And when we see the countries that are at the highest score level, these are some of those that had the greatest impact. And even with that, I would like to highlight the efforts made by several of our countries that made this voluntary assessment, such as the case of Guyana. It translated this assessment into a plan of action, and that plan of action was implemented with national resources. But we acknowledge that the financial need to be able to improve these capacities is of a regional and global nature. And in that regard, I'd like to report that with the support of PAHO Secretariat, we've developed for the second round of the Pandemic Fund 19 projects that were presented by member states of the Americas. All these projects that were submitted by the member states of the Americas have been considered as valid by the advisory team of the Pandemic Fund. This means it shows that these have been duly carried out, and that includes a request for funding of over $385 million for 26 out of the 28 eligible countries to participate in this round. So the result of these round will be announced on October 18th this year. So we hope that this time we will have more resources for the region of the Americas in comparison with the first round. In any case, as you have clearly stated in all your statements and comments, the initial and primary responsibility of the capacities of the IHR are in the hands of each state party, and the cooperation amongst the countries is shown in the work we do, for example, on points of entry. PAHO, in cooperation with the International Civil Aviation Organization, ICAO, and the Executive Secretariat of the Council of Ministers of Central America, and the disease control centers at the CDC in the United States worked together in order to hold a sub-regional meeting in Central America and the Dominican Republic, where they specifically analyzed the issue of points of entry. Many of the countries have designated the points of entry, but the points of entry require a whole set of criteria and capacities. And this is a matter that is extremely important, and in Tegucigalpa, in June this year, that analysis allowed several countries to review within what these characteristics are, and in some cases, to reduce the number of points of entry that had been identified. I would also wish to congratulate Ecuador for having begun the process of including the gender approach, because it is one of the indicators of the lowest scoring in the regulation. So that's a significant point. And then the epidemiological intelligence open source system that several countries are implementing with a greater commitment. In the case of Brazil, it is being used as an instrument for epidemiological surveillance, routine epidemiological surveillance.
That's extremely important. In other words, not only are we looking at the official information that comes to us through regular channels, we'll also checking on the open sources, and they report our reports and our epidemiological intelligence. So we've been observing that although the levels of the assessment of the basic capacities of the IHRs are at a lower level, there is an attempt to standardize the levels. And the guidance notes to assess those capacities now allow us in all countries to have an agreement on when we score 1, 2, 3, 4, 5 in capacities and why we do so. For instance, when can we consider that a plan actually exists? Is it when it's a draft, when it's been approved, when it has been gone through the minister's office, or when it's being implemented? There are many different levels. At each point, we could say we have a plan, but it doesn't necessarily mean it's being implemented. So it's a joint commitment which affects the safety and the population of the Americas. Thank you so much.
Gracias.
Thank you, Dr. Ugarte, for responding to those comments. Mr. Director, do you have any comments to make? Yes.
To congratulate all member states for reaching a very important agreement during the World Health Assembly that approved the amendments on the international regulation, and a special recognition to our representative of the region, Mr. Colin McKeith, that for 3 years participated in very complex discussions, and I think that was very important that the suggestions, the comments, the proposals, all the countries of the region come together and to support in his efforts. I think that it was remarkable indeed. Second, I agree with this comment from Sirugati that now the self-assessment is very more realistic, because we had a real-time test that was a pandemic. So some countries that before the pandemic said, yes, I have a laboratory capacity. And when they had to scale up their capacity that was supposed to deal with 10, 20 samples for new emergency diseases that produced a small number of cases, and they had to scale up that in a couple of weeks to run thousands of PCR tests, they realized that they didn't have the laboratory capacity or the mechanism to scale up the laboratory capacity that they need to have when there is a public health emergency. So I think that this is better because it's more realistic. Second, it's very important, this alignment that we are using in this region, and as Sirugati mentioned, is a unique situation that I think that we can maybe to support the other regions to do the same. The alignment between the indicators using in the voluntary external evaluation and the SPAR, the self-assessment. I think that this will bring a more a more realistic approach. And at the same time, we allow the countries to have a clear vision about what they expect when they agree to have a voluntary external evaluation, and at the same time to follow up after the voluntary external evaluation. So I think that it's much better to have the same set of indicators. And we also are working in the region with another evaluation that is being performed at the same time, that is the immunization, national immunization program evaluation. So the countries are paying for one and receiving two, let's say so, because they receive at the same time a report about their capacities, to improve their capacities of detection, response, preparedness, detection, and response, and at the same time, they receive a thorough evaluation about the national immunization program. And finally, the pandemic fund, we know that we had only 4 proposals approved for the first round. Suriname, Paraguay, one presented by CARFA, and one multi-country proposal presented by PAHO. I personally had meetings with many members of the board, and I would like to take the opportunity to ask the member states of the Americas that are part of the board that you need to call the attention for the needs that we have in Latin America and the Caribbean. I think that every region deserves to receive the support, but if we want to have more countries offering to receive and engage in the voluntary external evaluation, we also need to have some instruments to support the countries after the moment that they receive the report. So I think that's very important. We have specific challenges in our region. The situation in the Caribbean with a small state and small island developing states. We have many countries in Central America and South America that have specific difficulties that the pandemic fund, now that we will have more funds available for the second fund, we are really expecting to have more proposals from Latin America and the Caribbean supporting our countries to strengthen their core capacity. Thank you, Madam President.
Muchas gracias.
Thank you, Dr. Barbosa, for your comments. I'd like to inform the Council that the discussions will be noted in the final report. Before proceeding to the next item, I'd like to make some announcements. First of all, I'd like to thank you for the very efficient manner in which we have been having our discussions at this Directing Council. I believe the documents that remain are for information purposes, and we require all of your cooperation so that we can conclude our meeting on time. So I'd like to ask you to limit your comments to the time allocated so that we can complete the scheduled agenda, finish early, and in this manner. Today there's some great sunshine outside after many days of sunshine, so that we could enjoy that a bit. If we could do so, it'd be wonderful. So we move on to the next item.
El punto 8.5.
Item 8.5, Plan of Action on Entomology and Vector Control, 2018-2023 Final Report. I would like to bring to the attention of the Council document CD 61 Inf 5 and invite Dr. Sylvian Aldigueri, Director of the Department of Communicable Diseases Prevention, Control, and Elimination of the Pan American Sanitary Bureau, to come to the head table. And I now yield the floor to the representative of the Executive Committee to report on this item. Thank you very much, Madam Chair. The Executive Committee examined the final report on the Plan of Action on Entomology and Vector Control during its June session. The committee was informed that 6 of the 11 indicators of the Plan of Action were achieved. 3 were exceeded, 1 was partially achieved, and only 1 was not achieved. It was pointed out that The COVID-19 pandemic led to the diversion of financial and human resources away from the vector control programs, impacting their financing and operations. The pandemic also highlighted the need for vector control programs to prioritize updating and adapting their protocols for routine surveillance, periodic vector control, and timely responses to future vector-borne diseases and emergencies. Thank you, Madam Chair. This concludes my report on this item. Thank you very much, Madam Representative of the Executive Committee. I now invite the Directing Council to take note of the report and provide any comments it deems pertinent. I open the floor to the plenary to begin the discussion. And I call on Paraguay. Thank you, Madam Chair. We recognize the importance of the Plan of Action on Entomology and Vector Control 2018-2023, and we have taken note of each one of the recommendations contained therein. In this context, the year 2018 was significant for Paraguay because we received this plan at a historic moment for public health in our country. We were certified by PAHO WHO for the elimination of malaria and the transmission of Nosoma cruzi at the nationwide level. These achievements reflect our commitment to public health. Also, our country had strengthened actions in the comprehensive management of vectors through the participation of many community and governmental participants. The technical assistance of PAHO WHO has provided fundamental support to implement, develop, and assess our goals. As to the 5 strategic lines defined in 2018-23, we have completed all fully and continue to work hard in establishing and following those goals. Today, we would like to impose the preparation of an action to control vector control diseases in the next 5-year period. This plan should have a more specific and less holistic approach, reflecting the critical aspects that deserve immediate attention, and Paraguay has a lot to contribute to this effort. Thank you very much. Thank you, Paraguay. I now call on Honduras. Thank you very much. Honduras is in agreement with the report on the Plan of Action on Entomology and Vector Control 2018-2023 because it presents challenges and opportunities that are significant. In my country, in the last 5 years, we've made significant progress, such as the development of a manual for the management of resistance to insecticide, improvement of the entomological laboratories infrastructure, and a progress in investigation on biological surveillance of vector-borne diseases. We've also used modern technology for vector control, using epidemiological surveillance to identify areas of risk and strengthening elimination of carriers through sanitation methods and biological control. All of these efforts are crucial for strengthening our response capacity to diseases that are vector transmitted. However, there's still some gaps because we don't have coverage in vector control activities due to a lack of field experts. And it is urgent, therefore, to hire new human resources at the national level in order to improve our response capacity, and note the need to provide training and synergy with academia for technological experts in modern methods of control, giving importance to intersectoriality. We've also highlighted education and community awareness, communicating preventive actions, and promoting active participation in the combat of vectors through trying to bring about a change in human behavior. We have invested in specialized personnel and in providing continuous equipment. This, together with the strengthening of our information and early warning systems, has allowed for a better response to the outbreak of diseases transmitted by vectors. This demonstrates the firm commitment of Honduras to improve public health and mitigate risks associated with vector-borne diseases. Thank you very much. Thank you, Honduras. I now call on Panama. Thank you, Madam Chair, distinguished members. Panama is appreciative of the final report that highlights the progress achieved in the Americas in fulfilling the Plan of Action on Entomology and Vector Control 2018-2023. In spite of the repercussions of the COVID-19 pandemic and its effect on the financing to control actions for vectors-borne diseases, we support each of these points in the report that highlight the effort made by member states to address these public health problems and acknowledges that there were some goals that were not achieved, which we should think about to see how we can redirect national and regional efforts within the framework of government policies to attain the goals set. The implementation of this plan has allowed us to have methodological models that have improved our response to vector control based on shared evidence, to strengthen areas of action based on a plan, to close gaps and regional disparities for all indicators. We agree in the need to strengthen human resources by providing skills in entomology and strengthen the installed capacity of vector control at all management levels to achieve effective control of disease-borne vectors. We, taking into account the current meteorological situation in the region and the spread of malaria, we would like to assess the extension of this plan or perhaps develop a new one. We urge member countries to join our request. Thank you. Thank you, Panama. I now call on Bahamas.
Thank you, Madam President. The Bahamas notes the report on the 5-year Plan of Action on Entomology and Vector Control 2018-2023 and adds its congratulations to the stellar job accomplished by PAHO in meeting the targets outlined. As of the 11th targets programmed, 81% or 9 were met, including 36% where the targets were actually exceeded. The report demonstrates the solidarity of purpose by member states in implementing programs and plans of action. However, the Bahamas notes with concern that the 2 indicators that were not met related specifically to the building of expertise in member states. This is an area that has historically been a challenge in the region, as specialized human resource numbers in smaller countries are hard to identify, recruit, engage, and retain. This was highlighted in the report on page 7. The Bahamas believes that there is a need for PAHO to continue to work with member states in drafting strategies for the engagement and retention of the necessary skill sets and requisite expertise for vector-borne control, and notes the potential and significant impact failure to do so may have on a newly introduced strategy on epidemic intelligence for strengthening early warning of health emergencies 2024-2029. We further recommend that Objective 5 in the report under discussion be closely examined to provide specific recommendations on how this gap can be strategically remedied, especially in light of the earlier raised fact of climate change's role in the rising numbers of mosquito and rat vectors in tropical countries and small island developing states. Nonetheless, the Bahamas once again commends the collective work of PAHO and member states on the achievements made, even as the Bahamas seeks to pursue the actions recommended in the report to consolidate improvements to the health system brought about by the implementation of the Entomology and Vector Control Plan 2018-2023. Thank you.
Muchas gracias.
Thank you very much, Bahamas. I now call on Jamaica.
Thank you. Madam President, Jamaica wishes to commend PAHO on the successful implementation of the Plan of Action regarding vector-borne diseases. We note with appreciation that out of 11 indicators set, 6 were achieved, 3 were exceeded, 1 was partially achieved, and only 1 was not achieved. We also acknowledge the impact of the COVID-19 pandemic on the progress of these indicators. The action plan has proven to be vital in steering the region toward a strategic response against vector-borne diseases. In alignment with this initiative, Jamaica developed its National Integrated Vector Management Strategic Plan for the period 2020 to 2025, which is currently underway. This strategic plan encompasses 5 key actions that parallel the objectives outlined in the Plan of Action on Entomology and Vector Control for 2018 to 2023. Among our priorities is the development of innovative tools for vector management. In this regard, Jamaica is piloting the sterile insect technique, We have made strides in establishing our mass rearing facility and have successfully colonized the local strain of Aedes aegypti. The next phase of this initiative will involve releasing these insects as part of our control efforts. Another priority has been the establishment of a program for monitoring of insecticide resistance. Jamaica remains committed to the continued implementation of the strategic actions, but recognize that despite the progress achieved, dengue and other vector-borne diseases remain a substantial burden for the people of Jamaica and the wider Caribbean. Hence, it is imperative that we consolidate the gains made thus far and intensify our efforts to mitigate this ongoing public health issue. Considering these challenges and to sustain the momentum gained under the Plan of Action, Jamaica respectfully requests the development of a new action plan to cover the period from 2025 to 2030. Thank you.
Muchas gracias, Jamaica. Ahora se...
Thank you. Jamaica, I now call on Guatemala. Thank you, Madam Chair. Guatemala reaffirms its commitment to the battle against vector-borne diseases, diseases that continue representing a high level of morbidity for our populations. The climatic and socioeconomic conditions of our region expose our communities, even the most vulnerable, to these diseases and aggravate health inequality. During the period 2018-2023, we have aligned our strategies with the Plan of Action on Entomology and Vector Control of PAHO. In spite of the challenges presented by the COVID-19 pandemic, which interrupted our programs, we have integrated epidemiological and entomological data to make more precise and timely decisions. We are committed to the training of our technical staff specializing in vector control and develop partnerships with the educational sector and developed activities targeting communities to encourage active participation in eliminating mosquito breeding grounds. However, creating awareness amongst the community is one of the main challenges in the country, as well as involving key stakeholders such as municipalities in the management of water and sanitation. We realize there's still gaps in the country, particularly in the need to ensure sustainable financing for entomological surveillance programs and vector control. Finally, we urge you to continue promoting regional networks for technical cooperation because we believe only through collaboration and exchange of experience can we move forward towards eliminating these diseases transmitted by vectors in the Americas. Thank you. Thank you, Guatemala. Now call on the Dominican Republic. Thank you. The Dominican Republic welcomes with satisfaction the report on vector control and the advances in innovative means of controlling these diseases. Our country aligns itself with the regional plan of action by implementing a system of entomological surveillance with medical indexes combined with early warning, with specialized priorities for the new outbreaks. Since 2022, we've set up an early warning and alert system in 5 provinces with high levels of dengue, using climate data as well as epidemiological data to predict and combat the vector at an early stage through traps and other tools. We've also managed buying new procurement for tanks and preventing vectors in water storage by protecting the population. Under the direction of the Ministry of Health in 2023, we promoted and strengthened intersectoral meetings at the provincial and municipal level to control any outbreaks, and this has been accompanied by educational prevention campaigns. The Dominican Republic supports the measures in the report, particularly those that target collaboration between sectors to address social determinants, environmental determinants that favor vector-borne diseases. the technical operation networks and timely management of resources to ensure the proper equipment and staff for entomological surveillance has also been undertaken. Finally, we have called for the training of specialists in entomology and vector control to ensure progress in our battle against vector-borne diseases. Thank you very much. Thank you, the Dominican Republic. I now call on Puerto Rico. Thank you, Madam Chair. Puerto Rico welcomes the final report on the Plan of Action on Entomology and Vector Control 2018-2023. The adoption of the comprehensive strategy for epidemiological, entomological, and laboratory surveillance systems has improved the detection of viruses and control of them. With the support and cooperation of PAHO, we have set up a team that includes the Health Department and the dengue branch of the CDC and other agencies, so as to address, from a comprehensive perspective, the virus control, particularly dengue, by trying to contain the current epidemic outbreak we have in Puerto Rico. Without mosquitoes, there is no dengue. Thank you.
Muchas gracias.
Thank you, Puerto Rico. I now call on Dr. Alighieri to respond to the comments.
Señora Presidenta,
Thank you, Madam Chair.
quisiera enmarcar
I'd like to frame my comments around 3 points. First, the regional initiative to eliminate vector-borne diseases has a long list of diseases that are covered by this strategy: Chagas disease, lymphatic filariasis, onchocercosis, yellow fever, malaria, and the plague. So we have a framework and initiative up until 2030 to cover this. So I think that's an important chronology. But first, let me give you the epidemiological context at the moment. Beginning last year, the countries in the Caribbean and South America, including the Andean countries, and at the moment, the Central American countries, are all undergoing a significant outbreak, the biggest in modern history, a big outbreak of dengue, which has significantly affected health services as well as society. This demonstrates the need to work in one of the pillars of the strategy for comprehensive management of dengue, which is entomology and vector control. I'd also like to briefly mention the resurging emergence of a virus called Robuche, which has been reported in several countries in the Caribbean basin, Amazon, with presenting new challenges. We're talking about different vectors. So in reviewing and carefully reviewing the contributions made by the 8 delegations, I can respond now to a concern that all of you have expressed, which has been a request, actually, to follow up on the 2018-2023 plan. The Secretariat, with the support of experts, has developed a draft plan which will carry us out till 2030. That is compatible with the requests and suggestions made by the countries under the framework of this elimination initiative. This plan, which we will have to share more broadly, it's been prepared by experts from PAHO, will have 4 pillars using the lessons learned and the assessment from the last plan. The first pillar will be to restructure and modernize surveillance with the goal of being able to respond more quickly and better to emergencies of vector-borne diseases and entomological surveillance as well. The second pillar would be the assessment of access and inclusion of new technologies, as others have mentioned. And the third axis would be the effective interventions, including community participation. And the fourth pillar has been mentioned by almost all delegations, which is the challenge of training and updating human resources so that they are informed of the latest data.
Delegations from the Caribbean regarding the importance of climate change. We have obviously the impact of climate change regarding dynamics of vector-borne diseases. Dengue is one of the examples. Maybe Oropuche also, it's one of the examples that we can use at this moment. So it has been, it must be tackled also in a context of climate change. And I'd like also to note the introduction of new technologies in some countries of the Caribbean, including sterile insects. But I also would like to mention that many countries on the mainland have developed and included methodologies using the Wolbachia for vector control at this moment. Muchas gracias, señora Presidente.
Thank you very much, Madam President. Thank you very much, Dr. Alighieri, for replying to the comments. And now I'd like to give the floor to the International Atomic Energy Agency.
Thank you, Chair. Distinguished delegates, honorable ministers, the International Atomic Energy Agency promotes the safe and peaceful use of nuclear science and technology, including in the areas of human health, which includes non-communicable diseases and nutrition. In particular, the IAEA supports radiation medicine for the diagnosis and treatment of cancer, as well as supporting radiation safety for patients, medical workforce, and the environment. On September 26th this year, the directors of PAHO and IAEA signed a new memorandum of understanding, broadening the scope of cooperation between the two organizations in the field of cancer care, radiation safety and regulatory infrastructure, vector control, preparedness and response of emergencies, nutrition, and animal and zoonotic diseases. The partnership will be further enriched through IAEA's flagship initiatives, which includes the Zoonotic Disease Integrated Action, also known as Zodiac, which helps countries prepare and prevent pandemics. The IAEA and PAHO are also working together on controlling mosquito-borne diseases like dengue, Zika, chikungunya, using approaches such as the sterile insect technique. Joint meetings and training courses have been held and are planned for 2025 to provide comprehensive support from both entomologic and epidemiologic perspectives. 18 countries are currently participating in this initiative. Thank you.
Muchas gracias a la...
Thank you very much to the International Atomic Energy Agency. Director, do you have any comments?
Gracias, Ana Presidente. Muy breve, porque estamos ya, yo creo que en el límite del horario. Pero solo para subrayar que cuando plan de acción sobre tema tan importante como este de entomologia e controle de vetores termina su período, não é necessário.
When it concludes its mandate, we don't need a new resolution because that is part of the mandate that we have. It is part of that initiative, and no doubt this is perhaps one of the most significant areas for technical cooperation that needs to be strengthened in all countries of the region, be it in the training of more entomologists in order to support the ministries in issues of surveillance, improving the surveillance systems for vectors, and also the actions themselves for vector control. Unfortunately, as Sylvain Alighieri mentioned, in connection with the Aedes aegypti, which is a vector that leads to the greatest concern in the region because of the dengue outbreak last year and this year, more than 11 million cases, I believe. We still don't have, and let me put it in positive terms, we have some new strategies and innovations, but we will still need much more time and assessment so that we can escalate this and to have feasibility for this to be used in countries such as, for example, a contamination with the Wolbachia bacteria. So it seems to be, and others. At the same time, we have to support all the developments in new technologies to improve the technologies that are already available and what we can do in order to turn more effective the participation of the community, the families, intensifying the identification of epicenters of the multiplication of the vector populations such as the Aedes aegypti in the cities. And it seems to me that with the tools already available, we have to see how we can transform these actions and make them more effective. A huge challenge that we have is that, as we know already, dengue, besides having one part where we don't have a dengue, many times after a dengue outbreak, we can have months without dengue. And this gives us the false impression that the problem has disappeared, and it didn't disappear. It will come back 2, 3, 4 years later when there's a new serotype that will come into the population. So it is a matter of concern. It is a threat that we have, vector-borne diseases, and I believe that this continues to be one of our priorities in our technical cooperation for countries in the region. Thank you. Thank you very much, Dr. Barbosa, for your comments. I would like to let the Council know that the debate will be reflected in the final report. And before we move on to the next agenda item, we have 2 more reports to do, 8.6 and 8.7. And thus, tomorrow, we will do 8.8 and 8.9. And we will group, if you agree, the reports, the progress reports, so that we can conclude at 12 noon tomorrow. Because as a president, I would like to bring this meeting to an end, and I also understand that there are other members that have travel arrangements at noon tomorrow. Thank you very much. Do you agree? Very good. So let us move on to 8.6, agenda item 8.6. Plan of action for the sustainability of measles, rubella, and congenital rubella syndrome elimination in the Americas 2018-2023 final report. I bring to the attention of Council document CD 61 Inf 6, and I invite Dr. Daniel Salas Peraza, Executive Manager of the Special Program on Comprehensive Immunization of the Pan American Sanitary Bureau, to please come to the table. Thank you, Doctor. I now give the floor to the representative of the Executive Committee to report on this item. Thank you very much, Madam President. The Executive Committee was informed that 6 of the 12 indicators of the Plan of Action were achieved. All of them are related to vaccination coverage and epidemiological surveillance. The committee was also informed that all countries in the region have maintained their rubella and congenital rubella syndrome elimination status since 2015. However, the region lost its measles-free status in 2018 as a result of the re-establishment of endemic measles transmission in 2 countries and measles outbreaks in another 16 countries. In all cases, rapid response teams were deployed and plans of action were implemented to halt transmission. As a result, the region is expected to regain its measles-free status in 2024. In the committee's discussion of the final report, delegates welcomed the successes achieved under the Plan of Action and expressed support for the recommendations put forward in the final report. Several key actions for maintaining elimination status were highlighted, including ensuring universal access to measles and rubella vaccination, combating vaccine hesitancy, developing and maintaining robust disease surveillance systems, and strengthening outbreak response capacity to prevent the re-establishment of endemic transmission. The need to provide ongoing training for immunization personnel was emphasized, as was the need to ensure that sufficient human, financial, and material resources are available to sustain immunization activities for the entire year. Thank you, Madam President. This concludes my report on this item. Thank you very much, distinguished representative of the Executive Committee, for reporting on this item. And now I invite the Directing Council to take note of this report and provide any comments it deems pertinent. I open the floor to the plenary to begin the discussions.
Cedo la palabra.
I give the floor to Honduras. Thank you, Madam President. Honduras agrees with the report on the plan of action for the sustainability of measles, rubella, and congenital rubella syndrome elimination in the Americas 2018-2023 final report and the recommendations to be followed. We urge all to consider the high vulnerability faced by Honduras, its challenges and potential risk conditions, because this is a country of high migratory transit and not optimal coverage. Also, for the fact that it is being assessed as a country of indeterminate, the presence of susceptible challenges in the availability and tapping of financial and human resources. In this regard, we request to be considered as a differentiated approach for the allocation of technical and financial assistance in a continuous fashion, establishing mechanisms in order to monitor and to assess the investment of resources through a strategic alignment of cooperation agencies, ensuring effective communication that will enable us to show flexibility when faced with situations that might change the order of priorities in the application of the components of the expanded immunization program in order to implement the plan of action. Thank you. Thank you very much, Honduras. And now I give the floor to Panama. Thank you, Madam Chair. Panama welcomes the document and shares some recommendations for the same. It is obvious to see the reduction in coverage levels with epidemiological surveillance as well as virological at a global level, multi-factor phenomena related to the COVID-19 pandemic, giving rise to the emergence of anti-vaxxers and the population resistant and hesitant to vaccination. We support the 4 lines of action included in the plan geared to ensuring universal access to vaccination services against measles and rubella to the target population and others at risk age, to improve epidemiological surveillance programs, develop the national capacity and operational capacity to maintain the elimination of measles and rubella, and to establish standard mechanisms in order to provide a rapid response when faced with important cases of measles and rubella, avoiding the re-establishment of endemic transmission. Panama sees with favorable eyes the measures in epidemiological surveillance as follows: to increase its quality based on the rate of reporting suspected cases in at least 2 per 100,000 inhabitants, to keep a high and homogeneous coverage, to have less than 5 indicators that have been a challenge for almost all member states, to strengthen the role of national sustainability committees in order to permanently monitor operational plans and to comply with the recommendations of the international community. The risk analysis has been segregated at the level of the community, which greatly facilitates micro-planning and further reinforces standards in order to provide a rapid response when faced with a suspected imported case, and maintaining a rapid response teams updated in the countries. For Panama, it is vital that we all increase financial investment in order to implement specific actions that will give sustainability to the elimination of measles and rubella, as well as policies in order to reinstatement as a good public means. Thank you. Thank you, Panama. And now we give the floor to Cuba. Thank you very much, Madam President. Our country has been certified with the elimination of measles, rubella, and the congenital rubella syndrome on the strategic line number 1 in order to ensure universal access to vaccination services. we reaffirm that in our country, we comply with this by achieving coverage above 85% in a stable way over time. Regarding strategic line number 2, which is strengthen the capacity of epidemiological surveillance systems, we say that currently we have a surveillance system that covers the entire national territory, complying with the indicators established. In this year, we certified the National Reference Laboratory of the Pedro Cobrí Institute by PAHO authorities. On strategic line action 3, develop national operational capacity to maintain measles and rubella elimination, our committee has presented country reports annually before the Regional Monitoring and Re-Verification Committee for the reinstatement of measles and rubella and the CRS. And last but not least, in connection with strategic line 4, establish standard mechanisms for rapid response to imported cases of these diseases in order to prevent the reestablishment of endemic transmission in the countries. We would like to ratify that in Cuba we have a contingency plan in order to address these cases, imported cases in the country. We have a rapid response teams that are trained and with the necessary resources, financial as human, to face the challenges for the control of outbreaks. Thank you.
Muchas gracias, Cuba. Ahora
Thank you very much, Cuba. Now we give the floor to Guatemala. Thank you very much, Madam President. Guatemala has been part and parcel of the regional initiative to eliminate measles, rubella, and the congenital rubella syndrome. Achievements that were reached in 2016 in the region of the Americas. However, the recent outbreaks in Latin America remind us that surveillance and continual elimination are essential. Guatemala has implemented vaccination campaigns and has achieved immunization coverage that, although significant in some regions in the country, they do not reach the expected coverage of 95%. In spite of these challenges, we've maintained the elimination of endemic measles, and in 2023, no cases have been recorded. In 2023, in the course of 22 and 23, we've strengthened epidemiological surveillance with the development of mitigation plans and workshops to address outbreaks that have included stakeholders of different sectors, including community leaders, social participants, and public health staff, both as well as Social Security and at a central level as well as a local. They've covered the 29 departments that we have in the country. We would like to appeal to all to continue with this discussion that strengthens our actions and ensures a comprehensive and timely response before possible outbreaks. Thank you.
muchas gracias.
Thank you very much, Guatemala. And now we call on Bahamas.
President, the Bahamas welcomes the Comprehensive Progress Report, which highlights both the significant achievements and the challenges faced in maintaining the region's status. While the Americas has been proud to be the only region to have eliminated measles, rubella, and CRS, it is with concern that we acknowledge the loss of measles-free status in 2018. The resurgence of measles across 16 countries, compounded by the challenges posed by the COVID-19 pandemic, underscores the ongoing need for vigilance and coordinated efforts to sustain the elimination of these diseases in the region. The achievement of 5 key targets shows the region's strong commitment to eliminating these diseases. Madam President, in line with the achievement of the plans aimed to maintain high vaccination rates, the Bahamas is aggressively seeking to provide universal access to vaccinations, achieving at least 95% coverage for children under 5, while vaccinating targeted risk groups like women, travelers, and the elderly. Strengthened surveillance, healthcare training, data collection, and monitoring by the national advisory committees will ensure readiness for rapid response to potential outbreaks and strengthen ISAVI reporting. The Bahamas remains committed to implementing recommendations to sustain elimination, recognizing unique challenges faced by small island developing states. Increased investment and expert advice are crucial but may be limited by financial constraints and local adaptation challenges. Regular immunization campaigns and risk analysis are essential, yet logistical, staffing, and data eliminations can hinder their effectiveness. The strengthening of surveillance, lab capacity, and data systems is progressing as we advance multiple health system strengthening initiatives. Ongoing support is essential to overcome barriers and ensure effective implementation of immunization strategies. We thank PAHO for steadfast technical assistance and guidance as we commit to the achievement of this and other elimination initiatives. Thank you.
Muchas gracias.
Thank you very much, Bahamas. Now I call on Jamaica.
Madam President, Jamaica wishes to thank PAHO for providing the report on the plan of action for the sustainability of measles, rubella, and congenital rubella syndrome elimination in the Americas 2018 to 2023. While achievement of 5 targets is commendable, there is concern with respect to ongoing gaps in attaining high and homogeneous vaccination coverage, as well as a high-quality epidemiological surveillance. As vaccine hesitancy continues to affect the demand for vaccines, multi-sectoral collaborations are required to intensify social mobilization, communication and promotion to drive demand generation to achieving desired coverage outcomes. Jamaica urges PAHO to intensify country support for implementing strategies such as risk communication and community engagement to address vaccine hesitancy in the face of a new generation that has not experienced the ravages of measles and rubella outbreaks on our children decades ago. Jamaica has made significant strides in closing the immunization gaps that had worsened due to the negative effects of the COVID-19 pandemic. This we have achieved through the implementation of a national catch-up campaign. While coverage rates for MMR vaccination have improved, there is still work to be done to ensure at least 95% of children under 2 years receive their doses on time. Paper-based information systems have proven to be challenging for efficiency monitoring of population-based vaccination data. Jamaica, with tremendous support from international partners, has now invested in the development and implementation of a national electronic immunization registry. Jamaica welcomes ongoing technical cooperation to strengthen regulatory and policy frameworks, health systems, and targeted interventions. Thank you.
Muchas gracias.
Thank you very much, Jamaica. Now we call on the U.S.
Thank you, Madam President. The United States appreciates the final report of the Plan of Action for the Sustainability of Measles, Rubella, and Congenital Rubella Syndrome Elimination in the Americas. We reaffirm our commitment to eliminating measles, rubella, and congenital rubella syndrome in the Americas and worldwide. We remain concerned about the region's loss of measles-free status, along with the losses in immunization coverage incurred during the COVID-19 pandemic. Strengthening both surveillance for vaccine-preventable diseases and supporting resilient health and immunization systems will be key to maintaining rubella elimination and attaining long-term measles elimination goals amongst the region-wide resurgence. We further note rising vaccine hesitancy and the need for community immunization champions, as well as the need to reinvigorate extensive immunization as a public good. We must work to ensure equitable access to routine childhood immunizations to sustain the elimination of measles, rubella, and congenital rubella syndrome. We urge member states to implement the recommendations of the final report of the Plan of Action to sustain elimination efforts in the region. The U.S. also acknowledges the inherent challenges in sustaining elimination in the aftermath of the COVID-19 pandemic. The U.S. remains committed to the recommendations, including robust outbreak response and efforts to close vaccine coverage gaps, which are documented annually in a report submitted to the Regional Verification Commission. Thank you.
Muchas gracias.
Thank you very much to the U.S. And now we call on Costa Rica. Thank you, Madam President. The country has submitted the Plan of Action for the Sustainability of Measles, Rubella, and Congenital Rubella Syndrome 2018-2023, reviewed by the Regional Committee and accepted for the verification of the elimination in Costa Rica. I do want to share with you some background information because I believe that it is important to say that there are strategic goals in the region, but that if member countries are not able to attain these, it is very difficult to hold them at the level of each country. In 1999, the region, or Costa Rica rather, recorded the last endemic case of measles. In 2019, we had 10 cases of measles in my country, 7 imported and 3 imported, 7 linked to that import. And in 2023, we had 1 case that was not classified as its source. A rubella event for 2001, and in 92, we detected the last case of congenital rubella syndrome in our country. Costa Rica complies mostly with the 4 strategic lines of action as set forth in the plan of action in compliance with the goals of the 2 indicators except for vaccination coverage. Because these initially dropped because of disinformation campaigns and the sequela of what happened with the pandemic. For 2024, we held the extraordinary vaccination campaign for mumps, measles, and rubella for susceptible children. And good news, we improved the vaccination coverage. We reached 90.7% of coverage, complying with high quality and effectiveness and timeliness indicators so as to reach an excellent cutting point by June. Assertive communication, which is giving good results in a target that member states ought to reach so that once again we can reach a strategic goal in the region. We thank the support provided to the local office in order to continue with the push of these strategies in adequate communication. Thank you very much, Costa Rica. And now I call on Dr. Salas Peraza to respond to the comments.
Muchas gracias, señora.
Thank you very much, Madam Chair, and to all countries that shared their comments for this final report. What was stated by Honduras, and it should be mentioned, we've been cooperating with the country in different visits and training workshops in order to raise the capacity of the immunizations program. And it is extremely important to continue working, in particular on the micro-planning methodology to deal with these areas that we know have been left with debts for some years in order to achieve higher coverage. But for that, we are precisely present in order to continue with that support from the country office and the regional support. Panama, that mentioned the importance of a reduction in indicators in such an extreme context as we had in the pandemic, the COVID-19 pandemic, that affected all regions of the world. But it is also important to stress that at a regional level, we've seen an increase in the last 2 years. However, and several countries brought this up, mentioning the importance of having homogeneous indicators, standardized indicators, because one of the indicators that had been considered in this plan was that 80% of the municipalities were to reach at least 95% in coverage, and it was precisely the indicator that was less met that had a lower performance. So we have to be very careful with having the stratification, internal stratification of risk, have tools such as micro-planning, continue to implement the electronic nominal registry so that we can easily find where we find those that are under-vaccinated or unvaccinated. Cuba, let me commend you for the efforts achieved in strengthening or redoubling the 4 strategic lines of action. We know that you will continue to work in a responsible way in order to strengthen these. Guatemala, the importance of the campaign that you've been deploying, and that we also see the need for undertaking all necessary actions in order to strengthen epidemiological surveillance, because we know that this is a combination. We cannot neglect surveillance and to think exclusively of vaccination. Just imagine that in 2024, we already have reported in the Americas 365 cases of measles. And we have, comparing with the 2023, we had 64, barely 64. So you can see the huge difference. And it is true that most of the cases have appeared in Canada and the US. However, we see that this affects everyone equally. So epidemiological surveillance is very important. We need rapid response teams, and communication through the international health regulations is extremely important.
It is very important what you mentioned about the risk analysis, and we consider this a key component of every action that we can take in terms of reinforcing or strengthening the national immunization programs, as well as the surveillance systems. Jamaica, it is important to mention that we're going to have in St. Kitts and Nevis the last week of this month, the EPI managers meeting, and there we're going to have a workshop of communication, of risk communication, where we're going to review some of the most important remarks that we should consider when strengthening this component that is key, actually, to work in this area. To USA, I agree with all your considerations. It is key to have equitable access for immunization. So it's important for all the countries to continue working on strengthening that area so that we can have access throughout all the region, but internally in all the regions of a country. And it is important also to strengthen that timely report through the international health regulations, as well as I mentioned. And Costa Rica, el plan de acción que usted mencionó, señora ministra, muchos de los
important that many of the indicators have been met. We understand about coverage, but we realize you've made a significant effort to recover there. And we also congratulate you for the excellent performance in the follow-up campaign that was just completed and the quick coverage monitoring you've done recently. Oh, and I forgot. I'd like to also mention that this plan, even though it invites others to continue with the 4 lines of work, we also have the regional plan on immunization from the resolution that was adopted here in 2021 to revitalize immunization as a public good for universal health purposes. That plan of action includes 6 strategic lines, 26 objectives, and 37 indicators. And of those 37 indicators, there are 15 that provide continuity to the work done on chickenpox, rubella, and congenital rubella. So now we don't just vaccinate against measles or rubella. We need to consider that we have that challenge of implementing that plan and that all countries participated in drafting that plan. So we're going to begin implementing it soon. We do have, therefore, a proper framework for meeting our goals for 2030. Thank you very much, Dr. Salas Peraza, for responding to those comments. I'd like to inform the Council that the discussion will be reflected in the final report. I move on to the next item. Item 8.7, Plan of Action for Strengthening Information Systems for Health 2019-2023. Final report. I'd like to bring document CD 61 Inf 7 to the attention of the Council and invite Dr. Sebastián García Saizó, Director of the Department of Evidence and Intelligence for Action in Health of the Pan American Sanitary Bureau, to come to the head table. Thank you, Doc. I now yield the floor to the representative of the Executive Committee to report on this item. Thank you very much, Madam Chair. The Executive Committee was informed that 18 of the 22 targets of the Plan of Action had been met or exceeded, with significant advances made in terms of establishment of governance mechanisms, the introduction of standards on the information sharing, and the creation of networks to facilitate the adoption of innovative digital health systems. The committee also was informed that the lessons learned and the actions needed to improve the situation have been incorporated into the new Plan of Action for Strengthening Information Systems for Health for the period 2024-2030, adopted this week by the Directing Council. Thank you, Madam Chair. This concludes my report on this item. Thank you very much, Representative of the Executive Committee. I now invite the Directing Council to take note of the present report and make the relevant comments. I call on the plenary to start the debate. I call on Brazil. Thank you very much, Madam Chair. Brazil would like to express appreciation for the report provided on the Plan of Action for Strengthening Information Systems for Health 2019-2023. We are very interested in continuing with the regional cooperation and have interoperable platforms available, as well as a data architecture, interoperable data infrastructure for countries. The information for health systems is based very much on this. So the implementation of a broad digital program through the internet with cybersecurity in the area of health would be very important, since the data security system was set up in the Brazilian Secretariat of Health. We now have better records and much better control and governance of information since that security system was set up. We have been using this to evaluate the data from municipalities. This information will be crucial when we provide completely digitized medical information in Brazil. Paraguay. Thank you very much, Madam Chair. Paraguay is grateful for the final report CF-7, which highlights the importance of comprehensive modernization of information systems, which not only guarantees access to information, but sets the basis for the efficient and effective use of health information. In my country, within the framework of implementing the digital agenda that includes 4 of the pillars of the plan of action, we have made significant progress as improving connectivity, digital governance, digital economy, and institutional strengthening. We've made significant progress in implementing real-time data information system. Our Ministry of Health is at the moment implementing a health information system, HIS, which collects hospitalization information. The goal is that all health facilities have connectivity. To facilitate this implementation, we have set up an interinstitutional committee for the management of technological information and communication. One of the goals is to organize and document this and convene representatives from other ministries, public health, social well-being, and other public and private entities to participate in the development for better performance. In November 2023, under the Ministry of Health, Paraguay presented its progress in implementing information systems at the meeting, that American meeting on strengthening information systems. And we highlighted information systems based on interoperable standards, such as the exchange of vaccination certificates proposed by PAHO. We acknowledge the importance of strengthening information systems, not only as a tool to ensure better access to information, but also as a basis for efficient management of health data. Thank you. Thank you, Paraguay. I now call on the Bahamas.
Thank you, Madam President. Having begun an 18-month journey to undertake the maturity model matrix assessment in November 2020, the Bahamas can attest to the dedication and support that PAHO invested in ensuring that member states had the necessary tools and guidance to conduct an assessment of the maturity of health information systems. The Bahamas' process involved broadened country stakeholder consultation and facilitated the formation of a national IS4H steering committee that continues to meet monthly 5 years later. The plan of action that emanated from the Matrix report provided both a roadmap for early funding proposals to the Inter-American Development Bank and additional guidance to the implementation of health information systems in the otherwise ICT-naive public primary health sector. To date, in following the recommendations in the IS4H plan of action for the Bahamas, the health ICT infrastructure now boasts on fiber optic connectivity to just under 40 health facilities across the archipelago. More than $250,000 has been invested in computer hardware, a new ICT team of almost 20 experts with expertise in training, behavior change, program writing, program administration, public relations, and legal affairs has been convened, and public awareness activities are executed through various social media platforms like LinkedIn, X, Facebook, and WhatsApp, with the first webinar for IS4H planned in 2 weeks. The Bahamas expresses its profound thanks to PAHO for early funding to bridge the gap between the completion of the maturity model matrix and access to funding through the IDB loan program. We also express heartfelt congratulations to the PAHO team of ICT consultants for their unwavering work in implementing the 2019-2023 IS4H Plan of Action in pursuit of a digitized health sector in the region. We look forward to the support forecasted through the new IS4H Plan of Action. Thank you.
Muchas gracias, Bahamas.
Thank you, Bahamas. I now call on Honduras. Thank you, Madam Chair. Honduras, thanks you for the document. CD 61/7. We grateful for this program to strengthen information systems for health. This report underscores the importance of consolidated health information systems as a basic component of effective and quality health care in our region. The analysis of regional progress reveals significant accomplishments in areas such as the adoption of interoperable standards and the implementation of governance mechanisms in many member states. However, we still have challenges to address which affect countries that have less technological and infrastructure capacity, such as Honduras. For these countries, any progress in digital health are limited still because of structural challenges that require sustained technical support. Honduras, as a small and vulnerable country, recognizes the urgent need to continue strengthening regional cooperation under the principles of solidarity and Pan-Americanism. The improvement of information systems in the area of health should be a shared responsibility by all member states, because we realize that the success of the region depends on collective strengthening. Honduras appeals to member states who are donors to prioritize programs through PAHO to support developing countries and help them in their effort to improve digital literacy. Thank you. Thank you, Honduras. I now call on Costa Rica. Thank you, Madam Chair. To implement the transformation systems under the Ministry of Health and the support of public or private actors has been a priority in our government. In document ES4, Costa Rica has received a grade of 3 of 5 points because when the form was filled out, there still was no interoperability. But last week, we started doing that, so we went up a few more points. Costa Rica is very happy with the great jump made at the ministry because of this. Now we have transformation digital health. To put in a minister that was an engineer was a great change. I recommend that. As we have a decree as digital health, digital prescription of antimicrobials, psychotropics and stupefactions with the private sector, and the main advances in interoperability with standard guidelines. SH7 HRER has meant that we have obtained excellent dengue data, and I hope that makes a difference in decision making. Together with this, we obviously need to have a standardized vaccination registry, and we hope that very soon we'll be able to show you that. Our country's expectation is not only to grow in all these areas, but to reach level 4 over time and maintain it, and the possibility even of reaching level 5. But to share this know-how with the rest of the region is excellent. But once it's to be interoperable ourselves, imagine how wonderful it would be to be interoperable amongst countries to help the transit migratory population. I think it's a dream that could become reality. So I invite you that in November we'll be launching the digital methodology so that you can see with your own eyes everything that we have done. Thank you very much, Pajo, for your support. Thank you.
Ahora ofrezco el uso.
Thank you, Costa Rica. I now call on Dr. Garcia Seiso to respond to these comments. Thank you, Madam Chair. I'd like to begin with extending a deep gratitude to all member states for having participated in this initiative to join this Plan of Action 2019-2024, which will be closing its cycle and which no doubt served as the basis for laying out a roadmap for our region. It's a plan of action that in less than a year was implemented and dealt with significant challenges that we have heard through the many reports presented and occurred during the COVID-19 pandemic, which far from setting back the process, it has moved us forward. It has made us relevant amongst the priority agendas of our countries. And of course, Pajo has also increased its technical support and the implementation of this effort. One of the milestones noted in the report at the conclusion of the plan, which you have referred to in your comments, is that we have this analysis of the maturity of information systems for health in our region. This means that we are the first region worldwide where we have more than 200 standardized indicators that gives us a vision of what are the needs of the information systems in each national context. I'd also highlight that this information is not for the purpose of positioning different countries in their development level, but rather to lay out a specific roadmap to focus on those elements that are priorities in strengthening information systems. And of course, in this cycle, from the lessons that we've learned jointly, it helps us lay the foundation for the 2024-2030 Plan of Action that was adopted yesterday at this forum. Amongst the lessons we can learn from this period, some of you have already highlighted this. It's the importance of having solid governance mechanisms, updated systems that allow us to improve the information, interoperability, which we've heard all countries mention as a priority, and the standardization of information systems as key elements of digital transformation in a much broader context. Also, the fact that this is not something that has to occur in a vacuum. Instead, we need the support of other sectors. I highlight, for instance, the academic sector, as well as the public and the private sector, also international partners, beyond those that we achieve on an individual basis. I also understand the importance of focusing our attention on users and on having equity be a constant factor in any progress made. Also, we must ensure that technology and information systems are accessible and benefit all populations, with particular emphasis on the most vulnerable. Looking forward, of course, we have to continue with our multi-sectoral approach. That's one of the priorities reflected in our new plan of action. Also, the interdisciplinary focus in adopting international standards on the management of data on interoperable platforms, and they should be seen as public goods, and also as elements that will strengthen our new plan of action. The technological infrastructure that has been mentioned as a major issue is also one of the lessons we learned. How do we strengthen it? And how, from that perspective, we then set up protocols that allow us to improve privacy as well as data safety and security, which are data that's available through these systems. And finally, the evaluation and development of data architecture that includes emerging technologies such as AI, that allows us to do more with the data we collect and with the strength that we have achieved jointly through our information systems. that this become part of our national strategies so that we can strengthen public health and promote universal access and improve our health services. Once again, I'd like to thank each and every one of those who have commented at this forum, and we continue with our commitment to continue strengthening information systems and provide technical cooperation from the Pan American Health Organization. Thank you very much. Thank you, Dr. Garcia Saiso, for responding to these comments. Madam Assistant Director, would you like to make a comment?
To say thanks to all the countries who have contributed to the success that we've seen in the assessments that we have done. I wasn't going to take the floor, but after hearing all 5 countries, ending with Costa Rica, I wanted to say that we have come a long way in terms of information systems within our region. And Delegate from Costa Rica, you said one of the things you want, and it's possibly a dream for us to be able to communicate between countries. And I think with the migration, the fact that many persons seek care in other countries, the fact that we have health workers that may have to move between countries, I think it's a dream, yes, and I think it's something that we can accomplish and it's something that we can work towards. We have reached a significant milestone, I think, in terms of information systems within our region, and I think little by little we can get there. So thanks to all of you for the work we've done, but the work is not finished, and PAHO is here to work with you to take all the countries in the region to the next step. Thank you.
Muchísimas gracias.
Thank you very much, Dr. Thomas, for your comments. I'd like to report to the Council that the discussions will be noted in the final report. I think we have come to the conclusion of today's session. Tomorrow we start at 9 a.m. on the dot to continue with items 8.8, 8.9, 8.10, 8.11, and the adjournment of the session. I hope you have a restful evening, and we'll see you tomorrow morning.